Good morning, boss.
Right.
अब उसको ऊंची दौड़ को आप खराब हो रही है।
We will be starting with the
Good
program
morning.
now.
Shraddha ji, good morning.
I request all the participants to kindly unmute yourself.
हाँ सी दुकान
We started with our program now.
वापस हो गया मैं तो
Good morning, everyone. Welcome to Online National E-Poster Competition 2024-2025 on evidence-based research in homeopathy, bridging science and art. We are glad to have you with us today for this exciting event where participants. I think there's some technical issue. Give me 1 second.
लाग ऑटोमेटिक दे रही है
We are glad to have you with us today for this exciting event where participants will present posters highlighting various research studies and clinical trials that will provide data on efficacy of homeopathic remedies. I am Dr. Kanika Agarwal, Assistant Professor, Swasthya Kalyan, Homeopathic Medical College and Research Center, your MC for today. Here's how today's competition will work. We will begin by hearing from shortlisted candidates from each category. Firstly, undergraduate research studies, followed by postgraduate research studies. Presentation time would be 10 minutes, including 1 minute for presentation setup and introduction of participants, 7 minutes for presentation, and 2 minutes for question and answer session. Presenters, kindly note that time exceeding would not be allowed. Judges panel will have the authority to cut the marks on exceeding the time. Moving ahead, I request Dr. Yogeshwari Gupta ma'am, Principal, Swasthya Kalyan, Homeopathic Medical College and Research Center, to welcome and introduce our judges and start the competition.
Good morning. Good morning, everyone. Dignitaries on this platform, our CEO, C.A. Shraddha Agarwal, our Director, Dr. Pankaj Sharma ji, judges, Dr. M.K. Sahni, Dr. Renu Mittal, Dr. B.T. Roy, and all the participants, our organizing team, Dr. Swarupa, Dr. Kanika, attendees, all my faculty members, it gives me immense pleasure to welcome all of you to the online national e-poster competition organized by our college, Kalyan Homeopathic Medical College and Research Center, under the theme Evidence-Based Research in Homeopathy, Bridging Science and Art. We have among us Dr. M.K. Sahani. He is associated with the GD Memorial Homeopathic Medical College Hospital, Chairman, Institute of Science, Drug Transmission and Homeopathy, President, Homeopathic Congress Society, Dr. Sahani had elected as member of Central Council of Homeopathy, where he served as chairman of Education Committee and contributed to develop academic curriculum. We have among us another judge, Dr. B.T. Roy. She is presently working as homeopathy consultant at National Commission of Homeopathy. She is former associate in Jyoti Vidyapeeth Women's University and former assistant professor in our college, Swastika Kalyan Homeopathic Medical College and Research Center. Third guest, welcome Dr. Neil Mittal, currently working as scientist level 4 and administration in charge at CCRH headquarters. She is instrumental in developing public health programs undertaken by CCRH apart from different clinical research projects. She has more than 50 publications in peer-reviewed journal, presented many papers in national and international conferences. To her credit are many drug monographs and book chapters. Our CEO, Shraddha Agrawal, she is dynamic CEO of Swastika Kalyan Group, leading organizations with a vision to create a culture excellence in education, healthcare, image consultant, soft skill trainer. She served as vice chairperson of Indian Women Network Rajasthan chapter, dedicated to empowering women professionals through skill building mentorship. I welcome you, ma'am. Today, we are here not just to share ideas, but to shape our future of our homeopathic research. Evidence based research plays a pivotal role in validating homeopathic practice, bridging the gap between traditional wisdom and modern scientific understanding. This is a unique platform where we bring together bright minds, passionate researchers, and dedicated professionals to engage in meaningful dialogue and exchange knowledge. Through this competition, we hope to encourage you to present your creative insights and innovative contributions that contribute to the greater body of the knowledge in this field. Now, for a moment, I want to let you know about our college. Swastika Kalyan Homeopathic Medical College was established in 2002 under Puranmal Phula Devi Trust and inaugurated by Lal Krishna Advani ji and Dr. S.S. Agrawal ji. Dr. S.S. Agrawal ji is our chairman of this group. He is president in AIMS Jodhpur now and former national president of Indian Medical Association. Our vision is to provide sustainable, affordable, quality education and medical services. And mission is to enrich the life of people by providing skilled training, quality healthcare services. The college was started with 60 BHMS seats. Now we are only in Rajasthan. We have MD in 7 branches and PhD in 3 branches. Again, I would like to extend a warm welcome to all participants, judges, attendees. Your involvement, enthusiasm are what makes this event truly special. We look forward to witnessing the incredible posters that reflect the hard work, dedication, and research that you have invested in this field. Thank you for joining us, and we wish all the participants the very best in their presentations. Thank you, Kanika. Over to Kanika.
Thank you so much, ma'am. Moving ahead, we will be starting with our presentations for the UG category. I will be sharing all the posters from my end. Presenters of the UG category, please be ready.
Ma'am. Hi, Kanika. Before you begin, can I just say a few words?
Yes, definitely, ma'am.
Yes, okay. Good morning, everyone. I'm not going to take much of your time. I am Shraddha Agarwal, CEO Swastika Kalyan Group. Very, very happy to be attending this. This is our first nationally poster competition, which we have organized. Not we, I wouldn't say we, which the homeopathy team under the guidance of the principal ma'am Yogeshwari ji, Pankaj sir, and Dr. Kanika and the entire team. So I wish them all the best. They have put in a lot of effort to get this done, and it's going to be great. It's a new beginning, and everyone present here, I just want to congratulate here, because you are part of a new beginning. Like, whenever something happens for the first time and you are part of it, it is such a happy feeling, right? So thank you all for being part of it. I would also like to take a minute to thank our judges, Dr. Sahane. I'm not sure if Dr. Mittal and Dr. Roy are here, because I cannot see them. But thank you so much, from logging in from wherever you are, and spending time with the students to kind of see how they're going to be presenting today. So thank you so much for your time. Also, to all the participants who are participating today, I wish you all the best. I think वो कहते हैं ना, it's not the destination. जब अपन plan करते हैं कि अपन we are going to go to Manali for vacation, it is not going to Manali which is the happy, it is the journey which brings you a lot of joy. The planning, the packing, thinking कि क्या करेंगे, the shopping and everything. So I hope you enjoy this journey. You have fun today. You learn a lot from each other. And I hope it's an inspiration for you all to do better and to do much more in life. So I wish you all the very best. Have a great, great, great time doing this. Thank you. Over to you, Kanika.
That is not me, right?
Kanika, you're on mute.
Thank you so much, Shraddha ma'am, for your inspiring words. We are now starting with our competition. I will be sharing the slides from my end. I request all the participants to kindly turn on your video while you are presenting the poster. Our first presenter for today is just a second. Our first presenter for today is Arpi Hetal. She is from DS Homeopathic Medical College, Pune. Arpi, kindly unmute yourself.
Hello. Ma'am, I wanted to ask you that if I can please share my screen, as there are few minute changes in the PPT of mine.
Sorry, Arpi, you cannot share now. We have already
Hello.
taken the entries and we are not allowing the end only.
Okay, ma'am. Okay.
Okay. Are you ready?
Yes, ma'am.
Okay, we will be starting your presentation.
Hello, and a very good morning to one and all. Why find solution for dysmenorrhea when ignoring it has worked so well for centuries? My name is Arpi Barot from Dhondu Mama Sathe Homeopathic Medical College, Pune, a final year student. Being a girl is often a boon or a bane. Trust me, I know. It comes with a package of societal norms, of rules and regulations. What if I tell you you are quarantined for next 3 days? Now, imagine being shut down or being quarantined for 3 to 5 days every month. I know you can't even think about it. Just like that, the onset of menarche in the females is often associated with many gynecological complaints, commonest being dysmenorrhea. My study aims to evaluate the effectiveness of individualized homeopathic treatment in improving the working ability of unmarried females suffering from moderate to severe dysmenorrhea using a valid score, a quasi experimental study. Pain in any form is unpleasant and debilitating. Primary dysmenorrhea, though being such a high prevalent, remains underdiagnosed, inadequately treated, or even overlooked condition. Research shows that 45 to 95% of females globally and 75% of females in India suffers with dysmenorrhea. Shockingly, 1 out of 3 females suffers from the periods so much that they often leads to absenteeism from school or work, social withdrawal, and reduced quality of life. Despite of its high prevalence, it is often considered as an embarrassment and a social taboo due to lack of awareness, driving many women to suffer silently. The first line of treatment often includes the over-the-counter NSAIDs, which may provide a temporary relief, but it may come with few side effects. And its frequent use can even lead to dependency. Homeopathic's individual approach targets the underlying BPS factors and hereby promoting a tailor-made, holistic, and a comprehensive cure that reduces both the intensity and the frequency of the pain. Coming to the objective of my study, to study the efficacy of the individualized homeopathic medicine in improving the working ability in unmarried females suffering from moderate to severe primary dysmenorrhea. Coming to the methodology, study design and setting was an experimental, uncontrolled CAUSE study conducted in NM Ranade Hospital from March 2022 to November 2023. Sampling was a convenient sampling. The data collection tool was a standardized homeopathic case paper and a valid score tool for assessing the severity of dysmenorrhea. The sample size was of 30 females aged from 19 to 30 years. Treatment was individualized homeopathic remedies. The assessment was pre and post valid scores were compared using Excel sheets by pie diagrams, graphs, and etc. So let me give you some more insights to the tool. The Valid Score is a comprehensive, non-invasive tool developed to assess the severity of primary dysmenorrhea and predicts its impact on the daily activities. So Valid Score itself is an acronym, WA for the working ability, L for the location, I for the intensity, and D for the days of the pain. So these were the four factors on which the questionnaire of the tool was designed. The score of the tool was ranging from 1 to 12, where 1 to 4 scored to mild, 5 to 7 scored to moderate, and 8 to 12 served as a severe dysmenorrhea. Now, coming to the results of the study, I would like to say that we included 11 moderate and 19 severe cases before the treatment in the study. And after the treatment, we can see that there was a significant reduction in the number, showing only 2 severe cases, 12 moderate and 12 mild cases, which means that homeopathy acted so well that the severe cases decreased from 19 to 2, and the people significantly shifted to the mild cases. Well, this PPT do not include the statistics, but I would like to share the statistics of my study. So, coming to the mean valid score for the pre and the post treatment, the pre-mean score was 10.9 plus or minus 0.4. Post was 6.3 plus or minus 3.5. So the difference between the mean gave the p-value less than 0.001. All this shows that homeopathy significantly reduced the severity of dysmenorrhea. Now coming to the remedies used, the remedies used were Macphos, Cilicia, colocynth, natrimur, thuja, pulsatilla, phosphorus, sepia, and bovista. The most commonly used medicine in the study was Macphos, pulsatilla, thuja. Before coming to an end, I would like to say that addressing primary dysmenorrhea, not only medically, but also its societal aspect surrounding the mental health is very important for its recognition, diagnosis, and the management. This study highlights that individualized homeopathic medicine is highly effective in reducing the pain of the female and improving the working ability that increase their performance in daily activities by
1 minute
focusing
left.
on the sorry.
Kindly continue. Only 1 minute is left.
Right. So this study serves a crucial step towards revolutionizing the way we manage dysmenorrhea And all I want to say, if it works so efficiently on a smaller group, just imagine on a larger group with a controlled study, what change can we make? Thank you very much.
Thank you, Arpit, for the wonderful presentation. We will be moving ahead for the question and answer round with our judges. Our first judge, Dr. M.K. Sahani, sir. Any questions, sir?
Seems to be very nice presentation. Topic is also good. Uh, uh, RP, can you tell me what was the criteria that what you thought about the mental symptoms in this in your study?
Mental symptoms, so sir, we took an individualized homeopathic case. So there were no specific mind questions that we took. So we took all the females moderate to ranging from moderate to severe dysmenorrhea based on the valid score. They were called into OPTs and a personalized case was taken.
You have not included the mental symptoms?
No, sir, we have.
Okay. And what was your criteria for judging out the medicines? You have
Right.
personalized the case, or it was a therapeutic based, the magnesium, some medicines you have mentioned?
Right, sir. So I will like to explain the data collection. So we took the females individual case, and all the female, mostly the 80% of the female came in active stage. So I would like to say that we took the totality of the case. We took a detailed history. We formed the totality, and on the totality, a simillimum was given. And as females were mostly in the active stage, the MACPHUS was used, sir.
No, my question was that how you arrived at the simillimum?
So, sir, we formed the totality, and based on the totality, we prescribed a remedy, its potency, and its repetition.
You have utilized the repertorial approach or only the therapeutics approach of the medicines?
So, therapeutical approach.
Okay, so no repertorial approach. So you cannot say that definitely that these medicines are traditionally that they are used magnesia phos, not as individualized.
Sir, it is individualized because later when females came for the follow-up studies, we later gave them the constitutional remedy. Females who gave an active stage were much better with MACPHOS, and
So
later we gave
let me ask you, the first medicines that you gave was the magnesia phos, and then
yes.
you went to the constitutional medicines. Yeah.
Right,
so
right.
That means in a patient you have prescribed after the magnesia phos to reduce the intensity, and then you went to yeah, this is the way. Okay.
Yes.
So changing over the constitutions is also important. Nah? So
yes.
I just suggest that in future you should think about the including the repertorial criteria also. So your presentation is nice. I appreciate you.
Thank you, sir. Thank you.
Thank you, sir. Dr. Renu Mittal, ma'am. Any questions, ma'am? Dr. Renu Mittal, ma'am.
I don't think I think she's not here.
Yes, sir. Dr. B.T. Roy, ma'am. Any questions, ma'am? B.T. Roy, ma'am.
Hello.
Yes.
Yes, ma'am.
No, actually, what sir was saying, it is very much correct that constitutional and acute remedy. Like I guess MACPHOS was acted as taken as a acute remedy over here, and then followed by the other CPR, FOS, Pulse, Thuja as a constitutional remedy. Is it like that?
Yes, ma'am. Yes.
Okay. No more questions. Thank you.
Thank you, ma'am. Thank you. I'm glad to be a presenter here. Thank you so much.
Thank you so much, Arpi.
Thank you.
Moving to our next presenter. It's not, slide is not working. Just a second. I will be resharing. Just a second. We have with us our next presenter, Jaidev Pisha from Pioneer Homeopathic Medical College. Jaidev, kindly unmute yourself. Jaidev,
Yes, ma'am.
yeah, kindly unmute yourself and kindly start your video.
It's on, ma'am.
Okay, are you ready?
Yes.
Okay, we will kindly start your presentation now.
Good morning, all the respected dignitaries and everyone present here. Myself, Jaidev Shah from Pioneer Homeopathic Medical College, and I am a fourth BHMS or final year student. And I am here to share my experience on the topic of effectiveness of arnica in dental surgery. As we know, the basic physiological action of arnica is in reducing the swelling or anti-inflammatory actions on local muscles, and it also has its basic action on blood vessels. It reduces the swelling, and it also help in the hemorrhagic conditions or post-operative pains. Now, how do I get on this idea for dental surgery or to opt arnica in dental surgery? Once I and my family dentist, Dr. Arpit Mehta, was discussing about some dental complaints, and he resembles our medicine arnica with the complaint he had in his patients, like hemorrhagic conditions or any pain symptoms. So both were agree on our research work on this system. So he allowed or kindly allowed me to opt this research on arnica in his personal clinic. So are now moving further on our aims and objectives. We start our main objective in our this research work is we opt on three main points, that is pain, hemorrhage, and healing process in the dental surgery. All the patient or dental patient have main two problems, that is hemorrhage and pain. Now moving towards the methodology, we opt for 30 cases from which we worked upon 15 cases, and we have some inclusion and exclusion criteria. Like we included that we work under the dental problems under the guidance of our doctor dentist, and we excluded that some chronic illness or conditions like diabetes, hypertension, patient having these symptoms are avoided. And administration of the medicine, we administered 3 doses, one before surgery, one on the day of surgery, and third after the surgery. And we administered arnica 1 m potency. Now moving further on our result, we divided or we analyzes the patient in the different criteria. First, moving over towards the disease, we have 1 case of periodontitis, 3 cases of dental caries, 1 case of fractured tooth, 1 case on impact on wisdom tooth, 2 cases of buccal impact or upper third molar, 4 cases of periapical abscess, 1 case of tooth stamp, and 1 case of irregular pulpitis. And among all the patient, we have 3 male patient and 12 female patient. We further divided the age criteria in 4 categories: 20 to 30 years, 30 to 40 years, 40 to 50 years, and 50 to 60 years. Almost all the main cases are from 50 to 60 years of the patient. Moving further to the criteria of surgery, we have extraction, implant, and conservative management. We mostly get the most number of cases from the extraction, then implant and conservative management. Moving further towards the observation, we observe the 3 things in patient: pain, healing, and hemorrhage, and we assess them in 3 points. One for good remark, second for average, and third for poor remarks. We observe or we conclude that On the first day, we get good result in 5 patient, on third day, we get good result in 3 patient in pain. We get good result in 10 patient on first day in healing and 14 patient in third day in healing and 11 patient on first day in hemorrhage and 14 patient on third day in hemorrhage. Thank you.
Thank you, Jaidev. We will be moving with our question answer round now. Dr.
Hey,
M.K. Sahani, sir.
yeah, Jadhav, you have tried to explain very well. It's good. But can you let me know again the same questions like that? How you decide, what medicines you have included and how you decided over that?
Sir, I have included a medicine of arnica. Firstly, we start with 2 medicine, arnica and hyperica. But
Okay,
our family,
this is only the case study through the arnica cases only. You want?
yes, sir.
Yeah, you try to explain. And what type of which potency you have used?
1M potency, sir.
1M potency. Why you have
Yes.
selected 1M potency? What was the reason for? Because you have the 3 categories that you have taken: extraction, implant, and conservative management. So 3 aspects you have included in your criteria. So why you have chosen only 1M for the extraction and the implant and the same all the 3 types?
Sir, it is highly acute potency.
That I understand. That I understand. But intensity seems to be different in the implant and all the 3 categories. So you have not made judgment about the. You simply use that 1M potency. This is true, na?
Yes, sir.
Yeah. So no. It's but and your result was you have said that it is healing was good. So arnica has worked well. And
Yes, sir.
how you feel that it is the curative aspects or only the palliative aspects?
Sir, I have a review of my own dentist who told about or comment about this in his patients.
So you have taken the advice of your dentist.
Yes, sir.
So good, very nice presentations. Thank you very much from my side.
Thank you, sir.
Hello,
Yes, ma'am.
Jaidev. Congratulations, a very nice presentation. I would like to ask, have you done any investigation to verify the pre and post results of Arnica on the dental surgery?
No, ma'am, it's only on symptoms and I'm
Symptoms.
under the guidance of our dentist. We had done this clinical research.
Don't you think so? We need to have investigations to prove it more that, okay, before dental surgery means extraction or hemorrhage or whatever was the condition before and what was the condition after giving the Arnica to give it more evidence based, like instead of basing on only on the symptoms.
Yes, ma'am, it's necessary. I will try to improve it next time.
Okay.
Hello.
Yes, ma'am.
Jaidev, I would like to ask you, why didn't you selected the outcome scales? Like for pain management, we have the VAS scale, and for the healing and the hemorrhage also. We have now to give the objectivity, and we are talking about evidence base. Why didn't you selected some of the scales for as outcome parameters for your study? Are you able to hear me?
Yes, ma'am.
Yeah, please answer.
It's a subjective study, it's specific.
But for the evidence-based study, we always need objective parameters, right? Because subjectivity gives a chance of prejudice for the physician. Nowadays, when we talk about the evidence-based medicine, there should be objective parameters on the basis of which we can evaluate the effectiveness or efficacy of any of the homeopathic drugs before the treatment and after the treatment.
Ma'am, we have this assessment score.
Which score? You have used good, better, improvement like this one, na? You have
Yes,
categorized. But
yes.
this is not a validated scale. No? This is the scale and we used to do earlier 10 years, 15 years back from now. If it is 100% improvement is then it is 100%, then 50 to 75%, 75 to 100%, yeah, less than 50%. That was subjective scales. I'm asking about any objective scale because for nowadays, for categorizing the type of hemorrhage and the pain scales, like the visual analogous scale, the NRS scale, these are the scales which are used as objective parameters, which gives the strength to the study also.
Yes, ma'am, we will try to improve it next time.
Okay, now, but in this you haven't included any of the that scales, right?
Yes,
Okay, okay, Jada. Thank you.
thank you.
Thank you, Jaidev.
Thank you.
We will be moving to our next presenter, Tina Jangir from YPSM Homeopathic Medical College and Hospital, Alwar. Tina, kindly unmute yourself.
Yes, ma'am.
I request everyone to kindly mute yourself.
May I start, ma'am?
Yeah, Tina, you are ready? Yes, you can start. Your time starts now.
A very good morning to all. I am Tina Jangid from YPSM College, Alwar, BHMS intern. So my study is a prospective observational study to evaluate the effectiveness of homeopathy autoimmune disease, psoriasis. A prospective study means study looks forwards in time, following participants the point of study initiation. It means from start of the study and track their health over a time. So it starts from the introduction. Psoriasis is a chronic immune-mediated skin disorder affecting millions worldwide, leading to physical discomfort and psychological distress. The disease has a chronic remission and exacerbation-prone trajectory. Psoriasis is recognized a major non-communicable disease in the World Health Assembly decisions WHO 27th Assembly on 24 May 2014. There are problem statements along with that complications, psoriatic arthritis, increased risk of cardiovascular disease, metabolic syndromes, skin infections, liver disease, complications, which further affects the patient's quality of life. There is a huge variations in the line of management provided by health sector. There is a deficient exact prevalence in data not available. Sufficient data is not available, but in northern India, its range is between 0.44 and 2.8%. There is my research question, my observational study. My research question is that can homeopathy treatment produce any significant change in psoriasis as measured by psoriasis area and severity index? Now, there is not the exact evidence-based study in Rajasthan. So my aim and object to evaluate the effectiveness and the impact of homeopathy treatment in managing autoimmune disease. Psoriasis based on changes in PSI scales within the period of 6 months. To achieve my aim is to assess the impact of homeopathy remedies on clinical presentation of psoriasis, to evaluate the patient report outcomes, such as symptom severity, pain, itching, based on PDI scales in pre and post treatment with homeopathy. To monitor their profile, homeopathic treatments, noting any adverse reaction or side effects observed during the study period, and to explore the patient satisfaction by DQLI. So my materials and methods are methodology. My study design is prospective observational study, cases from IPD and OPD centers attached to the institute. My study period is 12 months, and sample size is 30. 30 is a standard number to study. My inclusion criteria is male and female patient in any age group presenting with sign and symptoms of psoriasis. Exclusion criteria is pregnant and lactating women's mental retardation illness suffering from other autoimmune disease. My primary outcome measured by psoriasis area and severity index, and secondary outcome measured by dermatology life quality index and psoriasis disability index PDI. Data collections and statistical analysis. It is measured by NOVA and chi-square. This is a statistical test for measure this. The outcome will be assigned initially at the baseline at every 2 up to 6 months, again at 6 months in my spreadsheet. Every included patient will reach the final statistical analysis irrespective of dropout, intention to treat. After completion of this study, the data obtained at baseline and 3rd month and at 6th month will be analyzed using different statistical method. The change in PSI score, PDI scale, DQLI score of the patient before and after treatment will be compared to find out the statistical significance. So there is a justification of study ki as a scarcity of research evidences and population of Rajasthan, lack of studies and intervention for psoriasis, evaluating efficiency of said intervention may help to evolving homeopathic treatments strategies in psoriasis. As per discussion, there are 2 articles mentioned here, in which article says that the homeopathic treatment shows a reduction in psoriasis severity, and participants reported improved quality of life and symptoms relief like itching, scaling, redness. So the conclusion is that by assessing changes in PSI and PDI DLQI scores, the study will provide insights into the potential benefits of homeopathy for psoriasis patients. The finding will contribute to the limited research on homeopathic intervention for psoriasis, particularly in Rajasthan population, and may inform future treatment strategies. And my aim is that कि राजस्थान बेस अभी राजस्थान की प्रेवलेंस में इतना स्टैटिस्टिकल डाटा नहीं है, तो मुझे मेरी स्टडी राजस्थान बेस पर करनी है. That's it, sir. Thank you so much.
Thank you, Harpreet. Oh, sorry. Thank you, Tina. We will be beginning our question and answer round.
Thank you, Tina.
Yes.
It was nice presentations. You have taken the topic on your autoimmune disease psoriasis. Can you let me know the classifications, which classifications you have tried to, because you have written only that patient with the sign and symptoms. So what was the criteria for deciding the sign and symptoms for psoriasis? Are you able to listen to me?
Yes, sir.
Yeah.
Sir, there are the tools which describe this disease sign and symptoms by using PASI scale and DQLI quality life of a person, and psoriasis disability index by using this healthcare tool system.
So I want to know that the classifications, under which by which classifications you have utilized for diagnosing, arriving at the conclusion that it is psoriasis. What was the classification system that you have used for the disease classification? Like ICD-10 and 11 are there. So, any idea about that? Okay. And then my second question is regarding your medicine selections is also there. Which medicines and what was the criteria for selecting the medicines?
Sir, on basis of individuality of a patient.
On the basis of?
Individuality and
how you decided at the individuality?
Individuality of a patient.
Yeah, how you decided over that?
With the case taking as a whole person. Totality, repertorial analysis.
That what I am asking. Totality. What was the criteria? What things you have included in the totality?
Presentation of case, mental generals, then totality, then repertorial totality, then repertorial analysis.
What I see that since psoriasis is under the autoimmune disease, so can you tell me something about the autoimmune disease also?
सर ऑटोइम्यून डिजीज इन विच की अपना जो खुद का हेल्दी इम्यून सिस्टम है वो खुद के सिस्टम पर ही अटैक्स करता है rather than foreign particles.
And last question is that this photographs that you have used, it is
Yes,
of your patients or it is from the
yes sir, from OPD cases, sir.
OPD cases.
Yes,
okay.
sir.
Okay, good.
Sir, my study is observational study, medicines
That's
prescribed by OPD teachers and doctors.
Yeah. I got it. So
Yes.
thank you. Nice presentations.
Thank you so much.
Renu ma'am, any questions from your side, ma'am? Ma'am,
Hello?
kindly unmute your. Yeah.
Hello?
Have you taken the consent of the patient?
Hello.
No?
Hello.
Okay.
Hello.
Tilia, you are audible. Kindly answer the question.
Yes, ma'am. Yes, ma'am. Ask me.
Ma'am is asking, have you taken consent of the patients?
Yes, ma'am.
For sharing the photographs?
Yes, ma'am.
Okay.
Hello, Tina.
Yes, ma'am.
I would like to ask whether your study is concluded or not.
Sorry, ma'am. I can't hear you.
Your study is concluded or still ongoing?
Ongoing, ma'am. It is a running internship.
It is okay. You are still collecting the data, right?
Yes, ma'am. Yes, ma'am.
Yeah. So
Ongoing.
the photographs you have shown are for the before the treatment or after the treatment, because all the three photographs are different. What you have tried to show here?
Ma'am, these photographs during the treatment का लिया हुआ है.
नहीं, पर एक ही पेशेंट का है, 3 पेशेंट का है?
No, ma'am.
तीनों का आप देखो, तीनों का स्किन टोन अलग अलग है. जब हम प्रेजेंट करते हैं तो हम एक पिक्चर बिफोर का लेते हैं और उसी का कंपैरेटिवली आफ्टर लेते हैं, तभी तो आप अपना रिजल्ट दिखा पाएंगे ना.
Yes, ma'am.
राइट. और वो इसमें नहीं है. और
आपने वजह से भी हो रहा है.
आपने जो पीए पासी स्केल यूज किया उसको कैसे इवेल्युएट कर रहे हो आप?
मैम
पासी को इवेल्युएट कैसे करते हैं?
ये मैम एक हेल्थ के टूल सिस्टम है. इसमें 3 पैरामीटर्स को मतलब देखा जाता है. इसमें इंटेंसिटी होती है, इसमें अफेक्टेड एरिया होता है, इसमें थिकनेस, रेडनेस, स्केल्स देखे जाते हैं. देन इसको
वही
स्कोर किया जाता है 0 to 4 की रेंज में, वेयर 0 इज
0 to 4 की रेंज में. नहीं बेटा, गलत बोल रहे हो. 0 to 4 की रेंज में उसका नहीं है, टूल का 0 to 10 में है. और उन तीनों को टोटल करके इफेक्टेड एरिया और सिम्टम्स के बेसिस पे होता है.
Yes,
और डीएलक्यूआई कैसे कर रहे हैं आप?
मैम डीएलक्यूआई इज अ डर्मेटोलॉजिकल लाइफ क्वालिटी इंडेक्स, जो कि एक क्वेश्चन आंसर के बेस पे पेशेंट्स का लिया जाता है मैम.
इसके डोमेन्स कौन से हैं DLQI के? आपने अपने इसमें स्टडी में इंक्लूड किया है, तो देर आर डोमेन्स इन DLQI। कौन कौन से एरियाज को हम इसमें मेजर करते हैं DLQI स्केल में? Any idea?
I will study, ma'am.
Okay, Tina. BT ma'am, any
Okay,
questions
okay.
from yours?
No, nothing. Thank you.
Thank you, ma'am. Thank you so much, Tina, for your presentation. Moving
Thank you, ma'am.
ahead to our next presenter, Sabrine from Ventikeshwar Homeopathic Medical College and Hospital. Sabrine, kindly unmute yourself.
Yes, ma'am.
Are you ready?
Yes, ma'am.
Okay. Kindly begin your presentation now.
Good morning to one and all present here. I am Sabrin Sumaila Samyuddin, a final year student studying in Venkateshwara Homeopathic Medical College and Hospital, Porur, Chennai. I am here to present my poster on and review on the effect of Natrum muriaticum in the various plant under salt stress condition. It is an evidence-based study. Basically, salinity is a major abiotic stress which our country is facing nowadays. So, Natrum muriaticum has been clinically given.
You're not audible.
Ma'am,
Ma'am,
she
is that
is
Sabrine, you are
audible.
not audible.
Ma'am, is that audible now?
Okay.
Yes, Sabrine, you are audible. Kindly
Yeah.
continue.
Yes, ma'am. So, Natrum muriaticum, it is a homeopathic remedy which is prepared from the common salt, and it has been clinically proved in various patients also. Now it has given immense support in the agriculture field as well, to mitigate the salt stress condition in the soil, in the seeds, in the plants, and the various aspect like that. So the main aim and the objective of this study is to investigate the effect of natramute to mitigate the salt stress in the various plant species. So I have taken basil plant, tomato plant, and cowpea plant to observe the effect of the natramure upon the salt stress condition. So the methodology of this study is various plant has been considered, and various publication. I have collected the information from various publication in the Google Scholar, and I have resulted it in the concise manner that the effect three topics I have combined. The first one is effect of Natrum muriaticum on the photosynthesis and biomass of the basil plant grown under the salt stress condition. And the Natrum mu200C promotes the seed germination and increases the total protein, chlorophyll, rubisco, and sugar in the early seedling of the cowpea under salt stress condition. And the last one is ultra dilution of the Natrum muriaticum in the agronomic performance of the cherry tomato submitted to the saline stress. So upon looking forward into the findings for the three study, the finding for the first one, that is the natrum effect of the natrum muriaticum on the photosynthesis and biomass of the basil plant grown under the salt stress condition. The finding has concluded that the photosynthetic rate has been increased in the plant when it is administered to the salinity condition. So basically, the saline condition would not allow the plant to mitigate they cannot be able to grow, and the photosynthetic effect has been reduced when the plant is administered in the saline rich condition soil. So when we administer natrum muriaticum, 25% of the growth has been recorded, and this in the salinity of 75 millimoles. And the second study is the natramute 200C promotes seed germination and increases the total protein, chlorophyll, rubisco, and sugar in the yearly seedling of cowpea under salt stress condition. In this study, Basically, cowpea seeds are the seeds which cannot be germinated in the salt-rich soil, and they cannot tackle the rich salt-rich soil to be grown. So when we administered Natrum muriaticum either into the soil or when we apply the medicine in the germinating seed, we could get a good result of its growth and germination. So I concluded that the effect of the salt in the germinating seed, they were providing the it is basically upon the evidence of Hahnemann's similia principle in the plant, that is doctrine of signature. And the third study is ultra dilution of the natrum mure in the agronomic performance of cherry tomatoes submitted to the saline stress. In this finding, the result has been given in Natramute 11CH and 13CH has given a good result to increase the height, diameter, lap, number of leaves, number of flowers per clusters, and number of fruits, fresh fruit mass, as well as the other productivity of the tomato plant has also increased when administered Natrum mure to the plant. So we look into the lower averages of the proline contents were also obtained with application of this homeopathic preparation, and this response has been associated with the osmotic adjustment promoted by the use of ultra dilution. So natramine positive the effect of the vegetation and the reproductive development of the cherry tomato, which was submitted into the soil stress. So observation, upon looking into the observation, we could compare the study also. When the basil plant, that is a basil plant, when it is administered to the soil stress, the growth has been reduced, the height of the plant has been reduced to 10 centimeter, and the leaf area has been reduced to 20 centimeter square. After the administration of the natramute treatment, it has given an immense if improvement in the growth, that is the average height of the plant has been increased to 15 to 18 centimeter and the leaf area to 30 to 40 centimeter square. And looking into the cowpea seed germination, at the soil stress condition, 40% germination rate has been reduced, and an average 10 in an average of 10 days, the germination rate has been reduced. And after the natramure has been administered, 60 to 70% germination rate has been increased on an average of 6 to 9 days. And in the tomato plant, the average height of 15 to centimeter has been reduced, and the leaf area of 50 centimeter square, it has been reduced. And after the administration of the treatment, the height has been increased to 20 to 25 centimeter. 20 to 25 centimeter, and the leaf area to 70 to 90 centimeter square. So the result of this study is the natramure has demonstrated the positive effect on the tomato, cowpea, and basil under soil stress condition, and including the improved growth, physiology, and biochemical parameter, as well as enhanced yield and fruit quality. The 12x and 30x potency shows pronounced effect. All over, on comparing with all the potency, the 12x and 30x has given a good result. And I conclude by saying that various research studies has been done with an atramute to mitigate the soil stress condition, and it has given a good result in the tomato, cowpea, and basil plant under the soil stress. And the result consistently demonstrated that the natramute treatment can mitigate the adverse effect of the soil stress on the plant growth, physiology, and yield. Thank you so much for giving me this opportunity.
Yes, Sabrina, your presentations is quite different from the others because you took the topic of agro-homeopathy and
Yes, sir.
you decided you tried to study on the stress level of the salt among the
Yes, sir.
Can you let me know, you have
Yes,
taken
sir.
the three types of the plant, tomato,
Yes, sir.
coffee, and basil.
Mm.
So what is the average salt tolerance, stress tolerance in the mango? Can you have you made review a study about the optimum level of stress management in the plant?
Yes, sir. The optimum 75 millimoles is the optimum level, but it can be exceeded to about 20 millimoles. The salt stress can be exceeded to 20 millimoles, but the good result has been shown in the 100 millimoles and 150 millimoles of salt stress conditions, sir. But basically, on an average, 75 millimoles has given a better result on comparing with other millimoles.
What is the ideal level of the salt in the soil so that the plant can have a good impact?
Okay, so the ideal level is basically 100 millimoles or 150 millimoles. In an adverse condition, it may exceed to 200 millimoles. But in the 100 millimole itself, we can mitigate the stress conditions, sir. In a further looking into the deep research also, with our homeopathic medicine, 200 millimoles of stress can also be controlled by our natriumur. So, but basically, 100 millimole is giving a good result.
You have tested for the salt level in that soil?
Yes, sir. It is in review study, sir. It has already been done and it has been published as an article.
Why you say that it has been reduced? What way? How you felt that it is reduced?
Which one, sir?
The salt level in the soil where you.
No, sir. The salt level has not been reduced, sir. The plant has mitigated the effect, sir. It has it is like a doctrine of signature in which we administer the natramur with various potency. It has the ability to mitigate the stress over it, sir.
That means you say
The plant.
that means you want to say that the other other plants are growing well, but these plants that we have selected, they were not growing well.
They were not growing well in the salt-rich soil. So when we administered our medicine, it has a good effect on the plant and the growth has been very much recorded.
Good. So it is a nice presentation.
Thank you, sir.
I congratulate you for taking this new subject.
Thank you, sir.
Also. So
Thank you, sir.
what do you, Dr. Renu Mittal and Dr. Vithi?
Renu ma'am?
Sabreen? Yeah.
Yes,
Sabreen?
yes, ma'am.
Yeah,
Yes,
this is
ma'am.
a very nice topic. You have chosen the agro homeopathy. I would like
Yes,
to
ma'am.
know in your poster, at one place you have mentioned the CH, centesimal potencies, and in other part you have mentioned the potencies in 12x and 6x, and
30x.
somewhere is 200. So which potencies you have used? You have
On
used in centesimal scale or in x scale?
No, ma'am, this is a review study in which various potencies has been tested. Out of it, 20x and 30x has given an immense result. And another study I have included the 200C, which is only for the cowpea seeds. So altogether on combining every study, but 12x and 30x has given an increased improvement in the plant, ma'am, on comparing with all the potencies.
So this is a review study. You haven't conducted the study yourself, right?
Yes, ma'am. Yes, ma'am. It is a review study.
And the study has been conducted in the field model or it's a laboratory study? The studies which you have reviewed
Yes,
is
it is a field model, ma'am. It's a field model.
yeah, it's a field model study.
Yes, ma'am.
Okay, and these studies are already published studies which you have analyzed.
Yes, ma'am. It has been very much published and it has given a good result by various authors
Where it has
also.
been published? Where it has been published?
I have taken these in the Google Scholar, ma'am.
No, Google Scholar is okay. Which journal they have been published? Because you have undertaken a review of the studies, so you must be knowing the journals.
Uh, Yes, ma'am. It has been published by Montel S. Sukul, in which,
Uh,
yes, ma'am. This study was published by Montel S. Sukul, and in the year 2012, in the
mhm.
International Journal of High Dilution Research, this was published. And another study also, it was published in the International Journal of High Dilution Research only.
By
These
Dr.
were, yes,
This was
ma'am.
published by Dr. Sukul, NC Sukuli, right?
Yes, ma'am.
Okay. Okay. Thank you.
Thank you so much, ma'am.
Uh, thank you. We had like technical difficulty from our side. Moving ahead to our next presenter, Pragati. Pragati Mathur from Swasthya Kalyan Homeopathic Medical College and Research Center, Jaipur. Pragati, are you ready?
Yes, ma'am. Good afternoon, everyone, all the dignitaries and participants present over here. Myself, Pragati Mathur, and I am a final year student of Swasthya Kalyan Homeopathic Medical College, Jaipur. Today, I am going to present among you all my STSS research, a comparative study on efficacy of homeopathic medicine Xanthosylum fraxinium 6x in primary dysmenorrhea, a single blind placebo-controlled trial. So we all know that dysmenorrhea is a very common problem among females, be them be a teenagers or a middle-aged woman. Among them, my study is basically based on primary dysmenorrhea, which is prevalence among in 85% in USA, 84.51% in Italy, and 40.7% in India. What I have tried to study is basically to compare the effectiveness of zenthosylum and the placebo. We have several other remedies in homeopathy to treat dysmenorrhea, but I have basically worked upon this zenthosylum medicine in 6x potency. Methodology I have used is that I have conducted the study in between two groups, where the group A is the odd group who have received the medicine xanthosylum fraxinium in 6x potency, and the group B is the even group receiving placebo. I have administered these two in an alternate basis, and I have measured the pain intensity and the associative complaints with using the NRS scale. The statistical analysis was done using paired t-test. For that, I would like to share the value. The p-value for the medicine was 0.0001 and the p-value for the placebo was 0.0645 in this test. The results that I have observed was that 31.57% patients have markedly improved in the pain, 47.36 were moderately improved, 21.05 were mildly improved, and I haven't seen any worst cases. So my study concluded that xanthosylum has proved much better as compared to placebo. Along with placebo, I have also advised the patients some dietary changes if they could make, or some yoga for their benefit. Here I have also shared some pie charts and the bar graphs, where you can see the number of patients having marked improvement, moderately improved, mild improved, and worse. The pie chart for the marital status, most of the patients that have received my treatment were unmarried and among age group 18 to 21. Thank you.
Thank you, Pragati. We will be beginning our question and answer round. Sahani sir, questions from your side. Sir, you are not audible. So kindly unmute.
Yeah, you want to say something from me, my
Uh,
side?
sir, we were unable to hear you. Kindly repeat what was your question.
No, no, I was just as the speaker, the participants were talking, so I have not talked. No, I have not. Just mic was open only. So it may be the
Sir,
doctor.
any questions from your side to Dr. Pragati?
Uh, yes, uh, why you have chosen only 6x potency? Why you have chosen only 6x potency?
The 6x potency is not even that low to not stimulate anything, or not even that high to, you know, give any worse effects of itself. So I have chosen 6x potency.
I don't find the inclusion criteria for this case is primary dysmenorrhea.
So the inclusion criteria from my side was the all those patients who are justifying the definition for primary dysmenorrhea, all those patients who have given their consent, and patients
No,
who are coming in this.
consent is different. I say what was the criteria for deciding that it is primary dysmenorrhea?
So I have taken the history or all through case taking, and if there is no pathology associated, if they have no systemic illness associated with them, they are suffering from cramps for and along with associated complaints, cramps worse enough for them not be able to do any their daily activities. They are getting absent from their colleges or work. So that was my inclusion criteria.
Redu ma'am, any questions from your side?
Yeah, uh, yeah, but still I don't find that you have the criteria is not. So it is only on the general observational basis, I think. Okay. So next, thank you from my side.
Thank you, sir.
Redu ma'am, any questions from your side?
Pragati, are you able to hear me?
Yes, ma'am.
Yeah, when you were giving your presentation, you told that you have given the medicine alternative, right?
Yes,
So,
ma'am.
but it means ki for the first patient, you have given like the homeopathic medicine, then second one placebo, and third one like. So
Yes, ma'am.
nowadays, is this the method for randomization? You have to have done the randomization. There are now a lot of methods for computer based softwares are there for doing the randomization. Why didn't you use that?
Question and answering numbers.
Ma'am,
Hello.
yes, ma'am. I just have to compare the effectiveness for both of these medicines. So I
That is
haven't used the
okay. That is
competitive.
okay. But why did you do the randomization? So because using the because selecting the patient on your own, okay, I will give homeopathic medicine to this and placebo to this is not the right way in doing research, right?
Okay, ma'am.
And second thing is ki when you how you were saying that the p value was 0.001. So you have compared the how you have compared whether you have compared the group A with group A or you have compared the group A with group B.
Ma'am, I have shared p-value for both the medicine and the placebo, and even in the medicine
बेटा
and
p
placebo, I
value
have.
just listen p value तब आता है जब हम दो ग्रुप्स को कंपेयर करते हैं right. If you have two groups you will compare homeopathic medicine versus placebo then p value तो एक ही आएगा ना दो कैसे आएंगी. So what you have done, I think so what you have done is you have compared the pre and post. आपने जिसको होम्योपैथिक मेडिसिन दिया उसका पहले देखा और उसका बाद में देखा और प्लेसिबो का जिसको पहले दिया और बाद में दिया पर आपने प्लेसिबो को होम्योपैथी से कंपेयर नहीं किया.
No, ma'am. I
तभी दो
have.
पी वैल्यूज आ सकते हैं.
Ma'am, I have
हाँ बताओ
compared.
आप बोलो.
Yes. Yes, ma'am. I have compared placebo and the medicine as well, and it was less than 0.05.
और आपने कहीं पे लिखा नहीं है 0.05 पे आप कैसे आए? कैसे आई
Ma'am,
वो वैल्यू?
I haven't added this in my presentation, but I have written in my documents. It was first I have compared the pre and post analysis score for the medicine and then the placebo. Then I have received two values and then I have compared both of them.
You have compared the p values.
Ma'am, the post and pre analysis score.
Pre and the post analysis score.
Yes, ma'am.
Okay, thank you.
Welcome, ma'am.
Diti ma'am, any questions from your side?
One question is there. How did you judge about primary dysmenorrhea? Because there are nowadays at the age, puberty age also, and after that also, the girls, school-going girls and college-going girls, they have a PCOS, and then because of that also they have dysmenorrhea. And symptoms much of the times are very vague, like just cramps are there. And on investigation, we come to know that they have got PCOS also. And they have no other symptom other than maybe hirsutism is there or extra hair growth, something like that are there. With that also we can judge. But without any investigation, how did you come to conclusion of only primary dysmenorrhea?
Ma'am, I haven't taken any investigations. I have just all those patients who have fulfilling the definition, that is having cramps and not any systemic illness, that if I have taken their history, if they have any PCOS or PCOD history, I have not included them in my case study.
Maybe the person is also not knowing about it, that they have PCOS.
So, ma'am, I have taken their history, that about their menses, about their irregularity or regularity, or all the bleeding pattern.
Only menstrual history, that how often they are having the menses and regularity of it, with
Yes,
pain,
ma'am.
without pain. There are
Sorry, ma'am.
cases where there is PCOS, but not much severe pain is there. Only simple slight pain is there, maybe for 1 or 2 days, rest all days they are okay. So such cases, how do you come to know that they don't have PCOS? Because I feel nowadays it is a very commonest disease that females are having PCOS, and they are not even aware of it until unless they complain of extra hair growth or weight gain, something like that. And then on examination or on investigation, we come to know that they have got PCOS. Even they don't have dysmenorrhea also.
I have prepared a proper questionnaire for that, and only on that basis, I am deciding which patient should get the medicine or the placebo and should come in my criteria.
How many questions have you taken in that?
Questionnaire, it was around 20 to 30 questions, which included all the bleeding patterns, all the measures that you have taken to, get relief from this pain, and all your history and everything.
Fine. Thank you.
Welcome.
Thank you, Pragati. Moving to
Welcome.
our next presenter. We will be moving to our next presenter, Soranjali from Swasthya Kalyan Homeopathic Medical College and Research Center. Soranjali, are you ready? There's some errors. Swaranjali is from Satara, Maharashtra. Swaranjali, are you ready? Swaranjali,
Yes, ma'am.
kindly start your video.
Yeah, ma'am.
Are you ready?
Yes, ma'am.
Kindly start.
Uh, Good afternoon, all the respected teachers and judges. Thank you for giving me this opportunity to present my poster in this competition. Myself, Swaranjali Suryavanshi. I am a fourth year BHMS student from Gulabrao Patil Homeopathic Medical College, Miraj. My guide name is Dr. Vivek Ghadge, sir. So today's topic for my poster presentation is the antibacterial activity of Arsenicum album 30 against the gram-positive strain becoming the global health concern, and it will lead to the exploration of the newer antibiotics. So when I was going through the previous research articles and previous research studies, I found that Arsenicum album shows the potent therapeutical usefulness in the infectious diseases. So I choose this topic. So the aim for my topic is to study the antibacterial activity of Arsenicum album 30 against gram-positive and gram-negative bacteria. To achieve these aims, my objective includes first, to observe the in vitro antibacterial activity and efficacy of Arsenicum album 30 against the gram-positive and gram-negative bacteria. And second one is to study the time duration taken by the bacteria to produce the zone of inhibition or to show the susceptibility against the Arsenicum album 30. So to achieve both these aims and objective, I follow the following research methodology, which includes first, our study design is prospective observational study in the vitro. Then the sample size are 30 bacterial samples, and the study settings are all the procedures are done in the microbiology laboratory by the microbiologist. Then we use the scale that is the CLSI guidelines, which mean Clinical and Laboratory Standards Institute for the measurement of the zone of inhibition. The brief procedure includes the bacterial strains were collected from the various samples such as sputum, pus, urine, stool, abscess, etc. And they are incubated on the nutrient and McConkey's agar at 37 degrees Celsius and for the 18 to 24 hours. Then these bacterial samples were isolated as per their biochemical test result, colony morphology, and gram staining. And at last, the antibacterial susceptibility test of Arsenicum album 30 was done in the Mueller and Hinton agar media. We use the specific Mueller and Hinton agar media because it has more diffusion power of the antibiotic than all other the media. So we use the Mueller and Hinton agar media and adding the isolated bacterial broth and one drop of Arsenicum album 30 on it. And this is incubated for 24 hours according to the diffusion method. Then after the 24 hours, we measure the zone of inhibition. So basically zone of inhibition, which means the circular area around the antibiotic disc in which the growth of bacteria is inhibited. So our outcome assessment is based on presence or absence of this zone of inhibition. First one, the bacteria who gives the zone of inhibition 22 are considered as a sensitive. And second one, the bacteria who does not give the zone of inhibition are considered as resistant to Arsenicum album 30. So sensitivity means after using the Arsenicum album 30, the bacterial growth is inhibited. And resistant means even after using Arsenicum album 30, there is no any effect on the growth of the bacteria. So by following all the research methodology, I came across my results and observation. My results that are Arsenicum album 30 is an potent antibacterial against the gram-positive and gram-negative bacteria. Among the 30 bacterial samples, 26 bacteria shows sensitivity and 4 bacterial samples shows resistance to the Arsenicum album 30. As we can see in the image, table number first, among these 26 bacteria, 23 gram-negative bacteria shows the sensitivity within the 24 to 48 hours. And 3 gram-positive bacteria shows sensitivity within the
24 hours. As we can see in the first image, there is formation of zone of inhibition after using the arsenicum album 30. And the resistance that is given in the table number second, 4 bacterial samples are resistant, in which 3 gram-negative bacteria, which include the samples of Klebsiella from urine, and 1 gram positive bacteria, that is the Enterococcus, shows the resistance. We can clearly see the growth of bacteria even after using the arsenicum album 30. So my observation is there is some clinical correlation between the signs and symptoms produced by the bacteria which are sensitive to the arsenicum album 30. That similar signs and symptoms produced by the arsenicum album 30 during its drug proving. So from all this research, I came across my conclusion, that is the arsenicum album 30 is an potent antibacterial against both gram-positive and gram-negative bacteria. That is 86.6%. And second one is, among these 26 sensitive bacteria, 23 bacteria were shows the sensitivity within the 24 hours, and 3 bacteria shows the sensitivity within the 48 hours. As we can see in the pie chart, the blue color represent the bacteria which shows the sensitivity within the 24 hours. The green color shows the sensitivity within the 48 hours, and red color indicates the bacteria who are resistant to the arsenicum album 30. And I conclude that there is a clinical correlation between the sign symptom produced by the bacteria which are sensitive to the arsenicum album 30, that similar signs and symptoms produced by the arsenicum album 30 during its drug proving. Thank you. I have all my 30 bacterial samples with the evidence of photographs, but due to the limitation of this PPT, I can share only 6 samples of my project. Thank you.
Thank you, Swaranjali. We will be beginning question and answer round. Any questions from MK Sahani, sir?
I think it is good. And Wali, I think it is, she has presented well. Only the criteria for deciding the results, any objective measurements that you should, Mittal was asking also in some of the cases. I just was not able to listen those things. If it is there in this related in this study, Swanjali, you can tell me.
Sir, we use the CLSI guidelines, which means the clinical and
I just missed that, so it is good.
Sorry, sir, I can't hear.
It is okay. So thank you. It is okay. Thank you.
Thank you, sir.
Renu ma'am, any questions from your side?
Yeah, Swaranjali, this is a very good study which you have done for arsenic album 30. But I wanted to know, as you know, all our preparations are alcohol based, right?
Yeah, ma'am.
So, have you kept a control also in your study? Because if you have alcohol, one positive control, yeah.
No, ma'am, because in books there is written that alcohol shows only antiseptic activity when its concentration is about 10%. And one research study taken on the arsenicum album 30.
Because alcohol.
Sorry, ma'am, I can't hear. Sorry, ma'am, I can't hear.
Antibacterial role and alcohol में हल बनती हैं. Was it control wherein alcohol was used?
Please, ma'am, repeat the question. Please, ma'am, repeat the question. I can't
Okay, I
hear
will repeat.
properly.
मैं ये पूछना चाह रही हूँ आपसे, आपने जब ये अपना टेस्ट किया है तो इसमें आपने आर्सेनिक एल्बम 30C यूज किया, राइट? और हमारी जो मेडिसिन है वो सारी अल्कोहल में बनती हैं, तो आपने इसमें कोई कंट्रोल भी रखा या
No, we can't take any control because we use the very small amount of our drug, that is the 1 drop, and 1 ml of the our potency arsenicum album 3 contain only 0.67% of alcohol, and alcohol is act as an antiseptic, which means the alcohol can kill the bacteria when its
when its concentration is about 10%. And in this our medicine we use alcohol as a vehicle, and vehicle does not carry any chemical properties or therapeutical usefulness.
नहीं ऐसा नहीं है अल्कोहल इट वुड हैव बीन बेटर अब इसको दोबारा अगर आप रेप्लिकेट करेंगे तो आप इसको अल्कोहल को अगर कंट्रोल रख के करेंगे तो देन योर रिजल्ट्स विल बी मोर वैलिडेटेड
Yes ma'am, I will do.
Yeah, second thing I would like to ask you कि what do you mean by sensitivity and resistance? How did
Ma'am,
you define? Yeah.
sorry ma'am, sensitivity, it is a term in which we can say after using the particular drug. In my study we use the arsenicum album 30. After using the arsenicum album 30, the bacteria are killed or their growth is inhibited, so this is called as sensitivity. And resistant means after using arsenicum album 30 on this bacteria, there is no effect on growth of the bacteria still grow after using the arsenicum album 30.
So this was a study you have done for the 24 and 48 hours. What if the
Sorry ma'am, I can't hear. Sorry ma'am, I can't hear clearly.
one is
Ma'am, your voice is breaking.
but we are even doing QCT studies. Okay. Okay.
Ma'am, I can't hear you.
Now my voice is better. Now it is better.
Yes, ma'am.
Yes,
Ranjini, now
yes,
it is
ma'am.
better.
Yes, ma'am.
Yeah. Yeah, I was just asking you कि आपने 48 आवर्स तक ऑब्जर्वेशन किया है आपने
हाँ
अपना ऑब्जर्वेशन पीरियड्स एक वीक का क्यों नहीं रखा है इसने
नहीं
उससे
मैम,
आपको हाँ जी
हाँ सॉरी,
बताओ
नहीं आप
बोलो बोलो
सॉरी, वो हमने एक बैक्टीरिया को जो है वो 24 और 48 आवर्स तक स्टडी किया है। ऐसे हमने 30 सैंपल स्टडी किए हैं, इसलिए वो स्टडी 2 महीने तक चल रहा था।
नहीं पर आपने उनको 48 आवर के बाद आपने सैंपल डिस्कार्ड कर दिया होगा ना आपने उसको कंटिन्यूअसली ऑब्जर्वेशन में नहीं रखा होगा एक वीक
हाँ
तक
नहीं, क्योंकि वो मॉडर्न मेडिसिन में भी 24 और 48 आवर्स तक ही हम वो जोन ऑफ इनहिबिशन आता है क्या ये नहीं देखते, इसलिए हमने 48 आवर्स तक ही देखा है।
नहीं पर वो जोन ऑफ इनहिबिशन आगे तक सस्टेन भी करता है नहीं करता है ये भी तो आजकल स्टडीज है ना जो
हाँ,
हम हाँ तो वो आपने इसमें नहीं लिया
इसमें नहीं लिया।
तो आप जब भी आगे करोगे ना तो ये दो मैटर्स को ध्यान में रख के करना
हाँ ठीक है
एक
मैम।
तो ऑब्जर्वेशन 3 डेज पे 7 डेज पे जरूर करना और एक अपनी स्टडी में पॉजिटिव कंट्रोल जिसमें सिर्फ अल्कोहल होता है उसको भी जरूर रखना
ठीक है मैम।
क्योंकि इससे आपकी स्टडी को ना और स्ट्रेंथ मिलेगी
हाँ मैम,
ओके
थैंक यू
थैंक यू
फॉर सजेशन मैम।
या थैंक यू
Any questions from Bhuti ma'am?
No, thank you. She has done it very well.
थैंक यू
And
मैम।
Anjali has given her all the more opinions.
Thank you, Sir Anjali, for your presentation.
थैंक यू मैम।
Moving to our last presenter of PG category, of UG category, Pradne P. Zambare from late Miss Hosubai Homeopathic Medical College and Hospital, Maharashtra. Pradne, are you ready? Pradne, kindly unmute yourself. Pradne, Pradne, it's your turn to present your presentation.
Yes, ma'am.
Okay, kindly start.
Good afternoon, everyone. So, myself, Pradnya Zhamre from late Mrs. Hausabai Homeopathic Medical College and Hospital, Nimshirgaon. So, now I'm going to present my research topic, what I had done. So, my research topic was efficacy of Black and 30 in prevention and treatment of subclinical mastitis in Holstein Friesian cows by using California mastitis test.
I think there's some technical difficulty from Pradnay's side. Pradnay, we are unable to hear you. Pradnay, we are still unable to hear you. Pradnay, we are still unable to hear you. I think there's some technical error. Till we are solving Pradnay's technical error and reaching to her, I request our judge, Dr. M.K. Sahani sir, to kindly address us all.
Thank you, Doctor. I'm very happy that this Swasth Kalyan Homeopathic Medical College has taken initiative in organizing this poster competitions. It is very important for inculcating the learning aptitude as well as the research aptitude among the students, and especially for the undergraduates. I'm addressing with the undergraduate students, and they are the newly joining, new to the research methodology. So the way that they have presented all the, I think all the six presenters, I find that it is quite good. All are, I say that these are, they deserve my congratulations for their presentations and their approach for taking initiative for the research. This in the present scenario, it is my sincere desire that all students should try to develop this research ability, asking questions, trying to answer them, reading the books. All these things are necessary so that you can have a very good background at the undergraduate level itself. And the new syllabi for the UG course, which was just upgraded by the NCH, it is very comprehensive, and they have, I congratulate NCH also for including and giving more importance on the research methodology in the subject. And this small attempts that this college has, Swasth Kalyan has taken here. It is very heartening, and I hope they will continue. And I have observed Swasth Kalyan, especially Dr. Yogeshwari Gupta ji, Dr. Pankaj Sharma. They are all very enthusiastic about the present, about doing something, something new and something initiative, and keeping the liveliness at the institutions. It shows the health of the institutions and uh, their interest in providing the proper education. And for all the participants that who have uh, participated in this session, I congratulate them for taking daring, I say daring, to present their work. It doesn't matter that whether you get the prize or not. It is a matter more important that you have so you have attempted. This is important things for every one of us. Keep trying, keep trying. This always I say, and sometimes we always, and this is only the things that what results we are getting. It is not the matter. It is the matter that how much we are engaged with the our in our activity, and this activity is the trial and making attempts and enhancing ourselves. So with this, I bless all the participants and thank you all the judges who cooperated with these institutions and the management of the Swasthya Kalyan. I am thankful for them, and especially my thanks to Dr. Yogeshwari Gupta ji for inviting me to be the judge at this session, for this session, and I congratulate everyone present here. Thank you very much.
Thank you so much, sir, for your inspiring words. Pradne's technical issue has been resolved. She is back with us. Pradne, kindly unmute yourself to resume your presentation.
Yes, ma'am.
Kindly start.
Yes, thank you, ma'am. So myself, Pradnya Zambre from late Mrs. Hausabai Homeopathic Medical College and Hospital, Shirgaon. So now I'm going to present a research what I had done. So my research topic was efficacy of LAC-1030 in prevention and treatment of subclinical mastitis in Holstein Friesian cows by using California mastitis test. Holstein Friesian is an international breed of cows. Uh, so there are two types of mastitis. First, clinical and subclinical. Clinical mastitis shows signs such as warmth, redness, or watery clotted milk, while subclinical mastitis doesn't show any sign and symptoms. The occurrence of subclinical mastitis predisposes the former. So, inclusive criteria of my study was cows between first and 8th month of lactation and cows with positive CMT test. And exclusive criteria are healthy cows and cows with clinical mastitis. So sample technique was simple random sampling, and study design was experimental uncontrolled study, study setting at a dairy farm, and my sample size was 5. Uh, uh, First I use California mastitis test kit. First I collect a milk sample in a paddle from each 4 quarters. Cows which found positive for subclinical mastitis were administered by LAC-1030, and 20 drops of LAC-1030 were given 2 times a day for 7 days. Then I had wait for 15 days without giving any medicine, and after 15 days I did CMT test again and compared it with previous results. So results after doing CMT test again are out of 5 cases, first sample gives positive test with all 4 quarters, second and third sample gives positive test with right front and left front quarters, and fourth sample didn't show any changes, and fifth sample gives positive test with right back and left back quarters. So from above research I concluded that uh, it is uh, it is concluded that LAC-1030 is not effective in prevention and treatment of subclinical mastitis in HF cows. cows. So my recommendations for further research are I should change route of administration. I should change potency with frequent repetitions, and I can do among large numbers. And also I can use different diagnostic tests for diagnosing subclinical mastitis in cows. Thank you.
Anything else you want to add, Pradney? You have still enough time. Am I
Sorry,
out?
ma'am.
Shall we begin with the question and answering round? I request MK Sani sir to kindly ask any questions.
I think it is a veterinary study, and exclusion criteria healthy cows. I don't understand, and the cows with the clinical mastitis. Can you tell me about this exclusion criteria?
Sir, healthy cows means cows which doesn't have any other illness or any other disease condition. And clinical mastitis, that is, there are two types of mastitis: clinical and subclinical. My work is only on subclinical mastitis, so I excluded cows with clinical mastitis.
What was the way that you collected the symptoms? Because animals are muted persons, so how you arrive at the only on the what were the criteria for selecting the symptoms?
Sir, clinical mastitis shows signs such as redness, warmth, and hardness of udder of cows, and the milk is watery or bloody with clots. These are the signs of clinical mastitis, and subclinical mastitis is a stage of intramammary inflammation. There are no any external signs or symptoms. So I had used California mastitis test to diagnose the subclinical mastitis.
And what was the medicines, the group of the medicines that we have used? How many cases you have tested? Sample size was only 5, I think.
Yes, sir. My sample size was only 5, and I had give lakh and 30 through their food, that is corn flour dough.
How you are sure that with this is very small, I think 5 is not so much, with this small size, you can do something good results. It may be the
Yes, sir.
only-
My recommendations are those that I can do this among large numbers.
Okay. Thank you. Thank you
Thank
from
you,
my
sir.
side.
Thank you, sir.
Renu ma'am, any questions from your side? Renu ma'am? Preeti ma'am, any questions from your side? Am I audible?
Yes, yes. I agree with Sani sir that
Um,
being 5 is very less, and minimum I think so 30 is the sample size should be there for any study to come to a conclusion, because you have come to a conclusion to a negative thing that it won't act, it is not acting. So, but with 5 sample size, we cannot say that it is not acting.
Yes, ma'am.
yeah, Pradnya, are you able to hear me, Pradnya?
Yes, ma'am.
Yeah, I have 2-3 questions regarding this study. First is QQ, why you have chosen the cows only between the first and 8th month of lactation? What was the reason of selecting this inclusion area?
Ma'am, because there is high chances of causing subclinical mastitis in that period of lactation.
Do you have any study which shows that the prevalence of subclinical mastitis is between the first and eighth month of lactation? Have you gone through the literature regarding this?
Yes, ma'am. Yes, ma'am. Yes.
Okay. Secondly, what you have written in your implications is increasing immunity of cows, avoidance of antibiotic resistance. But what you have presented is nothing is related to that.
Ma'am, as we know, homeopathic medicines can increase uh, means, can increase immunity against that particular disease. That is,
No, no, we
it
know it.
decreases the recurrence.
We know it.
Recurrence.
We know it. But when we are doing research and we are talking about any of the terms like avoidance of antibiotic resistance or increasing immunity, to give more relevance to your study, you should have studied the immune markers, right? And like you have written the antibiotic resistance, whether the cause which you have selected were already have taken the antibiotics, you have tested them for the antibiotic resistance, because if you're imply it doesn't, you can't imply from any study like this, no? Unless and until you have given the objective parameters like the immune markers you have used, or the antimicrobial resistance, the sensitivity test for the antibiotics which have been given to cows have already been studied upon. So basically, what I think why you have failed is, first is the foremost that the sample size is very small, and the rigor in your study, the methodology, what you have used is less. Though the topic is good enough, and we need more studies in the veterinary side in homeopathy, because with these evidence we can go for the further translational research uh, to the human beings also. And what was the reason for selecting 20 drops? How you calculated this dose of 20 drops?
Ma'am, I had given with a dropper, that is 20
No,
drops.
no, no. Why did you select it 20? Why not 5? Why not 10? Why not 30? No, who suggested you to use 20 drops?
Ma'am, I
Either
asked
somebody
to my
suggested,
guide.
you ask your guide.
Yes, ma'am.
Was it was there any, because whenever we are giving any medicine to the cows or any of the animals, there is a by weight dosage is calculated in the micro mls, right?
Yes.
But your guide told you to use 20 drops and you use 20 drops. Hmm? Because what I am seeing, though you are saying the results are not good, but what you have written in the first sample, you have got the positive test in all the 4 quarters. In second and
Yes.
third also there were results. So I think so. If you repeat this study with a bigger sample size and with more scientific rigor, using the immune markers, or also studying the factor that whether the whether the cattle has already been given some antibiotics injections, or whether the like that,
Yes, ma'am.
you should add more objectives. And secondly, one thing more, the way of giving the medicine, the route of administration also matters, because I think so you wouldn't have absorbed whether the cow or cattle has taken the fodder or not, right?
I,
if आपने
हाँ,
खा दिया fodder में पर cow ने खाया ही नहीं है, तो how will you evaluate the results?
yes, ma'am.
Hmm?
Thank you, ma'am.
Would you like to say something about it? Sure. Okay.
Okay.
Thank you.
Any more questions from BT ma'am?
No, thank you.
Thank you so much, Pradney. With
Thank
your
you.
presentation, we will be concluding all the presentations from UG category. Thank you, presenters, for your incredible poster presentations. Now it's time to hear from our esteemed panel of judges. We have already heard words from Dr. M.K. Sahani, sir. Now I request Dr. Renu Mittal, ma'am, to share your perspective on overall quality of posters and any suggestions for participants to improve.
Yeah, thank you, Dr. Yogeshwari. First, I would like to thank you for inviting me to your presentation. It is a very good initiative which has been taken by your institute for enhancing the research aptitude among the UG students, because they are the foundation now. When we start from this level, then only after doing their PGs they will be able to get to develop the bigger attitude. Have undertaken a good initiative, and at this level, at the UG level, the final year students or the third year students, they are trying to get in it, is very encouraging also. What I would like to suggest to all the participants is कि you should read more literature. Literature in sense the journals, the articles which are being published in peer-reviewed journals. Like from saying from the Central Council for Research in Homeopathy, I would like to say we have a journal IGRH. Now it is online available free. Everybody can access all the articles. So you should make your habit of reading at least one article in a week if you don't get much time, or so that you will have more research aptitude towards that and you will be able to improve your thesis and your working. And secondly, you should look after the statistics also, because to give we are talking about the evidence based medicines, the integrative models we are working upon. So for the evidence based, the subjective parameters doesn't work. The world around us doesn't listen to us with the subjective parameters, for giving them back answers, for having more rigor to our scientific world, and to present ourselves, we have to take the objective parameters. Nowadays, whenever you plan a study, so maybe it on a small sample size or a big sample size, it doesn't matter, but the objectivity should be there. You should use scales. There are, whenever you search for the Google search, you search for the questionnaires which can be used for a particular disease problem. Likewise also we are having the quality of life scales. Sometimes we say the diseases like that keep though the result of homeopathy is not good, but we are like in cancer cases or the terminal stage cases, but we can improve the quality of life, we can increase the longevity of the patient. So you should search for these scales. Okay, what are the scales available, and whether how can we use it? Because when we do research and we write to the researchers, their copyright scales always try to get a permission from them. Okay, these are the points you should take care of. You cannot use any of the scales without the permission of the author. So sometimes these scales are freely available for you, sometimes you need permission, and you usually, when you say you are a student and you are working for a research, they usually provide you free. But try to use the validated scales, try to go through the journals, the articles which are being published, try to keep yourself updated with the present ongoing research which are going on. I'm seeing the patients are now, the children are, students are now taking interest in the agro homeopathy or the veterinary field. This is very good, because somewhere we have to see our results, show our results there also. And because of the antimicrobial resistance which is creating a huge menace nowadays, the people are moving to the holistic treatment, to the homeopathic treatment, where we say there are no side effects, or at least the ADRs, the adverse drug reactions, are very less as compared to the conventional medicine. So while preparing your thesis or anything, you just go through the protocols which have been published. You can go through the Cochrane guidelines, and many of the guidelines are online available for developing the protocol also. Right. So the both the things are there. The preparation of the protocol should be very good. You should include the scales. The outcome parameters should be very specific. Second thing is the statistical evaluations. Whatever we are doing, if we are not so much not so much taught about the statistics. You can take help of some of your teachers or the guides who are well versed with the statistical calculations, or you can take help of some of the statistician with the help of your guide or your college teachers. We won't need help of a statistician for calculation of the sample size and what we should evaluate, whether we have to go for the pre-post test, which test we will be using based on the objectives what we have defined in our project. So these are some of the things which we have to take care when we are planning for a study, and going for and try to go for a randomization for the double blind studies, because observational studies you don't have a control group, and whenever you have to publish your result, you will be, if you want to publish your results in a good journal, in a peer reviewed index journal, they would always ask that you should have a control group in your study. And second, one more thing I would like to tell, ki whenever we give photographic evidence, so try to take photographs with the same angle and with the same light, which we have taken at the baseline at the start of the project and in while you are doing the follow-ups and at the end of the treatment, because then the photographs are comparable. If the quality of the photograph differs, suppose today you are taking it from some 2 megapixel camera and after that you're taking from the 5 megapixel camera, or the situation of the light where you're taking the photograph is not similar, then the results will not be similar, though the results are good, but it won't be visible as good as they should be. So, with these words, I would like to thank the Swasthya Kalyan College and Dr. Yogeshwari Gupta for inviting me for this presentation, for judging these posters of the students. I would like to congratulate all of the participants and that it will give encouragement to others also to be a part of these posters, and it will enhance your knowledge also. Thank you.
Thank you so much, ma'am, for your expertise. I request all the judges to kindly share judgment sheet to us. Finally, I request Dr. B.T. Roy, ma'am. We would like to hear from you, ma'am.
First of all, I will congratulate Swasthya Kalyan College, Yogeshwari ma'am, Pankaj ma'am, and the college management, all the staff who has given their hard input in organizing such a good platform for it is that I college has put me in this panel among the such eminent panelists, M.K. Sahani sir and Renu Mittal ma'am. I am a very less among in front of them. Ma'am has told everything about research and sir has told everything about the organon aspect, the homeopathic aspect and everything. But I will like to say what commission has also incorporated looking into this research thing, that we should give an opportunity to the students for upcoming, that research should be incorporated in UG level also. That's why the new curriculum has come with the research for the UG level itself. And second thing, I will say that all the research projects, whatever the studies has been taken up by the students are marvelous. But the best part is about going apart from the human studies, going towards the animal study and plant study. This is something unique, and it should be in more flourished among the students, that okay, we should carry such studies also, which we can see that now students are going into that. But one more thing that is required is more based on evidence based on the investigations, because investigations are the thing what the other system of medicine are more relying on it, instead of sign and symptoms, or the thing that investigation pre and post are more to be and means they should be encouraged for doing more investigation, going for investigation, so that we can say that okay, the previous and what was the later on, and we can say that our homeopathy is working a lot shoulder to shoulder and give a fruitful result to all the diseases. With that, I am thankful again to the college and everyone for giving me a chance to be here as a panelist. Thank you.
Thank you so much, Vithi ma'am. I now welcome Dr. Pankaj Sir, Director, Swasthya Kalyan Homeopathic Medical College, to conclude the UG category of presentations. Handing over to you, sir. Pankaj sir, we are able to see you. I request you to kindly unmute yourself and conclude our session for the UG category. Okay, I think there's some technical difficulty. ठीक है. I think sir won't be able to address sir. There is some technical error. Without further ado, I would like to thank you, our judges, for the UG category, respected M.K. Sahani sir, Dr. Renu Mittal ma'am, and Dr. P.T. Roy ma'am. Thank you for your valuable time, expertise, and thoughtful feedbacks. Your comments are truly appreciated and they will inspire our participants to strive for further, even greater excellence. I think sir is back with us. Handing over to you, sir.
Thank you, Master of Ceremony, Doctor Saab. Sorry. Hello, I'm audible. Hello.
Yes, sir, you are audible.
Thank you. Thank you, Dr. Sahni sir, Mudul Sahni sir. I am very much thankful to you to join with us, sir, and give your valuable time. सर, मैंने आपके साथ जिंदगी के अंदर 20 साल निकाले हैं. मैंने देखा है आपने होम्योपैथी के लिए कितना सब कुछ किया है. पूरे हिंदुस्तान में ही इंटरनेशनली आपने जो किया है और आपको मतलब होम्योपैथी के इतिहास में याद किया जाएगा सर. और जो आप कर रहे हैं और ये कर रहे हैं, हमारा एक बहुत छोटा सा प्रयास है कि जो आपने शिक्षाएं हमको दी, हम उसी को साथ में लेते हुए, इसको साथ में लेते हुए, और हम बच्चों को भी वही संस्कार देना चाहते हैं सर. हम सिर्फ एक ईमानदारी आपसे सीखा है, सिर्फ एक ही चीज, ईमानदारी. तो सर वो ईमानदारी को साथ में लेते हुए योगेश्वरी मैम इतना साथ देती है. हमारा पूरा टीचिंग स्टाफ सर रात और दिन सिर्फ एक ही चीज पे ध्यान देता है कि सिर्फ चीज पे कैसे इम्प्रूव किया जाए, और इस इम्प्रूवमेंट के लिए ये सब कुछ आप ही से सीखा है सर. मैंने दिल्ली में रह करके जब भी आप आते थे, आपके साथ कितना टाइम मैं बिताता था सर, और जितना टाइम मैं बिताता था आपसे मैंने बहुत कुछ सीखा है ना. आप मतलब कहना चाहिए मेरा, मैं जानता हूँ कि एक यू आर द पायनियर ऑफ द होम्योपैथी सर, नो डाउट अबाउट इट. रेनू मित्तल मैम, आपने जो सीसीआरएच के लिए जो काम किया, हम हमारा भी एमओ जो आपके साथ है मैम, हम आपको एक बात बताना चाहते हैं मैम कि मैं जब भी किसी प्रेजेंटेशन के अंदर, पेपर प्रेजेंटेशन या कहीं भी हो जाता हूँ, मैं सिर्फ एक ही चीज करता हूँ. हमको एक ही चीज का जवाब देना, साइंटिफिकली हमको सामने वाले को सेटिस्फाइड करना है, जिससे क्वेश्चन मार्क नहीं लगे. हम लेते हैं किसी पेशेंट को, लेते हैं बिफोर एंड आफ्टर रिजल्ट, और सारा सब कुछ करके रेणु मित्तल मैम और आप लोग जितना इनिशिएटिव लेते हैं सीसीआरएच वाले, हमको हमारा प्रेजेंटेशन बनाने के लिए इतने साल बाद भी कि हम होम्योपैथी क्या है, होम्योपैथी कैसे एक्ट करती है, क्या करते हैं, एक एक मेडिसिन को दोबारा दोबारा करना पड़ता है। एक साइंटिफिकली हम अपने हिंदुस्तान के लेवल पर हम अपने आप को प्रूव कर पा रहे हैं, ये एक बहुत बड़ी बात है। और हमने उसी को बेस बनाते हुए हमारे बच्चों को, जो चाहे फर्स्ट ईयर से लेकर के हमारे, हमने ड्रग प्रूविंग के अंदर भी हमने आप लोगों के साथ काम किया है, एमओयू किया हुआ है। और हमारे बच्चे जो फर्स्ट ईयर से लेकर के फाइनल तक, एमडी पीएचडी तक भी हम लोग सारे बच्चों को इन्वॉल्व करते हैं। यहाँ से जो जाते हैं मल्टी हॉस्पिटलिटी हॉस्पिटल, हमारा राजस्थान हॉस्पिटल है मैम, हम उसके अंदर भी हम उन बच्चों को साथ ट्रेनिंग करते हैं, बड़े बड़े जितने भी डॉक्टर्स हैं उन लोगों के साथ, और होम्योपैथी को कंपेरिजन करके और जो सीखे। जो होम्योपैथी का बच्चा हमारे इंस्टीट्यूशन से निकल के आए वो बाहर, तो ये निकल करके आए, तो ये निकल के आए कि हम किसी के सामने निगाहें नीचे करने लायक ना हो, हम साइंटिफिकली अपने आप को प्रूव करें। ये करके हमने दिया है। इसमें सानी साहब का इतना रोल, ये जहां भी जाते हैं, जहां किसी को भी देखते हैं, किसी थीसिस के अंदर कहीं पर भी कोई प्रॉब्लम आ रही है, अपना पूरा टाइम देते हैं। ऐसे ही सीसीआरएच का भी पूरा स्टाफ मैम, पूरा ऊपर लेकर के कहना चाहिए, सुभाष सर से लेकर के और नीचे पूरा स्टाफ तक, सारे सब कुछ हम लोगों को कॉपरेट करते हैं। और बीती रॉय ने अपना करियर राजस्थान से ही शुरू किया था, और उन्होंने जो यहाँ से सीखा सिखाया वो सब कुछ जाकर के पूरे हिंदुस्तान के लेवल के ऊपर जाकर के अपना काम कर रही हैं, उनको प्रेजेंटेशन का काम कर रही है। और वो जो सारा कंक्लूड है, जो करके पूरे हिंदुस्तान से सीख करके आकर के हमको बताती है, हम उसको फॉलो अप भी करते हैं। इसमें जूनियर सीनियर वाली बात नहीं, अगर किसी जूनियर से भी सीखने को मिल रहा है तो बहुत अच्छी बात है। और हम ये इसी बात को लेकर के प्रिंसिपल हमारी मैम योगेश्वरी मैम, ये रात और दिन सिर्फ एक ही चीज में लेती है कि मेरा कोई स्टूडेंट मेरी निगाह नीचे नहीं कराए किसी भी तरीके से, जो भी करना है होम्योपैथी के लिए डेडिकेटेड है। कितना अभी हमने साइंटिफिकली हमारी की कॉन्फ्रेंस की है सर, हमने आपको बहुत मिस किया सानी सर। और सर उसके अंदर भी यहाँ पर इतना अच्छा प्रेजेंटेशन और इतने सब कुछ दिए, जिसमें सीसीआरएच पूरा था, एमसीएच पूरी थी, विथी रॉय आप खुद मौजूद थी, आपका पेपर वो आपका वो प्रेजेंटेशन भी था उसके अंदर। तो इतना अच्छा सब कुछ लग रहा है मेरे को। पांडा जी यहाँ जयपुर में राजस्थान में रहे, पांडा जी के लिए क्या कहूँ मैं, कि पांडा जी ने यहाँ आकर के ज्योति विद्यापीठ के अंदर अपना सब कुछ किया, लेकिन अनफॉर्चुनेटली वो यहाँ राजस्थान छोड़ के चले गए। पुनीत शाह जी ने भी अभी आज जो ज्वाइन किया हमको और सब कुछ किया, और वो आते हैं टाइम टाइम पे अपना बताते रहते हैं सारा सब कुछ एक्सपीरियंस। कुल मिलाकर के मैम हम एक बात करते हैं स्वास्थ्य कल्याण की तरफ से, डॉक्टर एस अग्रवाल की तरफ से, डॉक्टर मैम हमारी डायरेक्टर्स की तरफ से, सबकी तरफ से हम आपको सिर्फ एक ही चीज का वो देते हैं कि हम हमारे बच्चों को एक अच्छी शिक्षा। और योगेश्वरी मैम मैं आपको थैंक्स देना चाहता हूँ कि पूरा हिंदुस्तान के शायद ये पहला प्रेजेंटेशन है जो बच्चों को आप लोगों ने अप्रिशिएट किया है हिंदुस्तान लेवल पे, पोस्टर प्रेजेंटेशन। ये मेरे को ऐसा मेरी नोटिस में है कि पहला पोस्टर प्रेजेंटेशन इंडिया लेवल पर करें, उसके लिए बहुत बहुत और बहुत बधाई, तहे दिल से बधाई आपको। और मैं इस चीज के लिए आगे भी इस चीज को बताऊंगा। और ये अभी हमारी स्टार्ट है, हम सर इसमें जो कमियां रही हैं हम उसको और आगे बढ़ाएंगे, आगे बढ़ाएंगे और आगे बढ़ाएंगे। श्रद्धा मैम ने इतना इनिशिएटिव लेकर के इसके अंदर काम किया, मैं श्रद्धा मैम का भी बहुत बहुत धन्यवाद करता हूँ। और योगेश्वर मैम से कहता हूँ कि अब आप आगे रिजल्ट जैसा भी है बच्चों का जैसे किया है इसको इम्प्रूवमेंट करके, और सानी सर हम बार बार परेशान करेंगे, हम आपको बार बार परेशान करेंगे, रेनू मैम हम आपको भी बार बार परेशान करेंगे, बीती आपको भी बहुत परेशान करेंगे, बार बार जज बनाएंगे, बार बार करेंगे, और हमारी कमियां दूर करके हम इस आगे करेंगे। थैंक यू वेरी मच।
Thank you so much, sir. With this, we will be concluding our poster presentation competition for UG participants. I thank you all the participants, respected judges, for joining us. Results for the UG part will be declared at the end after round 2 of PG presentations. We will be taking a short break of 10 minutes. We will see you in 10 minutes to continue with our PG category presentations. I request all the PG participants to kindly be prepared after 10 minutes.
ବାପୁ ଆସିଲୁ ନାହିଁ ଆରମ୍ଭ ହେଲାଣି ମିଟିଂ ମୋର ତ ସେଇଆ ହଉଛି ଅନମ୍ୟୁଟ୍ ହଉନି ଆଉ ଫୋନରେ କଣ ହଉ ମତେ ଆସୁନି ତୁ ସେ କୋଉଠି ଅଛୁ ଯା
Your call has been forwarded to voice.
हेलो अच्छा कौन बोल रहे हैं कौन बोल रहे हैं ओ सॉरी सॉरी
All are requested to kindly join. We will be resuming with our round 2 of the competition. हुए होंगे, सबको अलर्ट कर दिया? चालू कर दो. Welcome back everyone to Online National E-Poster Competition 2024-2025. Myself, Dr. Kanika Agarwal, your MC for today. I hope we are ready for the next round of presentations from the PG category. I request Dr. Yogeshwari Gupta ma'am, Principal, Swasthya Kalyan Homeopathic Medical College and Research Center, to welcome our participants and introduce our guests and judges for this round. Handing over to you, ma'am.
Again, good afternoon, everyone. Dignitaries on this platform, again, Director Dr. Pankaj Sharma ji, our judges, my guru, Dr. J.D. Daryani, sir, Dr. C.V. Naik, Dr. B.P. Panda, all the participants, our organizing team. It gives me immense pleasure to welcome all of you on the online national e-poster competitions organized by our college, Swasthya Kalyan Homeopathic Medical College and Research Center under the theme Evidence-Based Research in Homeopathy, Bridging Science and Art. We have among us Dr. J.D. Daryani sir, former principal, MPK Homeopathic Medical College, Jaipur, former dean. He was former dean in Rajasthan Ayurveda University, Jodhpur, chairman Drug Proving Committee, Central Council for Research in Homeopathy, life member and organizing secretary Journal Homeopathic Medical Association of India and Asian Homeopathic League. He has received many awards, including Lifetime Achievements Awards. Another judge, we have among us Dr. C.V. Naik, former director of CCRH, former president in Homeopathic University. He authored 4 books, published more than 200 articles, presented paper nationally and internationally. We welcome you, sir. We welcome our third judge, Dr. B.P. Panda. He is principal of Parul Institute of Homeopathy and Research Hospital, Vadodara. He is member of Board of Study in many universities, published many articles and presented paper nationally and internationally. Today, we are here not just to share ideas, but to shape the future of homeopathic research. Evidence-based research plays a pivotal role in validating homeopathic practice, bridging the gap between traditional wisdom and modern scientific understanding. This is a unique platform where we bring together bright minds, passionate researchers, dedicated professionals to engage meaningful dialogue and exchange knowledge. Though this competition, we hope to encourage you to present your creative insights and innovative contributions that contribute to the greater body of the knowledge in this field. Now for a moment, again, I want to let you know about our college, Swasthya Kalyan Homeopathic Medical College, was established in 2002 under Puranmal Phula Devi Trust and inaugurated by Lal Krishna Advani ji. And Dr. S.S. Agarwal ji. Our vision is to provide sustainable, affordable, quality education and medical services, and mission to enrich the life of people by providing skill training and quality healthcare services. The college was started in 2002 with 60 BHMS seats. We are only college in Rajasthan who have MD in 7 branches and PhD in 3 branches. Again, I would like to extend a warm welcome to all the participants, judges, attendees. Your involvement and enthusiasm are what makes this event truly special. We look forward to witnessing the incredible posters that reflect the hard work, dedication, research, and you have invested in this field. Thank you for joining us. We wish all the participants the very best in their presentations. Thank you all. Thank you, Dr. Kanika. Over to Dr. Kanika. Thank you.
Thank you so much, ma'am. We will be starting with the presentations for the PG category. Rules are same for the PG category. That is, presentation time would be total 10 minutes, including 1 minute for presentation setup and introduction of participants, 7 minutes for presentation, and 2 minutes for question and answer sessions. Presenters kindly note time exceeding would not be allowed. Judges panel will have authority to cut the marks on exceeding time. Without further ado, let's begin with our presentations. I will be sharing all the presentations from my sides. Presenters kindly ensure that your video is visible to us all.
से भी ज्वाइन करवा देता हूँ हेलो हाँ मैं अपने वो थोड़े नेटवर्क इश्यूज आ रहे हैं मैं मोबाइल से भी ज्वाइन करवा देता हूँ इनको
Our first presenter for the PG category is Dr. Meera from Rajkot Homeopathic Medical College, Gujarat. Meera, kindly unmute yourself. Dr. Neera.
Hello.
You are audible.
Am I audible, ma'am?
You are audible. Are you ready?
Yes, ma'am, I'm ready. Shall I
Kindly start
start?
with your... Yeah, kindly
Okay.
start.
So, good afternoon to one and all present here. First of all, I would like to thank Swastikalan Homeopathic Medical College and Research Center for giving opportunity to present at the national level poster presentation competition. Beginning with my presentation, of my topic is a comparative experimental randomized interventional single-blinded and prospective study to assess the effectiveness of administration of individualized homeopathic medicine through oral route versus olfactory route in the management of rhinitis. As we know, rhinitis is a global problem and is defined as an inflammation and swelling of the mucous membrane of nose. This study was done by reviewing the literature, wherein it was observed that according to World Health Organization report 2007, the global burden of rhinitis was estimated to 400 million, and the prevalence ranges between 10% to 32% in Asian Pacific region. In conventional system, treatment of rhinitis includes antihistamines, international corticosteroids, and immunotherapy. And even after using all these type of treatment methods, only and only short relief of the symptoms were observed. As we all know that homeopathy treats the patient as a whole individual, and also homeopathic medicines, when given orally, definitely proves to be beneficial. In the aphorism 151 of the Organ of Medicine in the 5th edition, it is also mentioned by Master Hahnemann that olfactory route administration medicine through olfactory route gives a very beneficial result than the oral route. In cases where olfactory route has been chosen for the route of administration of medicine, it has always been proven efficacious. So, research study was taken on the basis of this all review of literature with the aim to compare the efficacy of homeopathic medicines administered via oral route versus olfactory route in managing the pediatric rhinitis and assess the impact on the system's relief, patient satisfaction, and safety using RCAT scale, that is Rhinitis Control Assessment Test. Uh, Moving on to the materials and method, the type of study, which that is the study design, that was comparative study, comparing the oral route and olfactory route. Randomized, prospective, single-blinded, experimental, and interventional study it was. This study has been taken place at Sainath Homeopathic Hospital attached with Rajkot Homeopathic Medical College, Parul University. The inclusion and exclusion criteria were taken up into the consideration, where the inclusion criteria was various types of rhinitis, which was observed in the different patients. The sample size was kept 40, 20 patients each in type A and type B, that is group A and group B. Wherein in group A, the medicines were given through oral route, and in group B, the medicines were given through olfactory route. In exclusion criteria, the main thing which was observed, kept into the mind, that was the pathological cases were not taken, where some overgrowth or any malignant conditions were seen. The patients who were not regular in the follow-up were also dropped out, and the 40 sample size was kept into the mind, where two groups of 20 each A and B were taken into the consideration. Case taking and review of reports and examination was done. And at the end of the case and after prescribing the medicine, pre-score and post-score of rhinitis control assessment test was done. That is analytical scale, RCAT scale was used. The pre-score also was maintained, and the post-score after the treatment was also maintained. Selection of remedy was done according to the homeopathic law, and administration of it through oral route in group A and olfactory route in group B was done. Follow-up criteria was taken at 7 days to 14 days to 21 days as per the need of the case. It was taken. Data collection and analysis were done, and at the end of the study, statistical analysis was done with the help of paired t test, wherein it was taken into the consideration about the p-value, that whether that p-value is coming according to the hypothesis or not. Accordingly, two hypotheses were constructed, null hypothesis and alternate hypothesis. And after the analysis, statistical analysis, it was seen that the null hypothesis was rejected, whereas the alternative hypothesis, that is the efficacy of olfactory route, was seen beneficial. The results have been also displayed, and the observations and results are also displayed, where age-wise distribution has been shown. Uh, the gender-wise distribution of the cases has been shown. Potency used in the cases, whereas most of the cases 200 was beneficial, and few of the cases 1M was also beneficial, and in some of the cases 30 potency was also seen. Presenting complaints have also been taken into the consideration and observation. If we see on to the right hand side, the charts have been shown regarding the comparison of oral route versus olfactory route. We can see RCAT score is a progressive score, where the score, if improves more, that is, the score increases, then improvement is seen. So in the first chart itself, we can see the blue colored line and red colored line. If the olfactory scores are already higher, that proves that olfactory scores has been showing the improvement via olfactory route. Second is comparison of change in RCAT score. We can see red line, that is the baseline, and above there we can see the improvement in the scores. Last, then, it is the frequency of homeopathic drug prescribed at the baseline. Allium cepa, Sabadilla, Netramur were seen in frequent cases. In some of the cases where allergic rhinitis was observed, that in histaminum and ars alb was also seen. In few of the cases, Pulsatilla brand and Nux vomica has also been seen. Concluding my presentation, that is, the olfactory administration of homeopathic medicines provided faster and more significant improvement in managing the rhinitis compared to the we can say the oral route. While both methods were effective, the olfactory route may serve as the initiative, we can say, may serve as alternative treatment strategy due to its quicker relief and greater patient satisfaction. Further research is required to evaluate long-term benefits, as the sample size was only 40 taken over here, 2020 in each of the group. But we can take more of the sample size of about 100 and dividing it into 50-50 sample size. So that was the limitation of the study. Important references which were referred during the study were Harrison's Principle of Internal Medicine, Volume 1 and 2, 16th International Edition, Samuel Hahnemann, Organ of Medicine, 5th edition, William Borick, Materia Medica, Organ of Medicine. So these were the references which were used. Out of this study, it was observed that the RCT score has been improved in all of the cases. So first thing, it is proving that efficacy of homeopathic medicine in management of rhinitis, and in olfactory route, the number of significant cases, significant improvement cases were seen more than the oral route. So it is again establishing the fact that when the medicines have been administered through the olfactory route, it proves beneficial more than the oral route. So concluding my presentation, I would request Kanika ma'am for the.
Thank you, Neera. We will be now beginning for the question and answer round. I request Jaydeep Daryani sir to kindly ask any questions.
Neera,
Yes, sir.
I must congratulate you because you have taken up that project which earlier, long back, I've taken and undertaken for asthma. No doubt the results are encouraging. But in your case, the selection of potency, I mean, there is no fixed criteria which potency you are using and at what range you will going to change the potency. Because 30, 200, and 1M. How will you assess? Initially, I should give the 30 or 40, 200 or 1M. Is there any parameter for that?
The parameter for selection of the potency were selected on the basic principles of the posology, which has been explained by Master Henneman in the 5th edition of Organon of Medicine. This study I have taken as a pilot study. After observing the result of which potency.
Just listen. Whatever the instructions are given in posology, that is good enough. But for you, 200, 1M, and 30, it was a random or gradual?
No, sir. No, sir. It were taken on the basis of the susceptibility scale, according to age, according to the pathological changes, according to
Now, this seems to
I
be,
can say the response of first prescription.
this seems to be the mysterious. It is not open because at where the 1M potency should be given at what age, you must prepare a chart or table where you can say the 1M potency was effective for this group and 200 was for this group. That would be a better.
Yes, sir. Sure. I'll notice or I will take a
Now,
note of it.
there
And
are
in
there are different types of administration of drug, and olfactory is one of them. But for
exactly.
rhinitis, simply you open the bottle. I think it is practically, it will be not.
Actually, in the footnote of aphorism 151, Master has also explained that if it is not possible to give through olfactory route through nose, we can give the olfactory administration through mouth also by betwixting the between the two lips.
That is
So
the point.
in some
That
of
is
the
the
cases
point.
where there was presence of symptoms into the nose, we were also giving it to the mouth also. So olfactory and oral both were compared side to side.
Now, which was on the higher side? Which you recommend? Your study has proved that oral is
According
more.
to yes, on the basis of my personal, the selection of this study was on the basis of my personal experience itself. I once used to had, when I was in the UG,
Well,
I
your
had headache.
good efforts have been taken from your side, but you need some guidance, and that guidance will help you in future to for further
I would
studies.
preferably suggest that olfactory was being the efficacious according to my study and according to my views also. And it is, we can say, giving faster relief in the such an era where where the patients are expecting faster results. So olfactory route would help, and this evidence-based study also helps us to identify that olfactory route is giving a faster improvement in the cases. So this would be the concluding points.
Thank you.
Thank you, sir.
Thank you,
Thank you
sir.
for your.
Nayak, sir, any questions from your side? Dr. C.B. Nayak, sir? Sir, we are unable to hear you. Kindly unmute yourself.
Am I audible now?
Yes, sir, you are audible now.
So I must compliment Dr. Nirav for your selection of this topic.
Thank you, sir.
Before that, also I must compliment this management and principal for taking up this measure. Taking up this measure, this is of the first kind in the India probably. So I must compliment her. Then coming to Dr. Nirav, I have so many things to tell you. Number one, you just told you in your slide you are showing effectiveness. In your slide,
Yes, sir.
I'll go one by one. Coming to title itself, you are telling it is effectiveness, to study the effectiveness, but again you are telling efficacy. So you must know there is a difference between efficacy and
There is a difference
effectiveness.
between efficacy and
Even
effectiveness. Yes,
even
sir.
future, you must be conscious and cautious about this using these words. Then coming
Sure,
to
sir.
aim and objectives, you have clubbed together. You have clubbed together aim and objectives. There is a difference between aim and objectives. Do you know that? What is the difference between aim and objectives? Can you tell me?
Yes, sir. But because
Please,
of some space constraint over here,
then please
I
tell me.
have clubbed them.
Please tell me, because our discussion, I think other PG scholars, they're also viewing this and hearing this probably. So I hope there will be also benefited. Please tell me the difference between aim and objectives of a study.
Aim is somewhat that is what we want to prove with the help of this study.
Then
And
objective.
And objectives are the elements which would be helpful for getting up to that aim. Suppose, for an example, in my study itself, my aim was to identify that whether this study, or whether we can say this assessment of is efficacious or not. But to make it evidence based, but to make it we can say scientific, I have used RCAT scale also, and to identify that whether this would be correct or not, that objectives are including into that particular scale. Another thing is, aim is a broad statement of the study's purpose, while an objective is a specific and measurable goal that helps to achieve that particular aim.
Very
Aim
good, very
would be
good.
the
You are
general
absolutely,
statement which would
Dr.
define the
Nirav.
purpose of the study.
Dr. Nirav, you are absolutely correct. I must
Yes,
compliment
sir.
you. Many PG students, they do not know the difference between objective and aim. Let me tell you, just to summarize, the aim is to, that is the other word is goal. Means what is your goal to achieve in the study. Then the objective is to how to achieve this. How to achieve the objective. Methods you are using to,
Exactly, sir.
the methods you are using to adopt to reach at the goal, to achieve the goal. That is the wage. Here your objective is, what is your objective? How to measure the efficacy of the or compare both the olfactory route and
olfactory
odor
route
route by adopting that RCAT scale. So that is the objective. So you should in your slide you should
exactly
differentiate between aim and objective. That would have been clear for future. Let
because
it be
of that
message.
space constraint, I just plug it up.
Then you should have also, while explaining, you should have
Yes,
also
sir. I will
explained.
take care of that. And
Please take care of. Then let me tell you, you told this is a pilot study, but this is never a pilot study because you have taken 40 sample size. 40 sample size cannot be told as a pilot study. Say 10. Suppose you are
actually,
taking.
pilot study for further study.
No. I'm telling you
Pilot
pilot study.
in the
Pilot study
concern of further study.
Then please listen to me. In pilot
This
study,
is
your
my
sample
full-fledged
size.
study, which I
Please
have
let me
taken
finish.
for
Let me
9
finish.
months to
Let
1
me
year
finish.
of
Let
period.
me finish. Let me finish. That is
Yes,
different.
sir. Yes,
That
sir.
is time. That is time duration. That is time duration I was telling. I'm talking of sample size.
Yes, sir.
40 sample size is not adequate for your study, nor and this number is more for a pilot study. It is less for a full-time study, original study. So when you are taking a pilot study, I'm telling you, a pilot study where there is in a particular research project where there is huge cost involvement. manpower, this expertise, instrument, equipment, and loss of total huge amount of cost involvement is there. People should take a pilot study, taking only 10 or hardly 20 samples. Then after that study is over, if they get some feedback, then they should go for a full type of study, original research, RCT, adopting the RCT scale, which is called the gold standard or thumb rule of original research. Then coming to, then so sample size should be more in future. Sample size be more. Another thing, you have taken, you are comparing oral route and olfactory route. So now the sample size for each group is only 20. So it is very, very inadequate. So you have to take care in for future. Then yes, limited. I'm much coming to conclusion. Sir, outcome measures. Your outcome measures are three. One is patient, sorry, symptom relief. Second is patient satisfaction. Third is safety. It is a very good thing. Your outcome measures are very good. I must compliment you. You have done that. Symptom relief you have already mentioned.
Thank you, sir.
Patient satisfaction you have mentioned in both the routes, but safety you have not mentioned. When your outcome measures are three,
Okay, sir.
you have to write down all the outcome measures in your result section. That, but you have nicely mentioned. And also presented both the outcome measures. One is symptom relief. The second is patient satisfaction. But safety thing you have not mentioned. Am I clear? But don't. I'm again telling you,
Yes,
Dr.
for
Nirav.
safety concern.
Yes.
Yes, sir.
Safety means with these medicines. I think you, because these all the medicines potencies, Dr. Daryani ji, he has already delivered to you. So I'm not going to that potency area. But
Exactly, sir.
going from 30 to 200 to 1M, it's not bad also. In many research studies, researchers have taken only first 30, then 200, then 1M. But some people, some researchers, they identify where to give 30, where to give 200, where to give 1M. And if they are giving all medicine according to homeopathy principles, what you have told, then you could have mentioned that yes, we will start from 30, then we'll go in the higher ascending order. That is another thing. So lastly, I will
May
tell
I,
you.
sir?
Yes.
Sir, I want to tell regarding that potency
Yes.
that if I have, when I was preparing the review of literature, at that time I went through many of the articles in which in few of the articles some of the potency were fixed. But when that come to the outcome measure, at that time, suppose if 30 potency is good for one patient, but 30 potency susceptibility is not good for another patient. So
Right.
in that case, my result would be variable. But
Right.
if I am open to all the potencies, then according to the susceptibility of the patient which is occurring in front of me, I would be giving that particular potency which is required to that patient particularly. Then my result, then my
And that
observation
is
would
good. That
be
is, I got your point.
unbiased.
That is a good thing.
That's why I have not fixed up the potency.
That is
Thank
good.
you, Neera.
Then that is good.
Uh,
Let me tell you my last question. When you are given on the basis of the susceptibility, you are giving 30, 200, 1M, then there will be another grouping. 30 to how many patients, 200 to how many patients, 1M to how many patients, or you have gone in ascending order, then you have to give a comparison.
No,
So you tell
exactly,
me.
sir. That's why I told this is not actually a pilot study, but I told in the concern that this can be treated as a pilot study for
No.
exploring the further, we can say, aspects.
No, you cannot
Like
tell it is a
if we,
it is exploratory trial. It is exploratory trial.
yes,
But
exactly.
anyway, the last question, last suggestion is you have to this is good for what I'm suggesting. This is for the how to write an article in the research article. You have told the limitations of the study. You have written in the conclusion, but limitation of the study should be written under discussion, and future suggestions for future research should be written under conclusion.
Right.
You are absolutely right, sir. But due
Okay.
to some space constraint
Right.
of the,
I
that's
got
why
your
I
point.
have not mentioned it
Thank you
differently
very much. You are a
because I wanted to present all this in
young
a
man.
one slide itself. That's why.
You are a young boy. My advice to you will be go for writing articles.
Thank you, sir. Thank you very much, sir.
Okay,
I have read so many articles of yours from the
Thank you, Neera.
CCRH website.
Okay,
Thank you,
Thank you.
Neera. Requesting
Thank
BP
you.
Panda, sir, for any questions to the presenter.
I am audible, madam.
Yes, sir. You are audible, sir.
First of all, I am very much thankful for giving me opportunity to be a judge of this poster presentation. I pay my gratitude to my teacher, Dr. Chaturbhuj Nayak Daryani sir, and already they have passed the comment about the presentation. And Dr. Nirav, you have emphasized on pharmaconomy. Am I right?
Yes, sir.
So that is part of posology. So you try to explore that the route of administration, especially the olfactory route, that is better route to treat specifically of rhinitis or any other diseases.
That is efficacious for all the other diseases also, but I have focused specifically in the case of rhinitis, as we can develop some of the homeopathic nasal spray, which would be a further kind of a exploratory study on the basis of the results of my particular study. So this was we can say a secondary objective which can be taken for further studies also. So we can also explore for other diseases also the efficacy of administering homeopathic medicine through olfactory routes, sir.
Very good. I appreciate the ability of answering. And
Thank you, sir.
I would like to request you, please note the advice of Dr. Daryani sir
Sure,
about
sir.
your
Yes, sir.
potency as well as about different type of study. As Dr. Nayak told, that pilot study is not more than 20, 30 likewise.
20 straight. Yes,
It
sure,
is
sir.
limited. On the basis of pilot study, you have to go for extensive study, right?
Exactly, sir.
Second thing, I want to know one answer from you. So, what is the uniqueness of your topic? Of your subject?
Uniqueness of the topic is my topic has two things in its uniqueness. First is about the administration through olfactory route. In many of the diseases, we have seen the oral route is giving beneficially, but in the era which we are right now we are there, it is every patient is requiring fast relief. So whether to see that olfactory route is giving faster relief, so this is a evidence based study. And how to say that this is evidence based study? So for that I have used RCAT scale, that is rhinitis control assessment tool. So statistically, scientifically, we can prove that yes, with the help of reports also which have been included in my study, we can prove that yes, homeopathic medicines when administered through olfactory route are giving beneficial results to patient and very faster relief to the patients. So this would be my conclusion for uniqueness of my study.
Thank you, Nirav.
Thank you, sir. Thank you for your guidance, sir. Thank you, Nayak, sir. Thank you, Dayani, sir. Thank you, Panda, sir, for this comments.
Thank you so
Dr.
much,
Konika,
Neera.
Dr. Konika, Dr.
Yes, sir.
Konika, one last question,
Yes, sir.
to Dr. Nirav. Nirav, you have taken this RCAT scale for assessing symptom relief. Very correct. Am I correct?
Yes,
For
sir.
assessing symptom relief, you have taken this RCAT scale, right?
Yes, sir.
For patient satisfaction, that was also your objective. And have you taken any scale?
Quality of life was assessed with this thing, but
So which
as it
scale?
was
Which
becoming
scale?
broadened up, so I have not included over here.
So tell me-
WHO guidelines of 2004 quality of life index is there, QOLI, that was also used with this particular study. But as I am focusing on to the particular aspect of symptom relief and also I have here presented with RCAT only.
And what is that the full name of that scale suggested by WHO?
Quality of life index by World Health Organization 2004.
No,
Appendix
beta.
is
The
there.
servicer को join कराना है. हाँ भाई.
No. What I'm asking you, what is the name of the scale to assess the quality of life? I'm telling you the answer. This shortage
QOLI
of time.
scale, sir. QOLI scale.
I'm telling you, WHO QOL BREF. WHO QOL BREF, BREF. And it has four
Yes,
domains: physical domain, psychological domain,
Exactly, sir.
social domain, and environmental domain. And total number of questions are there 26.
Yes, sir.
Okay. But I must compliment you. Go on writing, making more presentation. Thank you. Next.
Sure, sir. Thank you, sir.
Thank you so much, sir, for your expert advice. I have a humble request to all our judges to kindly keep the question answer round to the point, as we have 6 more presentations to be presented, and this session of question answer has exceeded to 20 minutes. It's my humble request to kindly keep the questions concise and to the point, and presenters, you are kindly requested to answer precisely, as the
Dr.
duration
Konika,
you have been
Dr.
given is only 2 minutes.
Dr. Konika,
interrupt you.
Yes, sir.
I interrupt you.
Yes, sir.
I interrupt
Yes,
you.
sir.
This what I observed He's the opening batsman. Now the opening batsman either to wicket down or to make a century. It depends. But categorically, one thing which I have observed in last, but I hesitate to say before you all, Dr. Nirav, be polite.
Sure,
Don't
sir.
show
Sure.
yourself to be adamant because you are learner, beginner. We are
Exactly, sir.
advising you. We are
Yes, sir. I
advising you
am taking it
whatever
all in
shortcomings
perspective.
are there in future, you will take care.
Sure, sir.
You know each and everything, but you have clubbed all. That's why this
Sure,
thing has occurred. Thank you.
sure, sir. I'll take a note of it, sir.
Dr. Konika, I'm drawing the attention of your principal and Dr. Agrawal through you that you are telling now we have to concise to limit our questions to the time. I don't agree with you. I have a different opinion here because if your college wants that it should be meaningful, it should be effective, it should be somehow beneficial for the fraternity and the professionals. The question answer session should be given, should be enlarged, should be given more time so that that way other people can learn from it. Not only the presenter can improve his knowledge, but also other people can gather knowledge how to do these things. I don't agree with you to confine. You please increase the time limit. This is my suggestion.
Okay, sir. We will take this in consideration as objective of every event should be fulfilled. Now, moving ahead, it's my pleasure to introduce to you all Dr. Sarvesh Agarwal, sir, Chief Executive Officer of Swasthya Kalyan Group of Institutions and President of Rajasthan Hospital. Sir has joined with us. Handing over you to sir. Dr. Sarvesh, sir, kindly join us. We are waiting. Sir, you are visible.
नहीं टाइम नहीं दे सकते भाई उसमें बीच में
Sarvesh, sir, Chief Executive Officer
Yeah,
of Swasthya Kalyan Group. I welcome you, sir.
thank you, thank you. It's a pleasure to be here amongst the luminaries of homeopathy science of the country, and of course, there are some of them who are nationally and internationally renowned in the field of homeopathy. I think it's a great initiative that an online e-poster competition has been organized for evidence-based research in homeopathy. I believe that as people of science, the one thing that we should always worship, that is evidence-based medicine or evidence-based conclusions that we arrive upon. For us to build our credibility as a science, for us to build our credibility as scientific practitioners, there has to be enough research in place, both randomized as well as blind and double-blind studies with controls trials to authenticate our findings and to impose that findings on the world. It, I think, is an absolutely stellar effort by the entire team of Swasthya Kalyan Homeopathic Medical College, as well as all our honorable judges who have joined us from across the nation today on this online platform to provide the students an avenue to have their posters released. It will not just build their clinical and research-based acumen, but will also provide them a much-needed confidence to go out there in the professional world and leave their mark on it. I am hopeful that this entire event will not just be a single event, but will mark a continuous effort wherein these kind of things are organized on a periodic basis to give a much needed respect to our science. Thank you, everyone. And I hope you have a wonderful session.
Thank you. Thank you very much for your inspiring speech.
Thank you so much, sir. Moving ahead to our presentations, I will be sharing slides for our next presenter. Dr. Meghna, kindly be ready. Dr. Meghna is from
Yes,
Maxon
ma'am.
Homeopathic Medical College. Are you ready for your presentation?
Yes, ma'am, I'm ready.
Your time starts now.
Okay, ma'am. Good afternoon, everyone. Myself, Dr. Megha, and I am currently pursuing MD in homeopathic pharmacy from Bexon Homeopathic Medical College. The title of my research study is Assessment of Homeopathic Medicine, Silesia and Natrum muraticum on Growth, Yield and Biochemical Parameters of Potato Plant under Salt Stress under the guidance of Dr. Meenakshi Ambani Ma'am, HOD of Bexon Homeopathic Medical College. So, the introduction. As we all know, potato is the fourth most staple crop which was consumed after rice, wheat and maize. Potato is very beneficial and also provide national security for the increasing population of the developing nation. However, increasing incidence of abiotic stress due to climatic change such as heat, drought and salinity could limit the potato production. Among different biotic stress, salt stress is one of the major crucial factor that hinders the production and productivity of the potatoes. So in my study, I choose Natrum muraticum and Silesia as a potentized homeopathic medicine which will be cost effective, environment friendly and will be a friendly substitute that will increase the productivity and nutritive value and thereby eliminating the harmful effect of salt stress in potatoes. The objective of my study is to study the usefulness of different potencies of homeopathic medicine, Silesia and Natrum muraticum on growth, yield and biochemical parameter of potato plant under salt stress. My study was conducted in Sharda University Agriculture Department. Before sowing of the seed, soil analysis was done. As per the soil analysis report, the pH of the soil is alkaline and 9. And also, there are high level of sodium already present in the soil. So, there is no need for additional salt stress as there is already salt present in the soil. After that, the field is divided into 16 rows. Now we come through, we understand my study through this flow chart. The potatoes are divided into two groups, intervention group and control group. Intervention group has two medicine, Natramur and Silesia, and control also have two groups, alcohol control and water control. In Natramur, medicine is given through soil drenching and foliar spray. In all the control and medicine is given through soil drenching and foliar spray. Both the methods are used. The potencies which was used were 15C and 30C of both Silesia and Natramur. The methodology include the intervention group. In first category, the soil was treated with homeopathic medicine using soil drenching method. 5 drop of medicine is diluted with 50 ml of water. In second category, the sample received the water through foliar spray method. 1 ml of medicine is diluted with 99 ml of water. In control group, there are 4 control. The first control receive water through soil drenching. The second control group receive water through foliar spray. The third control, which is alcohol group, which receive alcohol through soil drenching and the concentration remains same. 5 drop of alcohol were diluted in 50 ml of water for soil drenching group. And the fourth control is alcohol plant which receive alcohol through foliar spray and the concentration is 1 ml of alcohol were diluted in 99 ml of water. After this data collection, the data was collected
on 45, 75 and 120 day of after sowing of potato and after harvesting of potatoes. On 45 day, the data was collected for shoot length and the number of leaves of the plant before treatment. On 75th day, the data was collected for shoot length and number of leaves after the treatment. On 120th day, photosynthesis pigment was measured with the help of spectrophotometer, and after harvesting, number and weight of tuber were measured. The observation is that both Silacea and Natrum muraticum significantly enhance the growth and yield parameter as compared to water and alcohol group. And Natromure 15C exhibit the highest average of shoot length, number of leaves, weight, and number of tuber in both soil drenching and foliar group. In foliar spray group, Silacea 7C has shown highest chlorophyll pigment, while in soil drenching group, Natromure 15C and Silacea 30 show the highest chlorophyll pigment. The p-value, the ANOVA is used for statistical analysis. The p-value obtained after using ANOVA of all observation are less than 0.05, which is significant, which is statistically significant. Now we look at the first figure, the first flow chart, which show the shoot length. In this, the Natromure 15C show the highest shoot length in both soil drenching and foliar spray group as we compare Natromure 15C with our control, that is water and the alcohol. In all the flow charts, number of leaves and in tuber weight, tuber number, in all these group, Natromure 15C has show the highest effect as we compare them to our control group. And in chlorophyll flowchart, chlorophyll में Silacea 7C have shown the highest highest chlorophyll content as we compare to our control groups. The conclusion of the study was homeopathic medicine Natrum muraticum 15C potency have beneficial and effectively mitigate the negative effect of salt stress on potato plant, promoting enhancing growth, yield, and photosynthesis pigment. And these findings highlight the potential of integral homeopathic medicine into agriculture practice to improve crop performance under challenging environment conditions. These are the photographs of my research study. The first photograph showing that I am collecting samples from the field, after which the soil is grind and sample of the soil was sent for the analysis, after which the potatoes are taken from the variety which I have choose is Kufri Ganga variety of the potatoes, and the field is divided into 16 rows, and after which the potatoes are sowing in the field, and medicine is prepared in our laboratory. That is, I have used 7C and 15C medicine. So 7C medicine is prepared from 6C, मतलब नेट्रम्योर 6C and Silacea 6C से हमने नेट्रम्योर 7C and नेट्रम्योर 15C prepare किए. Then medicine is given to plants through soil drenching and foliar spray. Both methods are used. And for photosynthesis pigment were measured, which was measured with the help of spectrophotometer, and all the parameters of the plant are after harvesting, number and the weight of tuber were measured. So thank you so much.
Thank you so much, Megha. Now on to our question and answer round. I request Taryani sir for the questions.
Well, Megha,
yes, sir.
Your presentation was very good. You tried your best.
Thank you, sir.
And I'm surprised that instead of the human being, your trial was on agro.
Yes,
and
sir.
that too with potato. but overall, your aim and objects have achieved. Are you satisfied with the aim and with as well as with the objective? What
Yes, sir. Sir, I am satisfied. Sir,
with the
I
both? But you have given nothing in that way. 50C, 15C will be given to that category, and 12C will be given that category, and 7C will be given this category.
sir randomly मतलब sir
But
field
now you are giving a message to the farmers, to the agro field,
yes
what they should understand. They should also randomly use 15C or 7C or 12C. As far as Silesia and Natramure is considered, Silesia, where lack of assimilation is there. Even eating a good food or good diet, but it is not properly assimilated. This is the main physiological point in that way. Secondly, in case of Natramure, whatever it is giving, it is going downward, downward, downward. Deficiency. There is a deficiency and there is physiology. There are two different things. Deficiency is soric and growth retarded, stagnant. It's towards that side. So now how will you compare both where Natramure should be given and where the Silesia is to be given?
sir most of the studies में नेट्रोम्यूर यूज हुई है फॉर सॉल्ट स्ट्रेस लेकिन सर मैंने
मैं नहीं हम दूसरे को कॉपी कर रहे हैं या अपने जेन्युइन एफर्ट्स बना रहे हैं
नहीं सर जैसे मैंने अपनी स्टडी के बाद भी कंक्लूड किया है तो नेट्रोम्यूर 15C पोटेंसी में मुझे बहुत अच्छे रिजल्ट देखने को मिले हैं अगर मैं कंपेयर करती हूँ उसको अपने वाटर कंट्रोल या सर अल्कोहल कंट्रोल के साथ नेट्रोम्यूर 15C पोटेंसी और
मतलब there should be a guidance from your side कि from this stage I have picked up this much of data and now further I recommend there should be a large study and so that the last conclusion can be taken up. That is lacking in your point. Anyway, you have tried your level best. Pass on to next judge, please.
Thank you, sir. CB Naik, sir, any questions from your side?
Yes, I must also compliment Dr. Megha for this nice presentation. And your former speaker, he has dealt with this in vivo trial, and you have presented an in vitro trial in plant model, which can be also done in other models. Also, laboratory model can be done, and this agrohomeopathy, the area agrohomeopathy, veterinary homeopathy, these are the areas where further studies are required, and with greater or more stronger study designs. And this is a good thing you have done, very good thing. I'm really very much satisfied with your presentation and also selection of the topic. Now, a few questions with you.
yes sir
One is, what is the basis of your selection of Natramure and Silesia? One thing you are telling that most of the studies you have seen that results were good, fine with Natramure or Silesia. You told probably Silesia or Natramure.
नेट्रोम्यूर
Natramure.
yes
So, what is the basis of your selecting? Then why there is replication? If you have already done a study, if others have done a good studies on Silesia and with good results, then why there is replication?
Sir, in previous studies, I found these three potencies 7C, 15C, 30C. These are the most effective potencies which they mention. तो सर
Right.
I use मतलब सर मैंने ये तीनों फिर इसलिए चूज करी कि मैं देखना चाहती कि इन तीनों में से भी कौन सी पोटेंसी सबसे बेस्ट है और
Right.
सर साइलेशिया मैंने इसलिए मेडिसिन जो सेलेक्ट की है सर, उसका बेसिस ये है कि जो एग्रीकल्चर यूज करते हैं वो सिलिकॉन डाइऑक्साइड यूज करते हैं फॉर रिड्यूसिंग द इफेक्ट ऑफ सॉल्ट स्ट्रेस। तो सर जो हमारी मेडिसिन है साइलेशिया, वो भी सिलिकॉन डाइऑक्साइड की ही पोटेंटाइज फॉर्म है। तो मैंने इसलिए होम्योपैथिक मेडिसिन साइलेशिया यूज करी है अपनी स्टडी में, टू सी वेदर इट इज यूजफुल in mitigate the adverse effect of salt stress in potato plant.
So after application of this natrium and silica into the soil, you have measured the that is shoot length also. Have you measured the root length?
No, sir. Sir,
Why?
my parameters are shoot length and number of leaves, and sir, chlorophyll
So you
pigment.
confined. So you confined only to this shoot, not to root.
Sir, root
Number
में
of
तो sir,
then
root
shoot length, then number of leaves, then number of flowering time. Did you take flowering time?
no, sir. Sir, my parameters is shoot length, number of leaves, chlorophyll pigment, and sir, after harvesting of potatoes, number of potatoes and weight of potato tubers. These are my parameters.
That is good, but you must identify all these things under your aim. You should divide your objectives into two: primary objective and secondary objectives, or aim and objectives. That you have not done. You have written on only a small line objective. In future, when you make a presentation, try to improve it. Write down primary objectives and secondary objectives, and all these parameters you are telling that photosynthesis parameters, other parameters for measuring the leaf timing of number of potatoes, all things will come under secondary objectives. That is fine. So have you heard of one another plant study was done? That was on lettuce plants. That was on lettuce plants in the past. When you have done literature review, did you come across this study? Lettuce plant, study on the lettuce plant with some of the drugs like probably arsenic, phosphorus, silicia, probably. I'm not recollecting correctly, but this was a very good study, probably done abroad, not in India, abroad. There, this study was done both on shoot length, then yield also, both shoot and root. So whenever you are making a presentation, it should also be thorough about the previous studies done in this area. But I must compliment you and your guide also. Your guide, she's a brilliant scholar. I know her. She has a good presentation also. She's also my co-author in some of the articles. But no, I'm not prejudiced. I'm not prejudiced that because I was director professor in Baxter, I'm supporting you.
Yes, sir. Yes, sir.
So anyway, I must compliment you. Thank you, Dr. Daryaneji, Dr. Pandaji. Don't think that I'm prejudiced.
Thank you, sir.
I am telling both the plus points and negative and minus points also.
Yes, sir. Yes,
And
sir.
thank you so much. Thank you so much. Now the term of Dr. Ponda.
Dr. Megha.
Yes, sir.
First of all, I appreciate that you have conducted your research in agrohomeopathy.
Yeah, thank you, sir. Thank you.
And in my college, we have completed a research in wilt disease and role of natrium.
Yes,
so I want to know about your literature review and how you got the inspiration to do such type of research.
सर फर्स्ट ऑफ ऑल तो सर जो मेरी गाइड है उन्होंने इनिशिएट किया था कि हमें एग्रो होम्योपैथी में रिसर्च करनी चाहिए। सर फिर मैंने लिटरेचर रिव्यू शुरू किया। सर मैंने आर्टिकल्स गूगल स्कॉलर पे सर्च किए कि ऐसी कुछ स्टडीज मिली हुई हैं क्या। तो सर नेट्रोम्यूर जो मेडिसिन है उस पर काफी सारी स्टडीज मिली मुझे सॉल्ट स्ट्रेस को लेके। लेकिन सर मुझे साइलेशिया मेडिसिन पे मतलब सॉल्ट स्ट्रेस की स्टडीज नहीं मिली। साइलेशिया जो मेडिसिन है वो ओवरऑल प्लांट के एज ए हेल्दी टॉनिक की तरीके से यूज की जाती है। लेकिन सर जब मैंने एग्रीकल्चर वाले डिपार्टमेंट की भी मैंने आर्टिकल्स देखे तो सर उसमें वो लोग सिलिकॉन डाइऑक्साइड यूज कर रहे थे। तो सर फिर मैंने देखा कि हमारी जो साइलेशिया मेडिसिन है वो भी सिलिकॉन डाइऑक्साइड को ही पोटेंटाइज करके बनाई गई है। तो सर इस वजह से मैंने साइलेशिया एंड नेट्रोम्यूर मतलब कंपैरेटिव स्टडी ये मैंने सोचा कि ऐसे करके देखते हैं क्या रिजल्ट मिलता है।
Another question, according to Avogadro's principle, there is no existence of quantity inside the medicine after 12C, right?
Yes, sir.
So, as Daryani sir ask you that silesia is prescribed where there is lack of assimilation, not because of want of food, right? So, whether your objective is to administer natriumur or silicea, whatever it may be, in each and every cases or in selected cases?
Sir, in selected cases.
So how will you discriminate?
मतलब सर, मतलब सॉल्ट स्ट्रेस के केसेस में
मेरा कहना ये है कि आप कैसे डिस्क्रिमिनेट करेंगे कि कहाँ पे मेरे को नाट्रियम देना है या नहीं देना है। एक फार्मर आपके पास आया है, आप कैसे आप डिस्क्रिमिनेट करेंगे, आप या नाट्रियम दो या सिलिसिया दो, क्या पैरामीटर क्या है आपका?
नहीं सर, जो मुझे मेरी स्टडी के बाद मिला है तो सर मैं तो नेट्रम्यूर ही दूंगी सर, वही ज्यादा इफेक्टिव है। अगर हम देखते हैं तो अगर कहीं पे भी सॉल्ट स्ट्रेस हो रहा है तो नेट्रम्यूर ही देनी चाहिए सर, वो बेस्ट रिजल्ट देती है।
चलिए, थैंक यू मैडम।
थैंक यू सर, थैंक यू।
Thank you so much, Megha.
Thank you,
Moving
ma'am.
on to our next presenter, Dr. Snehal Moore. She is from Dhunduram Sate Homeopathic Medical College, Pune, Maharashtra. Snehal, kindly
Yes.
unmute yourself.
Yes, ma'am.
Are you ready?
Yes, ma'am.
Kindly start.
Yes, thank you. Hello, everyone. Good afternoon. Thank you for giving me this opportunity to present my research in the national poster competition. Myself, Snehal Sudhakar More, representing my college, Dhondu Mama Sate Homeopathic Medical College, Pune. As we know, good health starts with the good food. Vegetables are essential component of healthy diet. But in today's agricultural world, vegetables often grown in soil saturated with fertilizers, rising concern about the long-term impact on our health and environment. This highlights the need to explore other options for chemical fertilizers. Hence, I have attempted an quasi-experimental study in the field of agriculture titled Effectiveness of Homeopathy in Combating Infection and Improving Yield of Cauliflower. In India, agriculture supports 58% of population, but the excessive use of chemical fertilizers harm the health of soil and crop. This study explores how homeopathic remedies can naturally prevent disease and improve cauliflower yield, offering a sustainable solutions for farmers. Objective of my study was to determine the effectiveness of homeopathy in combating infection and improving yield of cauliflower. Hypothesis was homeopathic is effective in combating infection and improving yield of cauliflower. Now, moving on to materials and methods. This study was conducted over 100 healthy cauliflower plant in an agricultural land of around 1000 square feet. Duration of study was November 2022 to February 2023. Homeopathic medicine were applied during various phases of plant growth like root development, stem formation, bolting phase via drenching and spraying method. Now we will have look at the result table for each growth phase. The result shows different phases of cauliflower growth and what homeopathic remedies we applied during each phases and what was the result we obtained. During first phase of root development, we apply the tabacum 6C using drenching method once in a week for 2 weeks for the strong bond between roots and soil, which we confirm by pull-out test. During phase of stem formation, we apply Silicia 6C and Equisatum 30C thrice in 10 days using spraying method. This improved stem strength, which was confirmed throughout visual inspection. During phase of the leaf formation, phosphorus 6C and magnesium carbonate 30C is applied in twice in a week for 3 weeks using spraying method. This result in the leaf growth and decrease in pest infestation, and it was confirmed throughout the visual inspection. During bolting phase, we use Arnica montana 30C was applied throughout spraying method twice in 15 days. It helped in preventing biotic stresses and it was confirmed throughout visual inspection. For overall growth and prevention of pest, we apply Artica parviflora 30C throughout spraying method twice in a week for 8 weeks. It helped in overall improve growth and reduce fungal growth, and it was confirmed using visual inspection method. The given graph shows out of the 100 cauliflower plant, 67% shows improvement in yield. We can see the cost comparison between chemical fertilizers and homeopathic medicine. We observe a significant cost save when we use homeopathic remedy over the chemical fertilizers. So, finally, from this study, we conclude that homeopathic medicine effectively improve yield of cauliflower by combating infection control. This provided a promising, cost-effective solution and a sustainable alternative for both high quality and high quantity crop yield, while ensuring long-term agricultural management. Agrohomeopathy has the potential to increase farmers' income by improving cauliflower growth and reducing reliance on harmful chemicals. So, here are a couple of articles I have referred during this study. Thank you so much.
Thank you so much. Do you want to tell anything else about your presentation, or should we proceed to question and answer round?
Proceed, ma'am. To question.
Daryani sir, I request you to kindly start the round.
Very commendable language and presentation. Thank you, beta. Thank you.
Welcome, sir.
Again, for agro sector.
Yes.
But commendable. But one thing I've observed, instead of using the chemicals, you are using homeopathic drugs. Now the number of drugs which has gone up to 6 or 7, I think so, right from tabacum to last urticaria, Uranus.
Yes, 7.
Right. Now, is it an easy way to apply or to administrator or to educate? Just consider yourself as a farmer. Now the farmer, once he knows this substance, this chemical is to be given here, sprayed or soil in the soil, that's enough, twice or thrice. But for homeopathy, a long chain has to be required. Now, why you have taken so much lengthy process? Can it make a short way? Number one. Number two, you have not described or opened up key of potency. Which potency you used, or you advise or recommend? It was a random, I mean, from your side, or there was a definite parameter for that? Number
Actually,
4 and the last, as compared to with the chemicals, your homeopathic growth, using homeopathy, the yielding or growth rate can we assess, but we have failed to assess because there was not parallel of that time. Your growth is there, 60-70%, whatever it is from your side. But parallelly, if there is chemically growth had to be seen, there is nothing is there. This is the main lacuna. No doubt, health point of view, for health consciousness, it is better way because the organic or homeopathic are almost same. I appreciate your efforts, but there are certain things which you have to improve in future. Thank you.
okay, sir. Okay, sir.
Thank you, sir. Naik sir, any questions from your side?
Yes, please. Please wait. Let me again, just like Dr. Daryani ji, he congratulated this girl. Actually, this is also another study from agro-homeopathy. So in vitro trial. So I must, sorry, in the field also, this is another field trial, not field trial. This is a good thing. So again, by repetition of agro-homeopathy. Better, why you have, why we have selected the 7 drugs? What is the basis of selecting the 7 drugs? What literature we have done?
Actually, because of the various phases of the plant growth and accordingly, मतलब मैंने उसके according ये 7 ड्रग प्रेफर किए। रूट डेवलपमेंट के लिए 7 to 14 days लगते हैं बेसिकली। तो टबैकम 6C इसीलिए यूज किया। टबैकम में ऑर्गेनिक साइट्रिक एसिड, मतलब जो भी कंटेंट उसमें कोरिलेट हो सकते हैं ड्रग्स के अंडर, वो फेज के रिलेट फेज के अंडर, तो मैंने उस हिसाब से ये फेजेस के हिसाब से मैंने मेडिसिन सेलेक्ट किया सर।
So we have used both 6C and 30C because one is below Avogadro's number, the other is beyond Avogadro's limit. That is a good thing for comparison. But do you think that beyond Avogadro's number there is no material, no material of the original drug substance present in it? Do you believe that? Do you believe that any potency beyond Avogadro's number there is no presence of original drug substance? Do you believe this concept?
No sir.
Why not? That means you are telling beyond the Avogadro's number there is also presence of the original drug substance molecules. You are telling. Am I correct? You are telling that.
Yes. Yes.
On
Sir.
what basis? On any scientist can you tell me in India who has done this study that beyond 30C, in 30C, in 200C also there is presence of original drug substance? Any scientist who has done this study? From your state? From your state?
सर मैंने रेफरेंस लिया था रिसर्च गेट से।
So what is that? What is
तो
that?
उसमें
Who is the professor? Where the study was done? Yes or no? Can you answer or not? Yes or no?
No sir.
Let me tell you, he is Professor Jay Sir Belare. He is from IIT Bombay, and there he has done the study on all the 6 medicines of metal origin: cupromet, auromet, ferromet, argentomet, then platinum metallicum, like this. And he has selected 2 potency, one is 30C and 200C. It is a great thing for all of us. We must improve our knowledge. We must be thankful to him that he could find that there was presence of nanoparticles. There was presence of nanoparticles and aggregates of nanoparticles in the 30C potency and 200 potency of these medicines of metal origin beyond Avogadro's number. That brought a big change. That brought a very big change in the concept of Avogadro's number, concept of presence of nanoparticles all over the world. This is for your kind information. Second thing is the results you are telling only on the yield. Yes, another thing also I'm telling you same thing, that you have to divide your aim and objective separately. Your aim should be different and your objective should be on the basis of what? Your objective should be on the basis of measuring the yield, also measuring the yield and anything else. Anything else? Any parameter?
Wait sir, wait.
Pardon? Wait.
Weight.
Achha, this
weight of cauliflower.
Achha, you have selected seven drugs and again 2 potency of each drug. So how many groups you have made? It is a big thing. It is a big thing, huge thing. You should have taken only few drugs and 2 potencies are fine. 2 potencies are fine, but you should have taken few drugs. Otherwise, your number of groups will be huge. 7 drugs and 2 potencies. And again placebo. Have you taken placebo or not?
No sir.
Achha. But you are telling it is not a competitive trial. And it is a quasi experimental. Then it's okay.
Quasi experimental sir, no comparative.
Do you think that quasi experimental study design has any strength? It has very less strength. Can you tell me which study design is the best one? Which study design is the best one? Which study design is the most acceptable study design all over the world by all the scientific professional scientists? They accept it, and which is the most powerful study design?
RCT sir.
Very good. What is the full form? Full form?
Randomized control trial.
Very good. So I request you to take up some studies in future, taking up this RCT. Again, thing is, how one thing. In which group you got the did you take the help of a biostatistician to do the statistical analysis?
Yes, sir.
Achha, what is the result? You have adopted which parameters ANOVA? He suggested you to take up use ANOVA or other parameters?
Other parameters, sir.
Other
Before to
parameter.
weight, sir.
Pardon?
Before मतलब cauliflower जब grow के phase में वो number of cauliflower and weight, sir.
So you got that results according to results, the yield was better. Yield was better. It's a good
Yes,
thing.
sir.
It will very much effective for the this your study will be very much effective, useful for the farmers also. Have you published this your own study published in any journal?
No, sir. It's
So
my own study, and this is my first study, sir.
So why didn't you submit when you did the study?
When November 2022 to February 2023,
Yes, right,
sir.
right. Now, in the meantime, more than 1 year passed. You have already written the report manuscript. Very good. You have done a very good job.
Yes,
You have done the statistical
Thank you,
analysis
sir.
also. But why you have not submitted to a journal?
सर मैं ट्राई करूंगी मतलब
So you take their who is your guide?
मनीषा सोलंकी मैम एंड डॉक्टर देवयानी देशमुख मैम.
Do you think that Dr. Manisha Solanki, madam, she also possesses very good position at the national level now? Do you know that?
Yes, yes, sir.
This is out of your research. This is out of your research. Sorry to ask you this question. I want to know that
नहीं.
what are the strengths of your institution? Do you know that? Manisha Solanki, ma'am, now she occupies a very good position at the national level. What is that?
Yes, sir. Literature committee.
No, which position? She's a convener or member?
Chairperson, sir.
Very good, very good. So, a brilliant person from your institution, you must be proud of her and
Yes, sir. Thank you, sir.
take the help of her. I'm complimenting you. Thank you so much for your
Thank you,
nice
sir.
presentation. All the
Thank you,
best.
sir. Yes, sir.
Thank you,
Thank you,
sir.
sir.
VP Panda, sir, any questions from your side? Dr. BP Panda, sir.
Dr. Snehal, I appreciate your presentation and your efforts. And
Yes, sir. Thank you.
one question only I want to make it clear that you have considered 7 drugs, 7 medicines for the combating of infection in cauliflower. So can you tell that what are the types of infection is generally occurs and for which type of infection which medicine is indicated?
सर टबैकम
Good
6
question. Good question.
में पेस्ट कंट्रोल के रिलेटेड टबैकम 6 यूज करते हैं वो इंसेक्ट लाइक अफाइड्स कैटरपिलरिस एंड बेटल्स ये इन्फेक्शन के लिए टबैकम 6 का यूज किया मतलब इसमें से पर मतलब जो जो मेडिसिन है वो अंडर मतलब इंसेक्ट्स या पेस्ट फॉर्मेशन लीफ ग्रोथ या फोटोसिंथेसिस के लिए फॉस्फोरस.
Right. That should be precisely mentioned because whatever research we are doing, that is for the benefit of the society and community. And you are doing the job for the community of farmers. So
Yes, sir.
that should be precisely reflected in your presentation. What
Right,
I
right.
was expecting.
Right, right.
Thank you, madam.
Yes, sir. Thank you, sir. Thank you so much.
I strongly support the comments of Dr. Panda because he's from Odisha.
Thank you, sir.
Okay.
Thank you.
नहीं मैं मजाक कर रहा हूँ बेटा.
Thank
You are
you,
also
Sneha.
from Odisha.
Dr. Daryani, please don't mind.
No, I am not mind. I am not. I am mindless.
Thank you, Sneha.
Thank you
Moving
so
to
much,
our
ma'am.
next presenter, Dr. Pavitra Gaur from Swasthya Kalyan Homeopathic Medical College. Dr. Pavitra, kindly unmute yourself. Kindly start with your.
Am I audible, ma'am?
Yes, you are audible.
Okay, thank you
Kindly
so much,
start
ma'am.
with your presentation.
Yes, ma'am. Good afternoon to all the dignitaries. My name is Dr. Pavitra Gaur. I am currently pursuing my MD from Swasthya Kalyan Homeopathic Medical College from Department of Materia Medica. And I'm pleased to present the finding of my research titled Analyzing First-Time Visits and Prior Experiences in Homeopathic Treatment, and it's a cross-sectional survey. Since the sample was taken over at a period of time, at a point of time, and from the OPD itself, so it was basically a cross-sectional study that I did. To begin with, homeopathy, as we all know, is an established component of of the Ayush healthcare system and is widely utilized in India for various health conditions. While previous studies have demonstrated high patient satisfaction and positive treatment outcomes, there is a limited data on how patients perceive and engage with homeopathic treatment, particularly regarding the first-time visits and referral patterns. Understanding these factors is crucial for optimizing patient care, improving communication strategies, and enhancing healthcare delivery system. Now, as we all know that homeopathy services are available everywhere and all over India and are being used fully and thus sharing the patient load. There is the potential for more homeopathic practitioners to contribute importantly to the healthcare delivery in India. The strength of the Ayush system lies in promotive, preventive, and rehabilitative healthcare, diseases and health conditions relating to women and child, mental health, stress management, problem relating to older persons, non-communicable diseases, etc. Earlier studies revealed high level of patient satisfaction and better communication from availing integrated services. So, a well-planned strategic initiative should be undertaken for further establishment of integrated healthcare setups and development of the appropriate integrated treatment models in the Indian perspective. So, taking into all these into account, the study was carried out with the aim to assess the patient's perspective, preferences, and experiences with homeopathic treatment, which was done at my college, that is Swastikalan Homeopathic Medical College and Research Center, Sitapura, Jaipur. Now, there were objectives which were need to be fulfilled through this study, and we tried to fulfill these objectives. First was to determine the prevalence of prior exposure to homeopathic treatments among the patient. Second, to evaluate whether homeopathy was chosen as a primary treatment option or recommended by the others. Third, to understand patient satisfaction with the consultation processes during homeopathic treatment. Fourth, to gather feedback on patients' understanding and perception of homeopathic practices for further improvement of healthcare services. Now, we did this study with the help of preparing a questionnaire which comprises of certain questions which were in Hindi and English both, and we took the consent of the patient whoever visiting in the OPDs, and a well-structured questionnaire was developed, and 120 patients were enrolled for the study, comprising questions in English and Hindi. The questionnaire assessed demographic, which was age and gender, previous exposure to homeopathy, treatment preferences and referral sources, satisfaction with the consultation processes. This was the methodology which were followed and which were followed throughout the study. Observations and result which was taken after the study. Total respondent 120. Age range in which the patient visited and gave consent for the study was 27 to 32 years approximately. And after analyzing the result, we see that majority had prior exposure to homeopathy. Nearly half were visiting for the first time. A larger proportion chose homeopathy based on referrals. Most respondents found the consultation processes clear and easy to understand. Now, as we can see that from the figure 1, from the gender predomination, that mostly patients which were visiting at the OPD, since it was a cross-sectional study and data was taken at a point of time, so majority of the patients who were attending the OPDs were females as compared to males. Now, for the first question, which included in our questionnaire was, have you previously received homeopathic treatment? So 72.50% said yes, and 27.50% said no. In figure 3, which was our second question, a question in the questionnaire, that is this your first visit to a homeopathic practitioner? So 58% said yes, that they were visiting homeopathic hospital for the first time for the treatment, and 43% said no, that they were not visiting homeopathic hospital for the first time for the treatment. Now, the fourth question, did you choose homeopathy as your first option for the treatment? So it was like it was balanced question, balanced answer, that yes, almost equal amounts were choose homeopathy as the first option for the treatment. Figure 5, which included question was, were you referred to a homeopathic practitioner by someone else, example doctor, friend, family? So 63% were referral patients, and 37% patients came without referrals. The last question was, did you find the consultation processes clear and easy to understand? So majority of the patient said yes, that they find consultation processes clear and easy to understand. So majority had prior exposure to homeopathy, nearly half were visiting for the first time, and a large portion choose homeopathy for the based on the referrals. Most respondents found the consultation processes clear and easy to understand. Now, what was the conclusion from this cross-sectional study? Implications for practices. The finding emphasized the importance of strengthening referral networks and leveraging patient satisfaction to increase trust and outreach, enhancing communication strategies to improve understanding, especially for new patients unfamiliar with homeopathic practices, developing targeted initiatives to address the unmet needs of dissatisfied patients while reinforcing the existing strengths of the consultation processes. Homeopathy continues to be trusted and growing healthcare option with patient satisfaction and referral serving as its cornerstone. By addressing minor gaps and building on existing strength, homeopathic care can further solidify its role in integrative and healthcare system. Now, what else can be done for strengthening the homeopathic system was strengthening collaboration with other healthcare providers, engaging with general physicians and specialists, organizing joint CMEs, which includes continuing medical education, conduct training sessions where allopathic and homeopathic doctors can discuss patient management and collaboration, patient-centric referral system, educating existing patients, provide information on when and why homeopathy can be effective so that satisfied patient refer others, develop referral cards and incentives, give patient referral cards or small incentive for referring new patient, example discounted follow-up visits that can be included, create patient testimonial campaigns, share real life patient success stories on websites and social media to encourage referrals, digital and social media outreach, which is actually now the main trend which is going on. Use telemedicine or an online consultation. Patient referred from other location can be consulted online before visiting a physical clinic. Optimize Google business and social media presence. Make it easy for potential patients to find trusted homeopathy clinics through online reviews and visibility. And engage with community and institutions, tie up with schools and colleges, offer health awareness programs that promote homeopathy for common conditions, collaborate with corporate wellness programs, partner with companies to introduce homeopathy and employ healthcare benefits, organize free health camps, which are usually organized by the institutions, nearby health checkup camps in the villages, provide free first-time consultations in underserved areas to create awareness, improve communication and trust, enhance doctor-patient communication. A satisfied patient is more likely to refer, ensure every consultation is informative and assuring, provide clear treatment plans, educate patients on expected progress, ensuring that they engage with homeopathic care, encourage feedback and online reviews, ask satisfied patient to leave online reviews which can serve as digital referrals. So this was all for my poster presentation, and I would like to thank my guide, Dr. Yogeshwari Gupta, who is also Principal and Actuary of Department of Materia Medica. Thank you.
Thank you, Pavitra. Beginning with a question and answer round. Dr. Daryani, sir.
I have no words to say any because the first time this type of study was undertaken by the Nehru Homeopathic Medical College, and the investigator was Dr. Harleen Kaur. And on the basis of that, I conducted this survey. This is called survey.
Yes, sir.
And thirdly, from Swasthya Kalyan College, you are taking this project. Well, of course, but title is not effective. It is not eye-catching. It is not, I mean, what the opinion of public about homeopathy? मैं भी आज अपनी प्रैक्टिस में पूछता हूं, आपको मेरे लिए किसने सजेस्ट किया? कहां से आए हो? वहां कौन था जो होम्योपैथिक दवाई लेता है? Just it is a knowledge for general knowledge. Now, whether this topic should be taken scientifically or it is simply to aesthetics, or rather you can say for propagating the homeopathy. in my gut feeling, my gut feeling is related. It is scientific. It will be used for the profession, or the profession will be beneficiary or benefited, or it is just a type of survey which you are conducting and you will publish this percentage, this thing. I mean the statistics data. Come on.
Are you asking me, sir, regarding it is considered as a scientific or a survey?
Yeah.
So according to me, for a time being, that when I started, it was a survey, but definitely I would love to take it beyond this thing, and I would convert it into a scientific study, because these kind of studies are actually very much needed in homeopathy to know how much is to be needed or to be worked upon. And like if there are patients coming to referrals, so what kind of referral network should be done, or how they should be strengthened, so that more patient output can be done in homeopathy or in the institution which are actually in the outward areas. Usually institutions are situated in outward areas, so what can be done so that the patient load can be increased in those institutions, so referral networks can be increased, and what else can be done so that we can propagate more homeopathy in population. Excuse me, sir.
Sir, we are unable to hear you.
Please unmute. Yes, yes.
To propagate the homeopathy.
Yes, sir.
To make popular homeopathy among the public.
Definitely, sir.
Anyway, your attempt is genuine and you have done your best. I mean, whatever you have done, it is the best.
Thank you so much.
But I have no comments regarding whether it is scientific or it is survey. Now, rest is senior person. Dr. Naik is here. He will give the better comments. And Dr. Panda.
Naik, sir.
Thank you.
Yes, yes. Dr. Pavitra, thank you very much for selecting another area, another study domain, that is survey. Your predecessors, they have selected some other titles, means some other area domains like in vitro trial, in vivo trial, but you have selected a survey. There is another domain. It is very good thing. New area you have explored. I must compliment you. Then coming to, have you heard of some standards that is called KAB and KAP? Have you heard of KAB and KAP?
No, sir.
KAB, knowledge, aptitude, and behavior. Then KAP,
Okay.
knowledge, aptitude, practice. For your type of survey, which formula is applicable?
And knowledge, aptitude, and behavior.
No, you are asking the questions to whom?
Actually,
To public.
I
To
want
public.
to.
You are asking questions to public
I want.
patients or to physicians?
Sir, it's like it goes by ways. Basically, it was not on the idea that whether I should ask it to the physician or to the public, but it was like byways.
No, that is not good. Now you should identify a specific area. Either
Okay,
you should ask question for survey, do the survey with dealing with the patients, or survey dealing with the physicians.
Okay.
Like, sorry, if you are dealing with physicians, what type of things can be done? Survey can be done like that. Whether you do adopt classical homeopathy, mixopathy, or then coming to potency, whether you prescribe 50 millisial potency or millisimal 50 millisimal potency or centesimal potency. Then whether you prescribe mother tincture, whether you prescribe common medicines or patents or not, like this type of questions can be asked to physicians by adopting one formula, KB formula, and KP that patient survey. You have done a very good thing. Very good thing. I must compliment you again and again.
Thank you so much, sir.
But the title, what Dr. Doriani ji has suggested, you should have slightly enlarged. You should have slightly enlarged. Should not. Please don't be miser. There is a rule. There is a rule how to select a title. The title should be Title should be precise, comprehensive, meaningful, interesting, and informative. There are so many criteria. And to select a title, particularly in a clinical trial, the formula should be adopted that is called PICO formula. PICO formula means P stands for population, I stands for intervention, C stands for comparator, and O stands for outcome. But that is not applicable for your survey.
Yes,
That is
sir.
more that is applicable for clinical trials mostly. So here, but it should have not been so much miser in, sorry, it was too much economical, not miser. Girls are economical, so then the boys, we must compliment them. And because they are running the show, in future, whenever you write this article on the study, then you slightly increase the number of words in the title. Have you published this work?
Not, sir, not yet, sir, because this study was conducted in December 2024 only. So it's yet to be published.
Have
That's
you
why, sir.
completed the manuscript?
Manuscript regarding this thing, sir?
Yes.
Not yet, sir.
Then how you have prepared the slide?
Manuscript. Sir, it's basically a manuscript only. I was thinking that you were asking that another somewhat or basic structured thing, but this is what I have analyzed and done and prepared.
So this is a type of summary you have done, good summary you have done, like a type of one abstract you have done very nicely. This is not an abstract, this is a good summary you have done, and try to enlarge it and transform it into an article, manuscript,
Yes,
and
sir.
submit to a good journal.
Yes,
And
sir.
because it is a study dealing with this survey, you know, in the there is a pyramid. Have you heard of this pyramid of scientific publications? This pyramid, I'm telling you, sorry, pyramid.
Pyramid of scientific
Design, study designs pyramid, where this
Yes.
letter to editor, correspondences, editorial comments, this case report, case series, they have less strength. So
Yes,
they
sir.
are in the bottom. But when you go top from the pyramid, when you go from bottom to top, you will see that the scientific public, sorry, these case reports, then case series, then randomized control trials. Gradually, when you go up, randomized control trial, then meta-analysis, all these will be in the at the top. So when you deal with these clinical trials, you must follow that. That is not strictly applicable here. But I agree with Dr. Doriani. You increase your number of words in the title. Then coming to aim and objectives, I must come. This is very good, very good. You have done very exhaustively the aim and objective, which are very clear, and you have taken up so many 4 objectives. It is very good. Yes. Others should follow that. Then coming to questionnaires, you told that you prepared a questionnaire for the survey.
Yes,
who
sir.
approved? Who approved this? Who prepared this? Who approved this?
My guide, principal, ma'am, Dr. Yogeshwari Gupta.
So she's quite talented. She's quite talented. But let me tell you, there is a word called validation. There is a word called validation. For validation, you must refer this thing to a committee.
Okay,
I'll request your principal. You to request your principal also that this is the suggestion of. I think she is probably present in the meeting in this presentation. She must be watching this, and she is watching both you and us also, whether you are going in right direction or not.
Yes, sir.
And please tell her that she should refer it to a committee that is called for validation. But it is it is difficult but not impossible. Group of scientists should be there for validation. Then coming to sample size, I think for survey the sample size is less.
Yes,
for
sir.
survey 120 sample size is less. So then question is, can you better tell me what are the scope and limitations of cross-sectional study?
Scope and limitations. So basically, these are inexpensive studies. Like not much of the
that is the primary merit side.
Yes, sir.
And no cost involvement or less cost involvement. Very good.
Yes, sir. And then, these are basically at a point of time study. So these are not like exhaustive studies. So we are getting the data at a point of time. So it's basically easy to gather the data.
So cost effective and less time consuming.
Less time consuming.
Very good.
But what are the demerits? Demerits of cross-sectional studies are they are not with very good methodologies. They are extensive methodologies which can be applied for a survey. So this is one of the demerit of a cross-sectional study.
It's coming to figure 6. Can you tell me about figure 6? You have mentioned that the consultation process was clear or not. This question was asked to whom?
To the patient itself.
To the patients.
Asked to the patients itself. Yeah.
Yes. What are the percentage of respondents
Sir, it
who
was
told?
82.50% said yes, and the remaining said no. So majority of the patients said that yes, they find the consultation process clear and easy to understand.
Very good, very good. Thank you very much again for making a nice presentation. Wish you all the best. And immediately finalize this manuscript on the basis of your study and submit to a good journal. Submit to a good journal.
Thank you so much, sir.
Can you tell me what are the good journals in homeopathy?
IJRH.
Good journal. No, better than do know that what is called which is the good journal? What is the criteria? It must
Which
be
has a good impact factor.
very good. Then
Good impact factor. One I just know.
Next is it must be peer reviewed. It must be
Peer
peer
reviewed.
reviewed.
Yeah.
So you told IGRH.
Yes,
Each
sir.
IGRH does IGRH has good impact factor?
Yes, sir.
How much?
Sir, that impact factor is not known to me. I cannot tell you. But
That is also not known to me. But it is indexed. It is indexed, but it is a peer reviewed journal. It is indexed journal, but impact factor is not clear yet. What is the best journal in homeopathy in the world?
Homeopathy
Best journal in homeopathy in the world.
Is it homeopathy links? I'm not sure, sir.
No,
Is
but
it
better than that. Yes, let me tell you, homeopathy, only homeopathy, which is published from London under the chief editorship of um, uh, um, previously of Dr. Peter Fisher. Now, Dr. I'm forgetting his name. Anyway, you must focus to these standard journals. They are homeopathy, then homeopathy links, then
Yes, sir.
IGRH, then International Journal of Homeopathy Research.
Yes,
These
sir.
are some of the very highly standard journals. High standard journals having good impact factor, and they are all peer reviewed. And don't waste your valuable time with a predatory journal.
Sir, I will be very grateful to tell you that next month, me and Principal Ma'am will be publishing an article in Homeopathy Links. We got approval also.
Very good. Can you tell me
Yes,
who
sir.
who is the editor of Homeopathy Links?
Bindu Sharma. Dr.
Very good.
Bindu
Right.
Sharma.
Thank you so much. You are updated. Good.
Thank you so much, sir.
I'm handing over the microphone to Dr. Ponda.
Thank you, sir. I don't want to ask question. Just I want to know that your research is survey research. What is the outcome of survey research for the community service?
Outcome of the survey research for a community service. Like it depends upon the generalizability of the data. If we are doing a survey, the result of the survey should be generalized in a community. So if it's a cross-sectional survey, and basically it's called as a snapshot survey, matlab, done at a point of time. So generalizability of the data is a question mark, but that is done for generalizing the result which is given to the community, basically.
What is the utility of the survey research for our fraternity?
Utility of the survey is definitely very much important, as I said, to improve a institutional healthcare system, improving OPDs, which will eventually benefit the patient also, and to the students also, the postgraduate students also who are working over there, and to the patients also. So it's basically important, and it's also important to the doctors also, that whether they are giving the consultation which are easy to understand, clear to understand or not. So basically it's advantage or beneficial byways, or it's a multi-factor advantage process.
Thank you, madam.
Thank you, sir.
All the best. All the best.
Thank you so much, sir.
Thank you, Dr. Pavitra.
Thank you, ma'am.
Our next presenter is Dr. Bhairvi Jadhav. Dr. Bhairvi, kindly be prepared. Just a gentle reminder to all. We have set Zoom meeting time to 4:30. We are worried that meeting will close by itself at 4:30 because of the Zoom meeting settings. So I request that we complete the meeting within the time so that to avoid inconvenience.
How
On to
many
our
how many presenters?
So she is our fifth presenter. We have
Total how many?
total 7 presenters we have.
7.
Yeah, we have 7 presenters, and our concern is that meeting will be closed because of the software at 4:30 sharp.
It will be done. It will be done. Don't worry, please.
ये डॉक्टर नायक ने तो लंच ले लिया है, पर हम सुबह से भूखे बैठे हैं।
No, I have not taken lunch. I have not taken lunch.
Doctor,
Dr. Daryani ji, principal has told that she will be sending lunch by courier.
अरे वो तो बाद में जाएगा, पहले तो हाइपोग्लाइसीमिया हो रहा है यार।
Okay, we'll finish quickly. I will ask you less questions.
Okay, sir. Moving on to next presenter, Dr. Bharvi Jadhav. Dr. Bharvi, are you ready? Dr. Bharvi, kindly unmute yourself. You are not audible to us. Kindly adjust your speakers. You are not audible. Kindly adjust your speakers. You are still not audible. Though you are not muted, you are still not audible. Kindly check your earphones. Dr. Bharvi?
I think it is better to give a chance to another one.
Right.
Okay, so we will take the next presenter first, and then we will come back to Bharvi till she adjusts her audio issue.
Hello, am I audible now?
Yes, you are audible. Are you ready?
You are Bharvi. You are Bharvi.
Yes, sir.
Okay.
Yes,
Kindly
sir.
start
Sorry
with
for
your
the
presentation.
inconvenience. Yes, ma'am. Thank you. Good afternoon, all. My name is Dr. Bhairavi Jadhav. I am MD Part 2 Psychiatry Resident at Dr. M.L. Dhawale Memorial Homeopathic Institute, Palghar. And the topic of my presentation is Scope of Rag Therapy and Individualized Homeopathic Treatment in the Management of Emotional Disturbances, Depression, Anxiety, and Stress, assessed using DSS-42 scale among the generalized anxiety disorder patients, an experimental pilot study. So the co-author of my research are Dr. Rajesh Yadav, Assistant Professor, Psychiatry Department, MLD MHI, Dr. Sunita Nikum, HOD, Psychiatry Department, MLD MHI. Introduction. Around 10 to 12% of Indian adults face mental health issues such as depression, anxiety, and stress. Studies have showed that 20%, 22% experience depression, 23% anxiety, and 15% stress-related symptoms. Dr. Hahnemann has provided guidelines for managing these mental disturbances through auxiliary and homeopathic treatment. Dr. Hahnemann mentions in aphorism 261 about the auxiliary management. Additionally, while Indian music can positively impact these conditions, further research is needed on the effects alongside homeopathic treatment. So aim is to explore the scope of individualized homeopathic treatment and with raga music therapy for addressing emotional disturbances such as depression, anxiety, stress using DSS-42 scale for 6 months among the generalized anxiety disorder patients. And the objective is to compare the scope of homeopathy with or without raga therapy in improving the symptoms of depression, anxiety, and stress in the generalized anxiety patients using DSS-42 scale in the span of 6 months. The methodology, the study design is used as experimental pilot study. I have not mentioned the sample size. The sample size is 12. In the inclusion criteria, I have taken patients of subjects of all sexes. The age group is 15 to 60. Patients diagnosed with GAD as per DSM-5 criteria and DSS-42 scale, and the minimal inside of the subjects is 2. Then in exclusion criteria, patients with mixed anxiety depressive disorders, patients with active psychosis as per diagnosed symptomatically, patients with known hearing defects. Withdrawal criteria, patients developing psychotic symptoms, increased depression score above 28 in DSS 42 scale after 3 months of treatment. Similarly, in the anxiety score, if score increases above 20, and in stress, if the score increases above 34. Then patients listening to raga therapy less than 4 times a week. randomization, 1:1 allocation was done. So 6 in the reference group and 6 in the experimental group. Variables studied were depression, anxiety, and stress. Intervention details, homeopathic treatment as per totality and posology, raga therapy, according the recordings of raga todi, minimum 5 days a week, 15 to 20 minutes per session. Time of listening was morning 8 to 10 as per the Gan Samay of Raga. Delivery schedule, the 2 sessions were kept in the presence of researchers to guide the subjects about the whole process. And then statistical analysis was done on Man-Whitney U test performed via SPSS 24. The observation and results. So you can see I have uh, given two anxiety. I have taken the bar graph is different, and the depression and stress I have made different bar graph. So in the anxiety, we can see the in the experimental group there is significant improvement, that is p value is 0.0355, and in the reference group there is no significant improvement in the anxiety symptoms. And in the depression and stress, there is no significant improvement in either reference and experimental group. So the conclusion of my study is the combination of individualized homeopathy and raga therapy significantly reduces anxiety symptoms in GAD patients. Limited or no significant improvement observed for depression and stress symptoms due to the specific calming effects of raga todi, which is primarily targets anxiety related hyperarousal. Depression and stress may require longer treatment durations due to their chronic and recurrent nature, and intervention of specific ragas like Raga Yaman. As per its studied effects on depressive and stress states, the findings suggest a pathway for use of auxiliary therapies like Raga therapy with classical homeopathic treatment without deviating from fundamental principles. I would like to thank Swasthya Kalyan Homeopathic Medical College for giving us this opportunity. Thank you so much. I'm open for the questions. Thank you.
Thank you so much. Beginning with a question and answer round. Dr. J.D. Daryani, sir, any questions from your side?
Your title has mentioned depression, anxiety, and stress.
Yes.
Initially, it is stress. Initially, it is anxiety. Then, after stress, and finally, patient goes into depression. So now the point which is striking in my mind, your cases were initially from the anxiety or from stress, depression. Number one, because your caption is individualized homeopathy. How that depression occurs. This is the part. Anxiety, stress, and number two, raga therapy along
So you are
with
not audible.
homeo.
Sorry.
Now, if it is homeo is improving,
Yes.
or raga is improving, there should be no group.
I think there is some network issue from sir's side.
Yes, I was not able to comprehend the question. Sorry, sir.
We will get back with Daryani, sir, as soon as his issue is resolved. I think he's
Am I
joined.
audible now?
Yes, sir.
Am I audible now?
Yes,
Sir,
sir.
you are
Yes.
audible but not visible.
Do you get me?
Yes, sir, you are audible.
Still, it's there. Error.
Hello.
So kindly continue. You are audible but not visible. I request Nayak sir has joined.
Yes, Dr. Bhairavi, again, I'm
Yes, sir.
complimenting you for selecting this good type, good area, good domain of
Thank you,
anxiety and
sir.
depression. That is a good thing you have done. But one thing, let me tell you some plus point of title and minus point of title.
Yes.
But don't be discouraged. I'm telling very
Yes.
frankly. So plus point
Yes.
is a good title. There is a rule. There is a rule in research methodology of writing scientific publication. A good rule is the standard rule is the title must satisfy a formula that is called PICO formula. PICO
Yes.
formula, not PK formula like say film. Not PK formula. You know PK? PK film? PK? America and Anushka Sharma. So this is not relating to
Yes.
PK,
Yes.
but a PICO formula, PICO. P stands for population, I stands for intervention, C stands for comparator, O stands for outcome. Let me repeat
Yes.
again. PICO formula, P stands for population or patients. Then
Yes.
I stands for intervention.
Yes.
Intervention means the medicine. Then C stands for comparator, means whether you are doing an open observational study or you are comparing with some other therapy, either a positive control or a negative control or placebo control, whether you are doing that. Then outcome, what are the outcome parameters? So that your title satisfies all these things, I must compliment you. But one thing is, you have put your feet into trouble water. You have invited trouble for you. I have not invited. You have invited by clubbing both GAD and depression. As Dr. Doryaniji has told that both are related, and depression is the terminal scenery of the drama. But why you have clubbed both the things in your study? Please,
Sir,
yes, yes.
yes, sir. Thank you for the question. Sir, actually, I have diagnosed the patients according to DSM-5 criteria as generalized anxiety disorder. But since I have taken this DASS 42 scale, it has three domains, three variables: depression, anxiety, and stress. So, though the patients are of GAD, but there are some symptoms of depression and some symptoms of stress, because anxiety is always related to stress, and there were some symptoms of depression. Patients were not diagnosed as per the criteria of DSM-5 as for depression. So they were exclusively diagnosed for generalized anxiety disorder. So, sir, this is an experimental pilot study, and my dissertation topic includes both depression and anxiety. So I have taken MDD and PDD cases in the depression criteria, and in the anxiety, I've taken all the anxiety disorders in my dissertation, which is the largest study. Yeah.
Okay. Then in your presentation, you have simply written objectives. Aim
Yes,
and
sir.
objective, aim and objectives. So you have not
Yes.
segregated. Only one bullet point you have not segregated. So which is aim, which is
Correct.
objective, which is aim, which is objective, that must be clarified. Because you have taken that scale, DAS 42, DASS
Yes.
42, that is a good thing. So that should be included in the objective, not in aim. So try
Yes,
to
sir.
segregate it to one is aim, second is objective. Then coming to
Okay.
introduction. In introduction, you have suggested for further recommendation. You have given some recommendation. But as per the rule of the article writing, recommendation should be given only in the conclusion. Only in the conclusion,
Yes.
not in the introduction.
Okay.
Introduction should be divided into three parts. One is called what is known. Middle part is known what that is called what is not known, and last part is called last part A B C. A stands for what is known. B stands for what is not known. C stands for why you are study. Means study research question. What is your study objective?
Yes,
That is called that should
yes,
cover that should be covered by the introduction. Coming to
yes, sir.
sample size, because it is a pilot study, I think 12 is good, but you could have slightly increased it.
Okay. Yes, sir.
Then inclusion criteria, you have included both GAD patients and have you included the patients of depression? But you are telling that as per this other standard scale, both are related. It is okay. It is okay. That
Yes.
have you heard of any other scale for assessing depression? Any
Yes, sir.
other?
Hamilton depression, even anxiety scale is Hamilton
No, no, no.
scale is used for
For
anxiety.
assessing depression, for assessing only depression, whether there is any other scale, what is that scale?
So Hamilton depression scale we actually use,
No,
and
no,
there
no,
is
no, no, no. Correct name of the scale.
so there is one for the geriatric, there is GDS, and then Beck's there is
No, I'm telling you
Beck's scale.
that is called Hamilton Depression Rating Scale, SDRS.
Yes,
Hamilton
Hamilton
Depression
depression.
Rating Scale and
Yes,
or HAMD scale, HAM all capital hyphen D, HAMD scale.
yes,
That could have been taken. Then can you please elaborate the raga therapy?
yes, sir. So I have taken the references of the articles I've mentioned in the references. So basically, the rag actually, I am a trained Indian classical singer.
Very good,
I have
very
a
good,
bachelor's degree in that.
good.
So raga therapy, actually, ragas are known to
So
produce some emotional.
this qualification you got while studying while doing PG or before PG?
Yes, sir. Before PG, I have done the qualification
Very good, good. Congratulations.
in my UG classes. Okay.
Good.
Yes, sir. Thank you. The raga is known to produce certain emotional effects on on our emotional state. So it has been researched on various like anxiety. I have mentioned the articles in the state anxiety levels on the various blood pressure, which is the autonomic nervous system gets aggravated in the anxiety.
But
So
that
they are.
assessing blood pressure is not in your assessment criteria, no?
No, sir,
That
no,
is not
but
in
I have
assessment
taken the
criteria.
reference. Yes, sir, I have taken the reference of the article where they have shown that the blood
Yes, yes.
pressure and other
You are right. You are right. You are right.
respiratory.
You are right. You are right.
Yes,
You have mentioned that there is no significant improvement in respect of depression and stress, but there are
yes.
significant improvement in respect of
Mhm.
GAD.
Yes, so because Rag Todi has specific action on anxiety. Further, Raga therapy also works on the principle of individualization. So, Raga Todi is mainly known for its effect on anxiety. While there are different ragas like Raga Yaman, so I have included Raga Yaman in my dissertation topic, which is a larger study, and I am seeing much improvement in depression. So, MDD and PDD cases, I've seen much improvement by
Good,
Raga
good, good, good.
Yaman.
Any control
Yes.
arm? Any control arm?
Sir, sorry, sir.
Any control arm you have taken? Control arm.
Control
Experimental
arm.
control group. Control group.
Yes, sir, I've taken this. Reference group is control group. We have given exclusively individualized homeopathic treatment in reference group, which is
No,
a
no, no.
control group.
No, beta. There must be
Yes, sir.
experimental. That is that is one is interventional group or experimental group where you have given the raga and other. Yes, that is the
Raga
experimental
and
group.
homeopathy.
I'm talking
Yes.
of yes, individual homeopathic medicine, IHP or IHT, whatever you can tell. Any control group means have you compared it with any control group by giving
Yes,
only
sir.
what is that? What is
Yes,
that
sir.
control group?
Sir, I have taken GAD patients which are given homeopathic treatment, individualized homeopathic treatment in the control group, which
I'm
is
talking.
reference group.
No, no. Acha, you are telling that is positive control.
Yes,
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 positive
positive
control.
control group.
Right.
I have not
So in the
taken placebo. I have not given placebo in the patients.
only placebo to one group.
No, sir, no placebo. In the reference group, I have given only homeopathic treatment, and in the experimental group, I am giving homeopathic treatment along with raga therapy.
But you just told about something placebo.
So I have not taken placebo group, control
Good.
group as placebo.
Placebo. Had you taken placebo, it would have been unethical. Giving placebo
Yes,
to
sir.
patients suffering
That's
from
why.
yes.
Yes, sir.
Anyway, thank you very much. Thank you very much. So how many total
Thank you
groups
so
you made?
much.
How many groups you made?
I have made two groups, reference the control group and experimental group.
Achha, ठीक, okay. Thank you. All the best. Immediately transform it into an article and send to a journal.
Yes, sir. Yes.
BP Panda sir, any questions from your side, sir?
Dr. Bhairavi, I appreciate your efforts. It is unique one, your topic. Only I want to ask you that I feel that your topic is broad. It should be precise and concise.
Yes.
There are so many ragas are there are so many medicines are there, and as per the emotional disturbances, depression, anxiety, and stress. So again, it is a broad category. So what I'm thinking, say, whenever you are doing research, that should be precise, by which it will be more effective. That is my
Yes, sir.
suggestion. Okay, thank you.
Yes. Thank you, sir.
Thank you so much, Bharvi. Uh, Moving ahead with our sequence of presentations.
Thank you, sir. Thank you,
Our
ma'am.
next presenter is Vijay Lakshmi Devi from Baxan Homeopathic Medical College. Vijay Lakshmi, kindly unmute yourself. Dr. Vijay Lakshmi from Baxan Homeopathic Medical College. Dr. Vidya Lakshmi. I think there is some technical issue. Till we are connected to Vidya Lakshmi, I would like to call our next presenter, Dr. Himani Shah from MPK Homeopathic Medical College. Dr. Himani, kindly unmute yourself.
Excellent support.
Outside somewhere. Can I take just 1 minute?
Yeah, we will wait.
Yeah.
Kindly be prepared quickly.
Okay, just.
Meanwhile, Vidya Lakshmi, are you here?
मैं यहाँ पे बैठ के मीटिंग ले सकती? लाइट चला दूंगी क्या? हाँ, लाइट चला दीजिए.
Dr. Himani, are you ready?
Yeah.
Kindly start with your presentation.
Sorry for late. Actually, thank you for accepting my presentation. And good afternoon, everyone. The topic of my study is the effectiveness of homeopathic plant extract solution as an add-on therapeutics in cases of dyslipidemia and open label randomized trial. So, as we all know, dyslipidemia is a multidisciplinary or metabolic disorder which covers large group of diseases, and it is caused by many factors, but as it is a diverse group, first we need to know biochemical values of dyslipidemia in adults. So as I have mentioned, and these are under the guidelines of Lipid Association of India. Now, I have chosen this topic because it is very diversely prevalent in India as well as all over the world. Like according to ICMR India B studies 2014, hypercholesteremia is 13.9%, hypertriglyceridemia is 29.5%, and low HDL is even higher, 72.3%. And even by using statins, only the risk is reduced by 33% only. So we need a complementary system of medicine which could target a specific parameters of dyslipidemia, like on triglycerides or HDL low levels, etc., or VDRL. That's why I choose this topic of my research, and my focus was on emphasizing personalized treatment and therapeutics to investigate the potential of Guttaria gameri and Crataegus oxyacantha in lipid modulation for effectiveness of management of dyslipidemia. As my title suggests, the effectiveness of homeopathic plant extract solution as an add-on therapeutics in cases of dyslipidemia in an open-label randomized trial. So my aim was to ascertain the effectiveness of homeopathic plant extract solutions of Guttaria gomeri and Crataegus oxyacantha when given along with constitutional medicine on parameters of lipid profiles, including triglyceride, LDL, HDL, non-HDL, and ApoB and ApoA1 ratios. As ApoB and ApoA1 ratios are new biorisk markers, target biorisk marker for cardiovascular health. Now, my objective was to evaluate and compare the effectiveness of homeopathic constitutional medicine alone and add-on therapy with plant extract solution of Crataegus and Guttaria gomeri. By analyzing pre and post-treatment reports in cases of dyslipidemia And my methodology was, my study was conducted at Virendra Homeopathic Hospital and MPK Homeopathic Hospital, Jaipur. And my study was conducted for 12 months with follow-ups every 15 days to 1 month according to the risk, and lipid profile reassessments were done at 3 months. Sample size was 196 participants, calculated using IBM SPS statistics software according to the target effect size for homeopathic studies. The sampling technique was convenient sampling followed by randomization into medicinal group, randomized according to a computerized generated list. My selection criteria was adults of age more than 25 years, both genders, with dyslipidemia and obesity, as well as giving consent and follow-up as required. Exclusion criteria was active coronary artery disease. As my study design is randomized open-label clinical trial, intervention was done both ways, like one for constitutional group, which is also my control group. The medicinal given were on the basis of Hahnemann's guideline and fifth and sixth edition, and randomization of mother tinctures were done according to the randomization table. And as there were 4 groups, one was control group, one was control plus categories, one was control plus guttaria, and one was control plus categories plus guttaria. So they were given accordingly. So, and statistical analysis was done using IBM SPS software, and tests were used Kruskal values for group comparison and Wilcoxon for each group. And as you can see there, I have presented the result of all the groups. The control group, there was no significant changes observed in TG, then they LDL or non-HDL. But when we added categories, there was significant improvement on TG, non-HDL and HDL. It doesn't show significant improvement in LDL level. While in Guttaria group, it shows significant reduction in triglyceride, LDL and non-HDL, but no improvement in increasing the level of HDL levels. But when I added control plus categories plus Guttaria, there was improvement in all the parameters, like including HDL as well as lowering all the lipid danger factors like triglyceride, LDL, and non-HDL levels. So I have also mentioned the uh, result of each medicine on each parameter. Like in triglyceride, the add-on therapy of both categories and Guttaria was effective. However, Guttaria was more effective with effect size of 0.149. In LDL and non-LDL, the add-on therapy of categories and Guttaria was the most effective by reducing the effects with effect size of 0.874 and 0.179. In HDL, the most effective was categories alone, and APO-B and APO-1 ratio, the strongest reduction in the favorable were seen in addition of categories oxygenica and Guttaria Gumeri group. And as I mentioned in the conclusion, that the trial finding provides insight into the management of metabolically challenging conditions like dyslipidemia by combining Cratagus oxygentica and Guttaria Gumeri in the control group individually or in the control plus Cratagus plus Guttaria in improving lipid profile in dyslipidemic patient and using them as alternative approach to target treatment of dyslipidemia. Now, I have mentioned the references in the QR code, and thank you.
Thank you, Himani. Beginning with our question and answering round, I request JD Daryani sir to kindly ask the questions. Dr. Daryani sir, am I audible? We will get back to Daryani sir. Till then, I request Dr. Nayak sir.
Yes, Dr. Himani, thank you very much for your nice presentation. Also, selection of the domain area, that study domain is also very good, and title is also very good according to PICO formula. I told after your predecessor presentation, PICO formula, this participants intervention, comparator, outcome criteria, all are fulfilled by your that good title. You have written aims, but you have written the heading is aims, but you have written only one aim. Better you correct it. It will write only aim, and you have written only one objective. Why one objective only? Because
Actually, no. Actually, sir, it's not a one objective. According to the format, I have reduced into one objective. I have, in my dissertation, I have created 4 objectives.
Very good, very good, very good. Because due to space constraints, it might have kept like this. Am I correct?
Yes, sir.
Okay, ठीक है.
Yes, sir.
Achha, the thing is, coming to methodology, you have divided into 3 groups. One is
4
group
groups.
is 4 groups. So Guteria, then Crataegus plus Guteria, and fourth one is
Control. That is our constitutional group.
achha, control is
Our constitutional medicine or individualized homeopathic medicine.
Achha, good, very good, very good. And you have shown that in the result you have shown that in some criteria there was improvement with Guteria, and in some criteria there was improvement with Crataegus, but there was marked improvement when Guteria was combined with Crataegus and given to the patients. Then in the
Yes.
control group you gave what?
In control group, there was improvement, but not that
No, in
significant compared to.
the control group, what you gave?
In control group, individualized homeopathic medicine based on
Sorry.
the.
So, by that means you are telling that in the control group where individual homeopathy medicine IHM was given, there was no such a significant improvement.
Yeah, because patient was not following lifestyle changes or anything. Just homeopathic medicine didn't give. In my study, I didn't see any specific or major changes in
Suniye,
potential.
Dr. Himani, please be very careful when you are concluding, when you are drawing at a conclusion. You are
No, I'm
telling
not drawing it.
I'm telling you, you are now telling that why there was some problem in the control group with individual homeopathy medicine. You are telling they were not following
That significant.
not following the guideline, your protocol guidelines or your instructions. That is another thing. But because they did not follow your guidelines, you cannot conclude that individual homeopathy medicine did not act properly.
No, I'm
Because
not saying that it didn't.
in most of the studies, individual homeopathy medicines acted far better than other specific medicines, or maybe some organopathic medicines, lesser known drugs, other things. They have worked far better than other groups. So please be very careful in writing about this. Then coming to discussion, you have written only discussion. In the presentation, you have written only discussion, but you are telling conclusion.
No, I have written discussion and conclusion both.
Achha, conclusion not visible to me. Conclusion is not visible to me. So there are 3 rules. There are 3 rules how to write a discussion. Please remember this also for other presenters, other people, audience also. Discussion should be written under 3 headings. One is discuss. Rule is there is a warning. Discuss your results. Do not repeat your results. Second is compare your findings with other findings on the similar area. Third thing is tell your limitations to the public. This is the rule for the writing discussion. Coming to conclusion, there are also 3 rules. First rule is write your conclusion very briefly in 1 or 2 lines. That is what is your take home message. What is your take home message from your study? Second guideline is how it is going to benefit the stakeholders. Stakeholders are 4 P. First P is policymakers. Second P is professionals. Third P is public. Fourth P is patients. So whatever research you do, the public should benefit out of that. And the last one for conclusion is what is your recommendation for your future researchers. So please follow when you write the manuscript. Please follow these guidelines how to write original research articles.
Okay, sir.
Okay, thank you very much for your nice presentation. All the best.
Dr. Daryani, sir, questions from your side, sir?
Almost whatever Dr. Naik has said or briefed, I endorse with the same. But only point is, hyperlipidemia is a lifestyle disorder.
Yes,
Until he will not improve the lifestyle, means following the diet regime and exercise, etc. The only medicine will not help. It is only conventional system of medicine which can make a control. But homeopathy, here she has, in results she has given that constitutional remedy is not so much effective in comparison to mother tinctures, Crataegus, and Goteria. It seems to be strange. very strange. Whether the something is missing or she is not able to explain. There are 4 groups. Number 1 on crataegus, number 2 second group 3, and third both mother tinctures, and last it is constitutional remedy. Now comparing the data or the results obtained according to her language, not satisfactory. Now, whether she is missing something, she is not able to explain, I doubt so. Now, can you explain?
Sir,
There are
you're
4
not
groups.
audible clear. Okay.
There are 4 groups according to your study.
Yes,
Result
sir.
has been, is it okay?
Yes, sir.
Is it okay now?
Yes, sir.
Now, my point is that your data, statics data are with 4 group, in 4 group. Number
Yes, sir.
1 group, mother tinctures, crataegus, and second is the
Good area.
mother
Third
tincture,
is
guttaria, and third is both the mother tinctures, and fourth is
control group.
control group. Now, which group is not giving results?
So all 4 group is giving result. I'm not saying ki, they are not giving result. I'm saying ki when I'm adding these mother tinctures to constitutional medicine, they are giving more result.
More results. What? Now, it means the constitutional remedy along with mother tinctures not this, are giving the good number of cases, I mean results, better results. This
Yes.
you want to say?
Yes, sir.
Okay. In spite of improving the lifestyle or controlling the diet or something else, or it was free from all the things?
Uh, in after altering lifestyle and diet and all, not just medication. After just changing the lifestyle, we were not getting that much result in constitutional group. But when we added mother tinctures, we were getting more result along with
Do
constitutional
you
medicine.
think the mother tinctures in long run will act?
No, I don't think so. They will act in long run. We will have to manage lifestyle and all. But I think they do help in short term management of cases.
Short-term management. This should be written in your observation and conclusion.
Okay,
Because
sir.
further suggestion which you want to convey the others or the
Okay.
profession, that longer period use of mother tinctures, ultimately it proves the symptoms,
Yes.
reprove. So we cannot, if at
Yes.
all it is necessary, we can give for a short period, then there should be a gap of 1 week or 10 days. And then
Yes, sir.
after, on the tapered doses, we have to reduce.
Okay, sir. I will mention in future.
Dr. Pandya sir.
Dr. Himani,
Yes,
your
sir.
topic is unique. I appreciate it. And to treat the dyslipidemia cases are very difficult if the lifestyle disorder has been persistent. And
Yes, sir.
you have told that in 4 groups, the result is remarkable as per the group is concerned. Then what is the uniqueness of your research?
So uniqueness of my research is that I can now tell categories work more on HDL parameters, good area works more on triglyceride parameters. While using both the medicine, we can overall manage the all over parameters of dyslipidemia. And for me, uniqueness of my study was that I can now know which medicine work on which parameter.
Are you telling that by add-on treatment, homeopathic plant extract, it will more effective if you prescribe only medicine. Am I correct?
No, no, I'm not saying it will be more, but it will be more targeted.
Then what is your comment in this regard?
I didn't understand your question, sir.
What is your comment? What is your suggestion that add-on of extract medicine should be given in each and every cases or not necessary?
Not necessary, only when it is really needed.
So as per the needed, we have to add on, otherwise not.
Yeah, if in only constitutional medicine is not able to manage it, then we should try add-on therapeutics of plant extract solution.
It depends on again the condition of the patient. Am I right?
Yes, yes, sir.
So everything should be mentioned precisely. What I am suggesting.
Okay, sir.
Okay, thank you, madam.
Very much right. Dr. Ponda is very much right.
Thank you, sir.
Thank you so much, Himani. Moving to our final presentation for PG category, Dr. Vidya Lakshmi Devi from Baxan Homeopathic Medical College. Vidya Lakshmi, are you ready?
Yes, ma'am. Yes, ma'am.
Kindly
I'm ready.
start.
Sorry for the inconvenience, sir. For jury members, to all. Good afternoon, respected organizer of the online national e-poster competition and the jury members of the competition. I, Hawam Vijayalakshmi Devi, Department of Homeopathic Pharmacy, Part 2, from Baxan Homeopathic Medical College and Hospital, Greater Noida. Today, I would like to present my presentation. The title of my presentation is Usefulness of the Homeopathic Medicine Phosphorus on the growth, yield, and the biochemical parameters of the okra plant affected with the lead toxicity. Under the guidance of and the supervision of Professor Dr. Meenakshi Ambawani. First of all, in the introduction, I would like to say is that okra, another name of the okra is also known as a ladyfinger. Okra is one of the important vegetable crop in India, and it has been called a perfect villager's vegetable because it is a good source of vitamin, dietary fibers, iron, proteins, and mineral. With a massive increase of industrialization and the increase of human activities, there has been observed in soil and the vegetables of accumulation of the heavy metals in the plant as well in the soil as well in the environment. So the main cause of the heavy metal, another type is lead toxicity. Lead toxicity is a type of the heavy metal which adversely affect the plant morphophysiological, biochemical process and the productivity. Phosphorus is a potentized homeopathic medicine is a cost-effective, environmental friendly means that it will increase the nutritive value and the productivity of the plant, hereby eliminating the harmful effect of the lead toxicity in the okra. My objective is that to study the usefulness of the different potencies of the homeopathic medicine phosphorus on the growth, yield, and biochemical parameters by reducing the toxic effect of lead in the okra plant. For the methodology, first of all, my study setup has been done in the Sarda University Agriculture, which is situated in the Greater Noida, which has been signed MOU with the Baxan Homeopathy Medical College. First of all, the soil has been tested in the for which I am going to use the soil and has been reported, and the soil that has been found is below the is a normal limit with the lead toxicity which I want to induce it. The lead toxicity which I have found in the soil sample is that 0.28, which is a normal limit, but for the study which I want is that lead toxicity, if effective want to see is that I have to induce the lead toxicity in the plant. For this, I have divided into by seeing on the flow chart. Okra seed has been divided into two groups. That is, number one is intervention group, and the number two is a control group. In the intervention group, I have divided the method of applying of medicine into two types. Number one is a soil drenching, and the number two is a foliar spray. In the soil drenching group, I have used phosphorus 6C replica of three groups, and the phosphorus 9C and phosphorus 18C, phosphorus 30C, and the phosphorus 200C of this group, with the replica of is in the soil drenching group. And the foliar spray also, I have also used phosphorus 6C, phosphorus 9C, phosphorus 18C, phosphorus 30C, and the phosphorus 200C with replica of its potency of the in the foliar spray group. For the control group, I have used normal soil, which has been water. For the normal, it has been given into a tree replica, and the soil, and another is that lead toxicity, which has been given only normal water, which has also been replica into tree. And the another is that lead toxicity soil is induced, and into it alcohol has been given by the method of the soil drenching in the tree groups, and the lead toxicity alcohol, which has been given by the foliar spray in tree replica. In this way, I have divided my two groups in the intervention group and in the control group. For the soil drenching group, I have given my medicine by only through by into the soil. For the soil for the foliar spray group, my medicine has been given only into the leaves by spraying into it. For the data collection, on the 40 day after the germination of the growth and the 65 day after the germination of the okra plant, of the growth parameters, that is the shoot length and the length of the internode, was collected. And the yield parameter, that is a weight and the length of the pot, were collected and the measures during the harvesting. And the biochemical parameters, that is chlorophyll A, chlorophyll B, and the total chlorophyll, were analyzed using the spectrophotometry technique. Observation and the result in the growth parameter, especially the phosphorus 200C foliar spray and the phosphorus 18C soil drenching, has the intervention has the most effective treatment in the shoot length and the length of the internode. In the yield, length of the pot was found maximum both in the phosphorus 200C soil drenching and the foliar spray, but in weight of the pot, phosphorus 30C soil drenching and the phosphorus 200C foliar spray was found highest in production. In the biochemical parameters, chlorophyll A found in the phosphorus 18C soil drenching and the phosphorus 18C foliar spray. In chlorophyll B, phosphorus 30C soil drenching, and in foliar spray, phosphorus 200C was found highest. In the total chlorophyll was found highest in the phosphorus 9C soil drenching and the phosphorus 9C foliar spray. And the data was analyzed by statistical analysis by using ANOVA, and the result was found to be significant. And these are the graph that has been found by interpretation. And I would like to conclude is that the application of the potentized homeopathic medicine phosphorus and its different potency has shown a beneficial result in the growth, yield, and the biochemical parameters, and the lead toxicity in the okra plant. Therefore, this study demonstrates the efficacy of the homeopathic medicine in agriculture will be a cost-effective, environmental-friendly substitute that help in increasing the productivity and the nutritive value, hereby eliminating the harmful effect of the conventional fertilizer. And in the upper right corner, these are the pictorial picture that has been used during my which has been clicked in during my study process. The first picture which I have shown is that this is the during the soil sampling collection. The soil has been collected and it has been divided for the sampling analysis, and it has been grind, then it has been measured, and the pH of the meter is of the soil has been measured it. And my study of the okra plant has been planted in a pot. So my pot also has been sterilized through it before the plantation of the when I saw the seed, the lead toxicity after the 30 day of the germination, lead toxicity has been induced into the plant. And these are the measurement has been taken into the small packets of the lead toxicity of each plant to be used has been picture has been given into it. And our homeopathic medicine phosphorus 9C and 18C has been prepared in our pharmacy laboratory from the 6C potency. And for the spectrophotometric technique, the chlorophyll A, B, and C total has been calculated by the spectrophotometry by using Aaron's formula. And these are the results of which has been collected in the for the growth and the length of the
Vidya
picture of
Lakshmi,
the
I
crop.
request you to kindly conclude in 5 seconds.
Okay, ma'am. I am finished, ma'am.
Okay.
Thank you, ma'am.
Thank you. We will be beginning with a question and answer round. I request Dr. Jaideep Daryani, sir.
No doubt it is again related with agro.
Yes,
And
sir.
both are on the same pattern. Here it is phosphorus, and earlier it was natrum mure and silicea. Am I
Yes, sir.
correct?
Yes, sir. Yes,
Ah,
sir.
okay. But there is a difference between two.
Sir,
She was
in my
going very
yes, sir.
2 minutes, 2 minutes, sir, to explain it completely. Finished it. पहले इसको 2 मिनट अलग से दे दें ताकि फिनिश कर ले, अदरवाइज बीच में इसको जरा वो लगेगा, क्योंकि पैरेलली एग्रो के 3 हो गए.
2 minutes. Okay, sir. Kindly conclude your presentation, Vidya Lakshmi.
Ma'am, my presentation has been finished. It has been concluded, ma'am. The result of the picture has been set, ma'am. It has been finished, ma'am.
Okay, sir. Back to Daryani, sir.
Thank you. Thank you, Dr. Nayak. Dr. Nayak, sir.
Yes, Dr. Daryanis ji, he has rightly pointed out that how this study is different from the previous study where 2 other interventions were used, like natramur and silicea. Otherwise, both the studies have many similar objectives and parameters. And here, can you please tell me, Dr. Vidyalakshmi, what is the common name of okra plant?
Sir, the common name of the okra plant is Albomensis esculentus M. moist, sir.
No, common name. I'm asking of common name, not scientific name.
Okay, ladyfinger, sir, okra.
Oh, lady's finger.
Yes, sir. It is a
Okay.
ladyfinger plant, sir.
Achha, from which part of the plant it is prepared? The medicine is prepared?
Bhindi.
Bhindi, sir.
Right. Okay, good. Bhindi. Then you have done the good thing that intervention you have divided into how many groups? One is soil drenching, the spray, then?
Then another is a foliar spray in the intervention group, sir.
Right. Then how this lead toxicity was induced, can you tell? How this was
Well,
in the soil?
my lead toxicity has been first of all, by doing the research study from the agriculture, I have found that lead toxicity can be induced into the soil by mixing by lead toxicity powder has been brought from the market, and the amount which I want to make the lead toxicity to be induced, which has been measured, and then by mixing into the water, I have been poured into the surrounding of the plant that it has been induced it, and wait for 10 days to make the to see the effect of the plant, sir.
Now, who guided you to decide the quantity of lead in the water solvent in the solvent?
Okay,
Who
sir.
guided you? Who guided you?
Sir, in my study, our Baxen Homeopathy Medical College has MOU signed with the Agriculture University, which is Harda University. Here I have got another co-guide, sir, which is a agriculture sir, who have guided me in my study, sir.
Very good, very good. What was the result from phosphorus sixth potency?
Sir, in the phosphorus 6C potency, the potency which has been not, but in the different potency of the phosphorus 18C, 200C, and the 13C, which I have found the result, sir.
Okay. So you have given the heading in the presentation, you have in the poster, you have given the heading data collection only. But actually that should be data collection and data analysis, because you have included data analysis also there. So it should be
Okay.
data collection, data analysis. And there is very minor thing I'm telling you, because I am very much careful about writing. So your heading is only observation and result. It should be observations and results. It is not such. It is not a very much gross error, but minor thing. But it must be, because you are a good scholar. You are a good scholar. I have all weakness for good people, and you are one of the good student scholar. Please be careful about the language also. If your language is not good, it will be rejected. The article you are sending to some journals, they will be not sent for review unless the editorial board. There is a review process. There is a review that is called peer review process. When an author sends an article to editor, there is an internal review by editorial team, and if they find some prima facie in the article, they only send to the reviewers for their comments.
Yes, sir.
So if you have some gross mistakes in the title, or you have not maintained not followed the structure of the article as per the guideline of their journal, then they will not accept it. So be careful about the whenever you send it. My request to you, not instruction, my request to you, that whenever you send this article to any journal, please go through their website.
Okay, sir.
And read the guidelines to the authors, and the articles must follow the guidelines of the authors. Sorry, guidelines for the authors, you have to your article must follow. Otherwise, they will not accept. For example, the reference style, whatever you follow, there are so many reference styles, like Harvard style, MPA style, sorry, MLA style, Vancouver style, Chicago style, APA style. So many styles are there. So you have to, whatever style they follow, you have to adopt. They means
Yes,
the
sir.
journal follow. You have to go through their website. These are some of the suggestions how to improve the quality of articles in future. Thank you
Okay,
so
sir.
much. Thank you so much. All the best.
Thank you so much, sir.
Thank you, sir. BP Panda, sir, questions from your side, sir.
Dr. Vidyalakshmi,
Yes, sir.
my question is, why you choose phosphorus?
Sir, first of all, for the mitigation of the lead toxicity, which I found in the Google Scholar, also in the agriculture article point of view, I have followed in the different agriculture article also, there have been said that phosphorus is the only that can be mitigated in the lead toxicity. So by in our agriculture agro homeopathy, phosphorus has not been used. So I want to see that by inspiring from the thought of the agriculture, I want to see that our homeopathic phosphorus can be mitigate the effect of the lead toxicity in the okra plant, sir. And also another has been agriculture book by a Kabiraj that has been said that in the book for homeopathy for the farm and the garden there has been mentioned that for especially for the lead toxicity phosphorus has been said that it is a master key to the agriculture. It helps in the growth of the flower fruiting and is as well as the growth of the fruiting time also. It helps to manage the it helps in the productivity of the maximum production. So phosphorus is the only that helps to mitigate the lead toxicity.
Very good. I appreciate your efforts.
Very good, very good, very good, very good.
Again, I want to ask
knowledgeable.
you.
She's quite knowledgeable.
Yes, yes. Again, I want to ask you that how many plants you took for your research purpose?
Sir, I have took total of 42 plants of which from the intervention group, from the soil drenching group, I have took 15 plants from the soilers, from the foliar spray. I have took 15 plants. For the control group, I have took 12 plants. For the total number of plants I took is a 42 plants, sir.
So you have told that you have gone through the book of Kaviraj, and in
Yes, sir.
Kaviraj, he has also mentioned the treatment of wilt disease in case of tomato.
Yes, sir. Yes.
Have you gone through that?
Sir, I just read about the diseases, but I haven't read about the particular wilt disease. But I was for my study, I was only searching at the time for the lead toxicity. So I found the phosphorus is the most effective of the for the lead toxicity, sir.
Have you published this article of this research?
No.
No, sir. I haven't published it. It is under the my dissertation has been given into the university, but it has been not approved yet. I am waiting for it, but I am on the way for the writing on the research article of my this dissertation topic, and under the guidance of my guide, it is on the process, sir.
All the best, madam. Thank you.
So one thing, Doctor Dr. Vidyalakshmi,
Yes,
when
sir.
you convert your dissertation to research paper, you request
Yes,
your
sir.
HOD or your PG guide to take a
Yes, sir.
class. There are some rules, international guidelines, how to convert a dissertation to a research paper. One author is Dr. Ananta Krishnan from JIPMER, South India. He has published in a book, which is a very good book, and there one chapter is on how to convert a PG dissertation to research paper. Another article I have also written how to convert a research paper into an article. Sorry, how to convert a thesis dissertation to an article. This was published in Homeopathy Links. So if you like, I can share you both the articles to you and tell your teachers to take a class how to convert dissertation to research papers. So this is a very good discussion how to convert that. Thank you very much.
Thank you so much, sir.
Thank you so much, Vidya Lakshmi.
Thank you, ma'am.
With this, we have concluded the presentations of all our 7 presenters from PG category. Thank you, presenters, for your incredible poster presentation. Now, let us hear from our esteemed panel of judges. I request Dr. J.D. Daryani, sir, to share valuable insights with us.
Thank you very much for inviting me and giving me an opportunity for this kind of work. Of course, during my teaching tenure, I mean, almost 36 years in my teaching career, I have never seen this type of competition. This is the first. Of course, others will learn something and they will come forward, but it is a Herculean job. Whosoever it may be, I mean, the principal or coordinator, or rather, I can say the management, and also students, they have done their best. They have done their best. They need a big applause big flaws. Now, this is nothing but to develop the research aptitude. Research aptitude. Now, these days, research is must, and research that too evidence-based. So they will learn something, they will gain something, and in future they will earn. They will earn. Here, learn, and there earn. Anyway, thank you to all participants, and thank you to Principal Yogeshwari ma'am. The coordinator, I think, is Dr. Sarkar, so he is the coordinator. Dr. Pankaj Sharma, Dr. Shekhar, Dr. Agarwal, all the team of Swasthya Kalyan, they have created an example. Really, it's an example for future, and rather others will also follow the same. Thank you very much.
Please unmute. Madam, please unmute.
Thank you so much, sir. Now I request Dr. C.B. Naik, sir, to share your valuable perspective on overall quality of posters and any suggestions for participants.
I think my predecessor, Dr. Daryaniji, has covered the central core of the entire thing, entire drama of today's drama. So I will simply add something. Now I must compliment the college. So far I know about the college. I am thoroughly convinced. I'm thoroughly acquainted with the campus also. I was invited as guest lecturer to that campus number of times when I was the vice chancellor of Homeopathy University. I must compliment the college and administration as a whole for three things. One is I know they are publishing a journal regularly. Second thing, where I am a reviewer. Second thing, they are also conducting CME programs periodically, taking grants from the Ministry of Ayush through Rashtriya Ayurved Vidyapit. Third thing, this is the unique type of program they have conducted today. What Dr. Doryaniji told, it should be an example for all other colleges to follow. Now I'm coming to principal. Madam, particularly some suggestions to the principal to upload these all presentations in their website. Number one. Number two, to communicate to all colleges. There are all these abstracts, all slides to communicate to these presentations or these poster presentations to communicate to all the principals of all colleges. Then to encourage all the PG students to actively participate in future programs. Then another important thing for the college, which will beneficial for the college and for the PG students, there is a grant given by the CCRH, that is called STS, one grant for STSH for promoting research for undergraduate students and for evaluating for quality dissertation. They are also giving some grants. So here I will request the principal to encourage all the PG students to send their dissertations to the CCRH for granting some grants, for obtaining some grants. So by this, both way, the whenever, and another thing is, whatever presentation they have made today, they must immediately transform into manuscripts and get it thoroughly revised by the experts, and to send only to the peer-reviewed journals with a good impact factor. So these are my suggestions, and again I'm thankful to all that organizer, particularly the principal, to invite me. And now please don't record it from I'm telling out of a joke, out of satire, that now it is time to go for lunch. So we are all hungry men, and all hungry men are angry men. So please don't face the angry men in future. Sir, more, please allow us to leave the program. This is not to be recorded. This is not recorded. Not to be recorded in a lighter vein. I told only.
So we are streaming live.
So sending by courier. Please send by courier.
Okay, sir. Thank you so much, sir. Now I request Dr. B.P. Panda, sir, to share his years of experience and feedback.
I heartily appreciate the efforts of Swasthya Kalyan management Principal Madam, Pankaj Sharma sir, to whom always I pay respect from bottom of my heart. I feel proud that I could able to listen different guidelines from my teachers, Nayak sir and Daryani sir. And this is an innovative idea. That idea should be continue in different form by which the research initiative, the research passion should be created in the mind of the young homeopaths. That's enough, and everything has been mentioned by my gurus. Thank you very much.
Dr. Panda, please take up this program in your college very recently.
Yes, sir.
In the next month, if possible.
Yes, sir. Yes, sir.
And please don't forget to invite me.
It is my pleasure, sir.
Okay, thank you.
Okay, thank you.
Thank you so much, sir. Now I request Dr. Tanuj Rajvanshi, sir, Vice Principal, Swasthya Kalyan Homeopathic Medical College, to address us all.
Hello.
Good afternoon, everyone.
Result. Out of 10.
Thanks to all.
I had
Thanks
forgotten.
to all our esteemed judges for giving your valuable time and especially your expertise guidance to the all youngsters. Thank you so much, sir. To all the judges, Dr. Daryani sir, Dr. Nayak sir, Dr. Panda sir, for PG, and Dr. Sani sir, and Dr. Renu Mittal ma'am for, and Dr. B.T. Rai for the UG. All the participants, thank you. All are winners because we have already shortlisted you. So for us, all are winners. Congratulations, although who will win the prizes. Thanks to our management, Dr. Sarvesh Agarwal and Shraddha Agarwal ma'am, for giving the permission to organizing, and Dr. Pankaj Sharma sir and Dr. Yogeshwari Gupta ma'am, principal ma'am. Special thanks to our organizing committee, Dr. Sarupanand Sarkar and Dr. Kanika Agarwal. Thanks to all.
Thank you so much, sir. We will be shortly sharing your results with you all. Hoping the advice shared at the platform will be helpful to us all. We are compiling the results from our side. Hope all the judges have shared with us their analysis sheet so that we can quickly compile our results. I request all judges to kindly share with us the result sheets. Now I request Dr. Pankaj Sharma sir to kindly address us all and declare the results for the day, the moment we have all been waiting for. Dr. Pankaj sir, over to you, sir. Dr. Pankaj sir. Sir is creating suspense before the declaration of results. That pause before the final moment.
उनको सर अनम्यूट करिए प्लीज.
Sir, kindly unmute.
हाँ. इले पांचटा को चालू करो.
Hello. Hello.
Yes, sir, you are audible.
Audible. Thank you very much, sir. Thank you very much, Dr. चतुर्वेद नायक जी सर. सर, आपने जो टाइम दिया, आपके साथ जो मैंने जिंदगी के अंदर टाइम बिताया, हम स्वास्थ्य कल्याण होम्योपैथिक मेडिकल कॉलेज की तरफ से हम आपका बहुत बहुत शुक्रगुजार हैं सर. डॉक्टर जेडी दरियानी सर, जो कि मेरे प्रिंसिपल रहे हैं, मेरा गाइडलाइन रहे हैं, हमेशा हमेशा मेरे को जिंदगी पर उन्होंने हर जगह पर संभाला है। मैं उनका भी बहुत बहुत शुक्रगुजार हूँ। डॉक्टर पांडा जी का तो मतलब उन्होंने राजस्थान में आकर के नींव गाड़ करके और वापस चले गए, ये हमने बहुत मिस किया। डॉक्टर योगेश्वर गुप्ता जी ने ये किया सर। अभी इससे पहले जो सेशन हुआ था सर यूजी का, तो मेरे को कहा गया है कि उसके अंदर सारे जजेस के रिजल्ट यूजी के आ गए हैं सर। तो उस रिजल्ट के अंदर उनको अनाउंस करते हुए प्राउड हो रहा है कि हिंदुस्तान की पहली कॉन्फ्रेंस में जितने इतने डायनेमिक मतलब जजेस थे, जिन्होंने अपना अपना असेसमेंट दिया है। ये सारे अपने जितने भी पार्टिसिपेंट थे, सारे पार्टिसिपेंट्स ऐसे थे जिनको की मना करना बहुत कम था और बहुत क्लोज कंटेस्ट था। लेकिन हमको जो अनाउंस किया था, अनाउंस उसका प्राइस था, उसके अनाउंस जो मेरे को लिस्ट की गई है, मैं परमिशन ऑफ द प्रिंसिपल्स वगैरह और जजेस की प्रिंसिपल से इजाजत से मैं बोल रहा हूँ। थर्ड पोजीशन यूजी कैटेगरी के अंदर अर्पी होटल बारोद, ये है धांधु मामा साथे होम्योपैथिक मेडिकल कॉलेज पूना। थर्ड थर्ड प्राइज गया है इनको। और सेकंड प्राइज गया है मिस्टर सबरीनी सुमालिया, सबरीनी सुमालिया फ्रॉम अनबिटवीलेस होम्योपैथिक मेडिकल कॉलेज पोरोर चेन्नई। एंड फर्स्ट पोजीशन स्वरांजलि बापू सूर्यवंशी फ्रॉम द गुलाबराव पाटिल होम्योपैथिक मेडिकल कॉलेज महाराष्ट्र। ये तीनों यूजी कैटेगरी के प्राइजेस थे जो कि उसमें गए सर। है हमारा पहला प्रयास था और बहुत अच्छा है, बहुत खुशी की बात है। इन सबको मैं बहुत बहुत बधाई देता हूँ और इनको एक थोड़ी सी रिक्वेस्ट करूंगा कि आप लोग सब अपना जो एक तो बैंक डिटेल और एक कैंसिल चेक की फोटोग्राफी मेल पे रिप्लाई करने के लिए जो कि जो आपको दी गई है और सिर्फ उसी के ऊपर करें, उसके अलावा नहीं। और कांटेक्ट में रहें ऑर्गेनाइजर के, तभी वो आपको सब कुछ हो पाएगा। तो थैंक यू वेरी मच सर, थैंक यू वेरी मच। अभी मैं पीजी का भी आपको 1 मिनट के अंदर बताता हूँ। जैसे आ जाता है हमारे जीजीएच का असेसमेंट, तो यूजी के लिए तो मैं इन सभी को बधाई देना चाहता हूँ सर। तो इसमें तो दो तो महाराष्ट्र के और एक चेन्नई का है। थर्ड प्राइज महाराष्ट्र को गया, सेकंड चेन्नई और फर्स्ट प्राइज फिर महाराष्ट्र। तो इन सबको बहुत बहुत बधाई देता हूँ सर। और मैं हम कोशिश करेंगे सर इसको रूटीन के अंदर लाने के लिए। थैंक यू सर, थैंक यू वेरी मच। आप अनम्यूट कीजिए मैडम, अनम्यूट कीजिए, पहले अनम्यूट कीजिए।
Sir, I think I'm audible now.
Yeah, no.
Congratulations all the winners of UG category. Swaranjali for winning the first prize, Sabreen for winning the second prize, and Arpi for winning the third prize. I would like to tell all the participants and viewers all across the nation who are watching us on YouTube that selecting winners from such a pool of talent was not an easy task. Each poster presented unique insights and innovative approaches to their respective topics. While only few can be recognized with awards, I want to emphasize that every participant has showcased exceptional work. Your skills and knowledge have been commendable and undoubtedly contributed for the field of homeopathy. Congratulations for all the UG winners. Our team is
Thank you,
still
ma'am.
on to compiling the results of the PG category. I request all the participants to kindly join us with your video cameras for the declaration of the result of PG category. We have with us the results of a PG category. I request you all to kindly open your videos, cameras. For third prize, we have Dr. Snehal Moore from Dhonduram Sarthe Homeopathic Medical College, Pune, Maharashtra. Congratulations, Snehal. For second prize, we have Bhairvi Jadhav from ML Dhavle Memorial Homeopathic Institute, Palghar. Congratulations, Bhairvi. And finally,
Thank you.
for the first prize, we have Dr. Himani Shah from Dr. MPK Homeopathic Medical College and Research Center.
Thank you.
Congratulations, Dr. Himani.
Thank
There has
you.
been a very short gap between all the winners. And it was very difficult to compile the results. Congratulations to all the winners.
Now, who got second prize? Who got second prize?
So, second prize we have Bhairvi Jadhav from
Pardon?
ML Dhavle.
Yeah, what is the
On
name?
the top, Bhairvi Jadhav, sir. Scope
Bhairvi.
of Raga therapy and individualized homeopathic treatment in management of emotional disturbances. I will again be telling the results of the PG category. Third prize, we have Dr. Snehal Moore. For the second prize, we have Bhairvi Jadhav. And for the first prize, Dr. Himani Shah.
Thank you.
Congratulations to all the winners and participants. I request all the winners to kindly share your bank details with also a cancelled checks. A huge round of applause for all our winners. Congratulations to all.
Thank you so much.
Thank you all.
With this, we will be concluding our session for today. Thank you, judges, for your commitment and your valuable time. Thank you, all the participants.
Can you leave now?
Yes, sir, definitely. We will be closing the meeting for
Because
today.
I'm feeling hungry.
Yes, sir. I am also feeling hypoglycemic now.
Thank you so much. Thank you so much, sir. Thank you so much, sir. And JD sir. Thank you, sir.
Thank you so much.